Hello, everyone. Happy afternoon. A very good afternoon. I hope and I believe you are doing well. A quick note, everyone. Am I audible and visible, everyone? Rather, the stress and anxiety is more post exam, because every question that you have marked, you try to recall that, you don't even remember what exactly is the answer that you marked. But guys, one thing that I would like to tell is, whatever has been done, it's done and dusted. Nothing can be changed, so do not fret a lot about it. These recall sessions are not to give you that worry and anxiety, right? It's just a learning lesson, for the future exams. If you're at all, I'm sure all of you would be appearing for NEET PG as well. That's not very far. So it's just a learning lesson that what kind of questions have been asked, how's the trend, the pattern of the questions that have been asked. Yes? Is this a... Yes. So the overall difficulty of the exam seems to be on the tougher side. And the reviews that we have got, biochemistry, there was a lot of biochemistry in the exam today. And yes, see, after every exam, there are going to be mixed reviews. Some students would say that the paper was on easy side. Some students would say it is on the difficult side. So basically, yes, it depends on the preparation level as well, or how did you combat that exam in the exam hall. So, jaisa bhi tha, jo bhi tha, it's done and dusted. So let's move on to the radiology questions that we are going to discuss in this session without taking much of your time. Right. See, when the results would come, you would get to know that there are students who have scored really good as well. So उनके लिए वो paper easy था. ठीक है, कोई बात नहीं. We still have NEET PG coming up, guys. So let's not worry about it. It's absolutely fine. We gave our best shot, and that's more than enough. So I would really need your inputs on the questions that we are discussing. Please let me know if the question was framed in a different way, the image was different, or the options were different. Right? All right. So the first question here, an ultrasound image of the right iliac fossa was given, and you were asked the most appropriate next step in management. So if this was the same image that was given, okay, thank you so much, PSS 162, for adding in the last option, that is USD guided drainage. USD guided drainage was the fourth option that was given. Thank you, Surya Putri. Okay, so 48 hours pain history was also given in the question. So that adds on to the history. So after 48 hours, this patient has come for ultrasound and the ultrasound has been done. So see, even if the image looks difficult, you are not able to make out from the image, look at the history. Right iliac fossa pain after 48 hours, and what would you think of is an appendicular lump, right? So you see this peripheral vascularity वाला एक ऐसा hypoechoic mass जैसा दिख रहा है with peripheral vascularity. You are thinking of appendicular lump. So basically, this question is based on appendicular lump, is what I can sense here. And for appendicular lump, basically you do not go for surgery. Right, interval appendicectomy is done. You do not go for immediate surgery there. USD guided drainage or USD guided FNAC was there. Okay, okay, within 48 hours. Okay. So according to me, the best answer that I would go for is going to be CECT, basically for a detailed evaluation of the appendicular lump. Remember, when you are doing ultrasound, the bowel air will restrict the visualization that you have in ultrasound. So that is why CECT, for detailed evaluation, to see that whether there is any liquefied abscess component, that drainage can be done, how much is the exact extent of the lesion. All of this can be evaluated well on CECT. So the next step in management here is going to be CECT. Okay? Is this clear with everyone? Yes? See, whether it is within 48 hours or after 48 hours. CECT would help in a detailed evaluation, the exact size and everything. So the next step in management, even if it has to be drainage, it will come after the detailed evaluation on CECT. So personally, the next step in management, I would go for CECT for that. Okay. Going on to the next question. So this was a patient with HIV infection, CD count of 40, and I don't know whether image was given or not given here. Image was given or not given here. So there is this ring enhancing lesion which is present in an HIV positive patient that you are seeing here. So yeah, that is what was the question. I think many of you had said that there was no image given for this question. Just that the question mentioned there is ring enhancing lesion. Was it single ring enhancing lesion or multiple ring enhancing lesion? Anything mentioned? So very good. If it was mentioned, there are multiple ring enhancing lesions mentioned. So we would go for cerebral toxoplasmosis. Remember, primary CNS lymphoma in an immunocompromised patient like HIV positive, even that can present as ring enhancing lesion, but generally that is a solitary lesion. Since the lesions are multiple here, CD4 count is 40, so you start thinking of opportunistic infection. It could be lymphoma, it could be toxo, but multiple here, so you would go for cerebral toxoplasmosis is what you would go here for. Okay, was basal ganglia also mentioned? So many of you are saying, Shovan is saying that, very good. It adds on more to the diagnosis of toxoplasmosis if basal ganglia was also mentioned. PMLE was there in the option, then what was not there in the option out of these 4 options? Yes? Neurocysticercosis was not there, rather there was PMLE that was mentioned in the question. Okay, so the answer here would be cerebral toxoplasmosis. Going on to the next one, which is basically an orthopedics wala question. So which of the clinical findings is most likely present in this patient? Now, in these questions, remember when the image is difficult, look at the options and retrospectively look at the image. So what is the Thompson test for? Thompson test is for Achilles tendon rupture. Thompson test is for Achilles tendon rupture, particularly complete rupture. So then you look for, is there anything in the Achilles tendon that you are seeing? There is that abnormal signal that you are seeing, the tear which is there. So yes, the image is showing that. Anterior draw test is for ACL. That's going to be knee. This is not the knee ka image. Okay. Again, McMurray's test is for the medial meniscus. Again, for the knee. So automatically you rule out these options. Options change. Okay. मुझे नहीं पता ये recall मुझे दिया गया. So please let me know what were the options and what was the question. Okay. So the options were basically for treatment or management. So I think orthopedics wale hamare faculty will take up the question for the management. But what I can tell you is the diagnosis here is going to be the diagnosis. If this was the image, then Thompson test positive Achilles tendon rupture is what you have to learn from me in this session. Yes, steroid injection was there. So basically the management was asked, steroid injection. Okay, the question was basically on the next step. Okay, so will be discussed in orthopedics, I believe. Plaster cast treatment was another option. Somebody saying plaster cast treatment. Okay, and the third option was Thompson test positive. This was okay, going on to the next question. A patient presents, was this a question and were these options? Acute left flank pain. So what is the most appropriate imaging investigation? If this was the question and these were the options, acute left flank pain. So again, you are thinking of the urinary tract calculus, right? Very important, very frequently asked urinary tract calculus ke liye, the NCCT is what is the gold standard because it helps you see the small calculi also. On ultrasound, seeing urinary calculus is different. Plain radiograph does not have a much of a yield now, right? It will not help you have a look at the radiolucent calculi as well. So if this was the question exactly and these were the options, then you will go for NCCT abdomen. Patient was 40-year-old female with left flank pain. So NCCT abdomen is what you will go for. Only NCCT wasn't there in the option then? Okay, NCCT followed by CECT was one option. USD followed by CT was an option. NCCT followed by CECT was an option. Okay, so if these were the options like this, there were no option which was saying that only NCCT, then the better answer to go for, you can go for USD followed by CT. Okay, it all depends on how were the options framed, right? That decides your answer in multiple choice questions. So if agar single option wala nahi tha, NCCT sirf nahi tha, then go for USD followed by CT. Going to the next one was that this was multiple options correct wala question. Based on gadolinium based contrast can be safely administered in which of the following conditions? So there is this ACR guidelines for the gadolinium contrast to be administered. Was there any option which was breastfeeding or pregnancy? Breastfeeding या pregnancy वाला कोई option था इसमें, or are all the options correct? Okay, GFR more than 50 tha, less than 59. Then that becomes easy. Yes. ACR class 2 contrast के लिए पूछा था, gadolinium based contrast. GBCA class 2 contrast. Okay. So remember that the gadolinium based contrast agents, GBCAs, they are divided into classes based on their risk for nephrogenic systemic fibrosis. Out of that, class 2 agents are the ones which are the safest and which have the lowest risk of nephrogenic systemic fibrosis. So that is why, remember that when you are giving these agents, because they are safe. So even if you have a 50-year-old, with a good GFR, less than 50 tha, more than 50 tha, kya tha? Yes? Less than 50. Okay, I'll stick to it. So, I don't know what were the exact multiple options correct में क्या क्या options से grouping किया हुआ था. The learning lesson here is for the ACR guidelines say that if it's an elderly patient, particularly more than 60, there's history of diabetes, right? Basically, where there's a risk of a renal disease. There, you definitely need to check the eGFR, and the eGFR, if it is less than 30, or if there is AKI, you are not supposed to give these agents. Otherwise, you can give these agents. If it is an elderly patient more than 60 years, you need to definitely have eGFR calculated, the renal function test calculated. So if it's a 30-year-old with no RFT, 30-year-old में उतना risk नहीं है of a renal disease, no comorbidities, you can give the contrast agent. 60-year-old with renal function not known, an elderly patient has more risk of renal disease, you will not give the contrast. Child with normal renal function, you can give the contrast there as well. Yes? Is this clear with everyone? So less than 30 में, it is definitely not given. ठीक है? Less than 30 AKI नहीं होना चाहिए. Pregnancy में, if you think that MRI, the contrast is absolutely necessary, the potential benefit is more, then you can give. Even in breastfeeding, you can give the contrast because they say that the excretion of the contrast in breast milk is very less. And even if some amount is going into the breast milk, the absorption from the infant gut is very, very less. So breastfeeding वाले में भी हम दे सकते हैं. ACR says that you need not stop breastfeeding, but if the female has that fear, then she can stop for 12 hours. Otherwise, no risk of stopping the breastfeeding. ठीक है? So definitely इसमें तो हम देंगे और इसमें भी हम देंगे अगर दो options थे तो. ठीक है? All right. Going to the next one, was this the question there? Which of the following investigation is approved in a child of age 12 with upper respiratory infection? Yes. In a child with upper respiratory infection, remember there is no need of any radiological investigation because upper respiratory infection, generally it's a viral infection. Radiological imaging does not change the management. Following the ELARA principle, as low as reasonably achievable, do not give unnecessary radiation, especially in children. So there's no need of any radiological investigation if it is just an upper respiratory infection. So there is no need of radiological investigation is what is going to be the correct answer here. Is this clear with everyone? Yes, so no need of radiological investigation. So these are the recalls that we have got for radiology questions, guys. If there are any other questions that you remember, you can let us know, right? You can DM me as well, or on the Insta page, you can DM me, or on PrepLadder Med Instagram page is where you can DM us. नहीं, mandated कुछ भी नहीं करना होता है. upper respiratory infection में कोई radiological investigation नहीं चाहिए. Right? It is not helping in any way if it is just an upper respiratory infection. Why are we giving gadolinium enhancement in child with normal RFT? Wherever you need a contrast agent. Contrast agents help us to evaluate the lesion, the pathology better, right? So in a child, you can give gadolinium contrast as well. Okay? Right. We will take on all the inputs, guys, that we get from you. That's the very basis of having these sessions as well, so that we get inputs from you, right? Without taking much of your time, we'll have the next subject coming up for your recalls, right? We'll not take much of your time in recalls because I know that how impatient you guys are. Yes? Yes, I think even if there was a question on Pott's spine, I have not received any on that. If that was the case, I think that would be discussed in orthopedics, right? Radiology is basically overlap with a lot of other subjects. So जो questions अगर होंगे भी तो बाकी subjects में भी discuss हो ही जाएंगे. If there was no dedicated question on nuclear medicine, radiotherapy, or general the basics of radiology. ठीक है? All right, guys, all the best for your results. Again, do not worry much, however the paper has been. You do have next very important opportunity coming up, that is NEET PG 2026. So move on to that. Today, just you can passively listen to the recalls, help us in getting the exact recalls. And from tomorrow, you can move on to the next PG 2026, right? All the best. Thank you so much, everyone. That was a quick radiology recall from my end. And I'll see you again, post results with the good results. Thank you so much.
Ready? Chakshit, we are good to go. Afternoon and welcome to this recall session. So, how were dermatology questions? So, I think they were pretty easy. Most of them we had covered. So let's see. So, dear students, this is just a recall session. So I may not have the exact question, exact options, exact images, and I may be missing out on few questions. So that is why this recall session helped me out so that we can formulate the correct questions at the end of the session. Don't judge yourself. Don't mark yourself. I'm sure you did very well in the exam. And now this is no testing time. It's just a relaxing time and discussion time. Right? Yes, derma was easy. I feel so too. And that means you had read dermatology well. So, this is the first question that I have. Match the clinical signs in column A with most appropriate condition in column B. So, let's see. So, very easy. Positive Nikolsky sign. We have studied repeatedly Minar. It is there in Pemphigus vulgaris. Where do you see pseudo-Nikolsky? Pseudo-Nikolsky you see in Steven Johnson syndrome or 10. It is called pseudo because there is necrosis of of keratinocytes and apoptosis, which causes the sharing away or peeling away of the skin, and not the antigen antibody deposition. False Nikolsky is seen with bullous pemphigoid because why false? Because subepidermal disorders ideally do not show Nikolsky sign, but sometimes they may be positive, and that's called as false Nikolsky sign. Cerebriform tongue is something that we see with pemphigus vegetans, which is a variant in which you see a vegetative lesions in the flexures and cerebriform tongue. So first three options I would say is quite easy. Cerebriform tongue I would say is a little difficult, but if you had figured out the first three, which we had discussed earlier also, I'm sure you would have done it right. So in the options that I have, I would mark A as the correct option, but I'm sure they may not be the exact options. But this is what it should be. Yes. So good, very good, correct. And so I think there is no confusion in this question. Yes. Let's see. Same to same options. Thank you so much. So wonderful. So an easy question. I always tell you, immunobullous is a must do because it is a very common question to get. Now this is the second question which I have. If the image was something similar, let's see. A neonate is bought with the lesion as shown in the image. Baby is feeding normally, no fever, hypotension, or signs of shock. What is the most probable diagnosis here? So, was there anything else in this question which was provided, or were there any other options here? Concept is correct. Yes, resolved class. Okay, I will make sure. But I think we uploaded the PDF, but let's do the recall. 2-day all neonate. Very good. So yes, so I think this is what we have. So neonate with these lesions. Now, if I have a 2-day-old neonate presenting with this peeling of skin, which is there, it should be staphylococcal scalded skin syndrome. So bullous pemphigoid in children 2 days old, rare. Epidermolysis bullosa is a congenital disorder, but just does not immediately present in the neonate age group. It can also present with peeling of skin, but out of these options, EB is something which will come a little later. Pemphigus due to transplacental transfer of antibodies can also present with congenital pemphigus, but out of this, mucosa was not involved. 2-day-old baby. So no, nothing else was given. It was given that no mucosa is involved. See, even pemphigus very, very rarely can happen in neonatal age group due to transplacental transfer of antibodies. And mucosal involvement may or may not come. But I believe that there must be something more in this question to figure out between this and this. So I need your help here. Skin peeling image, epidermolysis bullosa. So multiple. Did they give you patchy vesicles? Did they give you vesicles around the umbilicus? Oh, the image was also not this. So what I get to know is, okay, fine, just give me the inputs and then we will discuss that based on the inputs, what can be the probable causes. So I will remove all of this and let's see what you all have to say. So there were vesicles around the umbilicus, which you all are telling me. These vesicles were patchy, very good. And vesicles was present. There was a different question. Okay. Apart from vesicles around umbilicus, any other thing on the face also? And you are saying superficial erosions. Lesions in face and extremities was given, no mucosal involvement. So don't mix two questions. Let's do one thing. Let's go on to the other question so that you don't get confused. And then I'll come back to this question, right? Because a lot of you are saying that there are two questions which are overlapping. So we will go back to the list of the questions and come back to this. I've noted down whatever important points have been given to me. So I have another question on scabies students. So let's go back there. So we'll come back there. Now, this is one question which I have here. So, guys, I'll come back to that question because I think there is a confusion whether between two questions. I have a question on scabies. We'll discuss that and come back to this question and discuss that. So, let's see. A patient presents with painless black necrotic lesion over the heel with surrounding edema, as shown in the image below. What is the best investigation to confirm the diagnosis here? So, what was this? We are coming back to that question. Please, let's get back to this question now. Thank you so much for all your inputs. I've noted that and I'll come back. So, what do you think it is? There is a painless black necrotic lesion. Now, in this question, so you are saying there was no necrotic, that helps. No edema, that also helps. So wonderful. So this is what was confusing me. So if you say that there was a painless lesion over the heel, no edema also given, as shown in the image below, you have to think of melanoma. So melanoma, you would always go for skin biopsy. So if there was a painless black lesion on the heel, no edema, no necrosis was given. Edema may slightly be there, but no necrosis. Then the probable diagnosis that you have to think of is acral melanoma, for which you would go for a skin biopsy, right? KOH smear, I would not do in this. Gram stain, no. Zinc stain, no. So even if you are thinking probably of a deep fungal infection or something like that, still you will go for a skin biopsy. So any lesion which is pigmented, which is necrotic, with no edema, no necrosis, sorry, as you told me, you would go for a biopsy. Why not KOH smear? Because we are not thinking of any superficial fungal infection here. It is a painless black lesion. And if this is the lesion, it's slightly raised. You see something like this, you think of acral melanoma. Okay. So hyperpigmented lesion on the acral area of the foot, that's usually, in that case, you have to rule out acral melanoma. Okay. Perfect. So I think this is clear. Most of you are giving me the same input, painless black lesion on the acral area. So go for a biopsy. Now, was this the question? A patient presented with well-defined scaly plaque over the scalp with silvery white scales as shown in the image. What is the most appropriate treatment that you would do? So I'll first wait for your reviews on the question here. Okay, perfect. Image may not be this. Only scaly was written, because if there was just a plaque with scaling, it would not help me. No silvery white. Okay. So even in the previous question, next best investigation would be a biopsy, because I do not understand why are we doing a QH if it is an asymptomatic hyperpigmented lesion. Silvery white not mentioned, no moth-eaten appearance was there, multiple lesions were there, itchy scales, not silvery white scales. So perfect. So now students don't get confused. What I get is some of you are saying that there was a patchy lesion with some scaling plus minus itching. So if it was something like this, a patchy lesion with scaling plus minus itching, yes, I would think of tinea capitis here, and that would be my first DD, and then the treatment would become oral antifungals, right? So if there was just patchy alopecia or patchy lesion with some scaling, as you are saying, some itching, then you have to first think of tinea capitis, and there you would give oral antifungals. However, if some of you are saying if you were given an option of silvery white scales, so if in question specifically silvery white scales was present, you have to think of psoriasis, and in that, since it is localized psoriasis, the first treatment of choice would be topical steroids. Okay. The first, so I've given you both the options, but most of you are telling me it is patchy lesions with scaly with itching, right? Not silvery, that's clear. Only patchy was given, no moth eaten was there, so scaly. So perfect. If all of, oh my god, yes. Only image, no history. So how do you know it was psoriasis? If it was just an image which was given, there was just a gray patch. Okay, so don't get confused. So no silvery white scales, this would be tinea capitis. Tinea capitis, you will give oral antifungals. But if some of you remember that there were silvery white scales, you will think of psoriasis and then give topical steroid, not methotrexate. If they have not mentioned that other sites are involved, if there is a single patch being given, you first try to treat with topicals. I told you body surface area less than 10, you stick to topical agents. Okay. Got it. So I think this is clear. We'll move on to the next question. A male presents with multiple painful vesicular lesions over the penile area. What is the causative organism? Now, this is quite straightforward. I have no confusion here, but in case the question was different, again, I need your inputs. Okay. Yes, so oral antifungals or tablet griseofulvin. Even if it was given griseofulvin, that would be the correct answer here. Wonderful. So at least we agree on one of the questions. So you're all saying that there were multiple painful vesicular lesions over the penile area. We know vesicular painful lesions is caused by herpes genitalis, and there the cause is HSV. So herpes genitalis presents with painful vesicular lesions and coalescing erosions in the genital tract. So if that was given, no other STI can present or no other genital ulcer disease can present with painful vesicular lesions. HSV was not given in the option. How is that possible? Okay. Now some of you are telling me that the lesion was on the scrotum. It was not painful. So how was the lesion? So I don't think so, students. There's a lot of confusion in this. If you remember the question as being painful vesicular lesions, we know it is herpes. If it was painful ulcer with undermined edges, it would be chancroid. If it was painless lesion, single lesion on the scrotum, you have to think of chancre and treponema pallidum. But what I get is most of you are saying painful vesicular lesions on the genital tract. So again, maybe we are confusing here. So let's just move on to the next question. This is herpes genitalis, and the option herpes simplex virus would be the correct answer here. Perfect. Now, this is another question that I have, which probably you guys are confusing with the question which we discussed previously. A patient presents with intensely itchy erythematous vesicular lesions on palms and soles. There were lesions which also were present in interdigital spaces, and itching is worse at night. Now, was this the question which was there? Because again, it's a very straightforward question. So that's okay. Even if in scrotum you had painful vesicular lesions, you will think of herpes only. Baby with sole involvement, no interdigital web spaces. Oh. Now, if in the same question lesions were present around the umbilicus also, which is quite possible with scabies. So scabies is something which you all know. I have no doubt that you would mark scabies as the wrong answer. Worst at night was not given, interdigital was not given. Okay, let's move out. Periumbilical lesion, no patient but an infant, no itching at night was mentioned. Bullous impetigo was an option. Palmson's. Okay. Let me just read all your comments and try to understand, because I'm getting such varied responses on this one. Okay. Infant with involvement of palms and soles along with periumbilical area. I guess then what we'll do is, I think there is a lot of confusion between these questions. So I'll just tell you that what can be the probable answer. Thank you so much, everyone. So here, if you were given itchy vesicular lesions on palms and soles with a patient presenting with something like this, then this is sure shot scabies, right? This is sure shot scabies, no case of scabies. That's perfect. Now, there is a lot of confusion about this question, probably, which we have discussed. And so I will tell you the important points which can help me. So if you guys are saying that there was bullous lesion which was given with some crusting, which is present in an infant, then we will go in with impetigo, right? Because that can happen in a baby. So we'll move out from the scabies question. So let's move on. If, however, you were given bullous lesions or skin peeling at sites of trauma, so even if the image was of sites of trauma, which would be which can be trunk, which can be elbows or knees, then you have to mark epidermolysis bullosa. Now, I have received so many options that I am unable to figure out the exact question, because there are so many reviews on this. So bullous lesion with crusting in an infant, impetigo. Bullous lesion, skin peeling at site of trauma, epidermolysis bullosa. Then, if they have to ask about staphylococcal scalded skin syndrome, there will be some fever, some constitutional symptoms, because it is a toxic reaction. This would again happen in an infant. So what I'm getting is it was an infant. So fever, constitutional symptoms, some focus of infection with peeling of skin. Again, think of staphylococcal scalded skin syndrome. So what I understand from you guys is there was an infant, there was some vesicular bullous lesions, site is variable, question is variable. So again, I'm just telling you if it was present. Okay. So no fever, no constitutional symptoms, you can think of epidermolysis bullosa. So neonatal pemphigus, if they have to ask you about neonatal pemphigus, they will mention transplacental transfer of antibodies. So transplacental transfer of antibodies can give rise to neonatal pemphigus, which sometimes can present with vesicles and bulla. Now, here the answer would vary depending on what age was given and what other features were given to you, right? I'm so sorry, I'm not able to help out with this because the chat box is flooded with so many options and they are not matching. But this is what I figured out. So based on this, you can probably tell me what was the exact question if somebody can do that. Maybe there were two questions and we are confusing there. Nicole's kick one we have done. Now, any other question apart from that? So skin peeling in newborn, skin lesions were erythematous, baby feeding well, no infectious symptoms. So if there was no infection, baby is doing well, you can even think of EB in an infant because EB does not usually have any symptom, just there is peeling of skin. Okay. Got it. Now, so I think there was a question on neonatal and Ellie, maybe. So there is somebody is telling me there was a question on neonatal Ellie. Cerebriform tongue we have discussed. Any other question apart from that? So tinea capitis, I understood there was a question on tinea capitis. You will give oral antifungals. Right. So I think this is what we have for dermatology, and we please tell us more questions if you have. Scleroderma and telangiectasia question. What's the answer? So can you give me the exact question? So apart from that, I think there was something for neonatal LE, anti-RO for heart block has been given, and so neonatal LE question. If they had mentioned Rho or La antibody and congenital heart block. So malar telangiectasias can be seen in rosacea. So if they had given you just telangiectasias with erythema on the face, that is erythemo-telangiectatic rosacea, and that can present like this. Fetal heart block antibody would be ROLA, we've discussed that. Scleroderma with malar telangiectasias can be seen in scleroderma. I've told you scleroderma in the facies, there are telangiectasias. So what was the exact question? Malar telangiectasias associated with, I got it. What were the options? Scleroderma. What else? So yes, you are right. Scleroderma can present with telangiectasias on the face. If that was the question. Okay, so I think that was all about dermatology, and we'll go on to the next subject now, and image of iris hyperpigmented patch. So dishydrotic eczema was also there. That's fine. So okay, students, thank you so much, and I'm sure the next educator will be there with you shortly. In case you still remember more questions, keep posting. We have our other faculty, and we can discuss those. Much.
Hi. Hello, student. I hope you are eagerly waiting to just know the answer that whether you have marked it correctly in exam or not. So in this physiology discussion session, what we are going to discuss, we are going to discuss only the answer of the question. If you found that any of the question is not proper, the stem of the question or maybe options are not written properly, so please do let me know in the chat box so I can update the questions later on, right? So the purpose of this session is to discuss the probable most correct answer, right? Because exact recall may not be possible for everybody. So whatever questions I have received so far, I'm going to discuss in this physiology recall session. So in physio this time, there are altogether 15, 16 questions has been asked. So this is a little bit large number of question. Okay. Generally, from physiology in INI-CET, around 10 questions are generally asked, but this time the number of questions is around 15 to 16. So we are going to discuss those questions in physiology session. So first question, which I got from this recall, that biphagic flow in the right coronary artery is due to. So if you look at the option, the question become very simpler. Right. So we know that in coronary circulation or the circulation through the muscles of the heart, how it goes through the coronary arteries, and coronary arteries originate from the arch of aorta. So the determination of the flow in the coronary artery will be determined by the pressure in the arch of aorta and the ventricular pressure. If the ventricular pressure is more than that of the aortic pressure, then the flow in the coronary artery will be stopped. That's why we know that in case of left ventricle, what happens? Left ventricle, only there will be diastolic flow, but there will be no systolic flow. So for left ventricle, we all know that coronary flow only occurs during diastole and not during systole. No flow during systole. Okay, so no flow during systole. This is for the left. But for the right coronary artery or the right ventricular blood flow, you know that there is biphagic. There is a flow of the blood in the left systole also during diastole also. So what is the cause of that? The cause is the low pressure in the right ventricle. Because even during the systole, if you look at the pressure of the right ventricle, that pressure is way below that of the aortic pressure. That's why the right ventricular blood flow occurs both during systole and diastole. Right? So answer is low pressure in the right ventricle. That is the answer. Next question. Increase in permeability of the glomerular capillary will leads to appearance of which of the following in the urine? Fourth option was not there. Okay. Initial systole. Okay. No. So if the options were different, then for the right ventricle, what will happen? The right ventricle, the diastolic flow will happen as well as systolic flow. But during systolic flow, the flow will be a little more than even the diastolic flow for the right ventricle. This is very, very typical of the right ventricle. So if you are saying the options were different, then best match option will be like this, that in right ventricle, diastolic flow will be there, systolic blood flow will be there. But systolic blood flow will be a little more than that of the diastolic flow because of the pressure difference between atrium and between aorta and ventricle. Right. Initial systolic flow time, left ventricle. Okay, so all the options that you are writing is not very clear. Initial systole, reverse flow, ये option था. Reverse flow was not there for right ventricle, right coronary flow. Okay, there was 4 long options. So you are not sure what was the 4 option. So if anybody can, recall the whole question, sir. Initial systole, reverse flow में option था right ventricle में. Okay, let's go ahead. We can come back to this question later on if you could recall later. Okay, so next question was this. I believe this was the actual question. Okay, so here if you look at the option, the glucose, ketone body, uric acid, all of them are freely filterable substances. So there is no relationship with the capillary permeability. But if there is increased capillary permeability, the flow of the permeability of which substances will be there, the protein will be more permeable in the. Okay, इस question को देखो, इसको देखो. Okay, previous one. Glucose was there, ketone body was there, uric acid was there. So protein question is, if the glomerular capillary filtrability increase, which of the following substances will be appear in the urine? I believe if this is the exact question. Permeability increase हो गया ना? That is the question ना? That is the question. No, there is graph wala, there is another question. I will show you. The graph wala question, there is another one. Yes, graph wala question was there. I will show you. The filtrability, there is another question. But this was one of the question, I believe. So here, other substances which is given here, they are the freely filtrable substances. So freely filtrable substances means if there is increase in glomerular capillary permeability also, the substances will remain same in the urine. Okay. So increased permeability of glomerular capillary will leads to appearance of which of the following in the urine? Okay. Protein will appear in the urine if there is increase in permeability. Okay, question देखो ना, increase permeability. All of these substances are freely permeable, na? Thus, image-based picture I will show you later. First, hold on this. Question was like this or question like this or not? Nephron image was there. Okay, nephron image. Okay, I got it. Nephron image. But even with the nephron image, the question is not going to change. I believe the question was based on the concept of the freely filtrable substances or not. If you are saying the increased permeability will appear in the glucose is going to appear, then all will appear in the urine. All will appear in the urine, right? So here I believe the question maybe stem was a little bit different, but this is based on the permeability concept of the substances, right? Okay, chalo, next question dekhte hain. Renin is secreted in response to which of the following? This is the question? So elevated sodium load in the macula densa, it can be a little confusing here. Elevated sodium load in the macula densa, I told you in my classes also that NaCl के साथ renin का जो relation है, it is the reverse relationship. So this is not going to be the answer. Okay. Then elevated renal perfusion pressure, no. But we know that JG cell contain a baroreceptor. Whenever there is decrease in the renal perfusion pressure or decrease in the blood pressure, then and then only the renin secretion is going to increase. So renin is secreted in response to which of the following? Your answer will be reduced perfusion pressure or hypoxia in the kidney if there is any kind of option like this. So here, reduced renal perfusion pressure will be the answer. Okay, chalo. Next question. Hyperpolarization during sensory transduction. Direct question. So this question we have discussed in classes multiple times that there is one sensory receptor which is exception to the law. All the sensory receptor, they are activated when there is depolarization. So all these receptor will be activated when there is depolarization. But the rod and cone cells, the visual receptor, the rods and cone cells, you know, they are activated when there is hyperpolarization. So hyperpolarization during sensory transduction is for which of the following sensation? That is the visual stimulus. Okay, that is the rods and cone. Easy question. Next question. Emotional modulation of the speech. So to recall, we are getting basically emotional modulation of the speech. This is also known as this emotional prosody. So I believe this is the exact question which was asked, maybe the emotional prosody of the speech or the emotional modulation of the speech. In both the cases, answer is going to be the cingulate gyrus. Answer is going to be the cingulate gyrus will be the answer. Cingulate gyrus, because frontal lobe is not there in this question. So prosody was the option that was, yes, emotional prosody. So this is the exact question I believe. So this question I will follow. The remaining one is not there. So here, cingulate gyrus, bilateral, maybe whatever. Okay, cingulate gyrus will be the answer. Okay, because that is one of the important part of the limbic system and that is controlling our emotional speech. Okay, prosody. Okay. Okay. Now, this is the image which is given to me by my team. I don't know what is whether this is the exact image or not. But this is the structure which is marked, and this structure is nothing but the intercalated disc. But in the option, I am not getting any of the intercalated disc. So student, could you recall that intercalated disc was there in the option or not? If this is suppose this is the exact question. So if the intercalated disc was not there in the option, then the next better will be the gap junctions. So what I told that if the intercalated disc was not given in the choices, Could you recall whether the intercalated disc was given or not? Achha, pink image was there. Okay, so we have to take another image. No image. Intercalated disc is made up of. Okay. Intercalated disc is made up composition of the intercalated disc. Okay, so what was the option? What is the option? Composition of the intercalated disc. So I told you intercalated disc is basically the fusion of the plasma membrane, and at the level of the intercalated disc, gap junctions will be there. So I am writing here. So the composition, very good. Composition of intercalated disc is okay. So in that cases, cardiac muscle metal, multiple correct type. Okay. Right. First option. Wrong option, tight junctions. So tight junction is not going to be. Okay. No image, sir. Zona occludens was also there. Okay, I believe intercalated disc was multiple options. Zona occludens, desmosomes, gap junctions, fascia adherence, tight junctions. Single choice or multiple choice? Multiple choice. Could you recall? Okay, so image was not there. काट दिया. अब ठीक हो जाओ. अजीब ऑप्शन था. Okay, that's why multiple choice था. No. Only gap junctions is the best possible choices here. And desmosomes, it was there. Desmosomes will also be there. Okay. Let's see. So I'm putting a query here. Okay. This is not the exact recall. Okay. So composition of the intercalated disc was the option. So someone, if you could message me later on also that what was the exact choices in the intercalated disc. Multiple choice, I got it. Okay. Gap junctions, if it is there, it will be there because at the level of the intercalated disc was present. Okay. Zona occludens नहीं होगा. fascia भी नहीं होगा. Then gap junctions will be the single choices. Okay. चलो ठीक है. एक बार कंप्लीट करके मेरे को एक बार सेंड करना. Okay. So I'll check and then I'll revert back. Okay. चलो next question देखते हैं. So this is one a direct question. Multiple. Okay, I got it. Okay, desmosome or hemidesmosome ठीक कर लो because someone is saying hemidesmosome, someone is saying desmosome. Desmosomes and gap junctions will be there. Okay. So GS receptor ये question को देखो. I believe this is the exact question and direct question. So इसका आंसर भी direct होगा. Beta adrenergic receptor. No hemidesmosome. Okay. आप यहाँ पे देखो. So previous question, if the intercalated disc was there, so intercalated disc आपको देखना होगा कि desmosomes is there or not. So desmosomes will be one of the answer, and if it is not there, then gap junctions will have to choose this, right? Because I told you already कि जो option मेरे को catenin, fascia वो सब नहीं आएगा. Okay. अब ये सेम क्वेश्चन तो इसका आंसर भी एक ही होगा, बीटा एडिनर्जिक रिसेप्टर, और कोई इसका आंसर नहीं है. हाँ, वो हैंड आई कोऑर्डिनेशन वो हम आ रहा है उस क्वेश्चन में आ रहा है. वी आर कमिंग टू दैट. पहले ये क्वेश्चन को देखो. अच्छा, नेक्स्ट क्वेश्चन. हाँ, दिस वाज द क्वेश्चन व्हिच यू वाज सेइंग दैट देयर वाज अनदर क्वेश्चन सर वेयर ग्राफ वाज गिवन. So here now again this is the question of the filterability and the molecular radius. So we know that this is the cationic substances. ये question, this is the previous question, basically previous year question. This is the neutral substances and this is the negatively charged substances. We all know that the filterability of substances X is greater than filterability of the substances Y greater than the substances Z. This is the sequence. है ना? ऐसे टाइप का ग्राफ था. Exactly, ditto graph. And this is a repeat question, you know, repeat question. Already this question has been asked. Now here they have changes the option. Now if you follow this option, so Y has more filterability than X, so A wrong. X is less filterable than Y. Again, this is wrong because X is a cationic substances. So X is the maximum filterable substances, followed by your y followed by z, यही तो ना? So x maximum followed by y followed by z. So if you just match it, x representatively positively charged molecule, this is also true. Y has more filterable than z, this is also true. ये multiple statement correct था कि single statement correct था? Now you look at that whether this was a multiple or single choice. Because if you look at X represent positively charged molecule, this is also correct, true. And Y has more filterability than Z, this is also true. But I believe, multiple choice tha, so C and D both will be the correct. C and D both will be the correct, sorry. C and D both will be the correct. But I don't know whether this last option was exactly this is the option, but if this is the exact option, then obviously you can easily understand that X is a cationic substances, so X represent positively charged substances, this is also true, and filtration of the Y is more than filtration of the Z, this is also correct. Okay, so C and D both are the correct in this question. Okay, chalo next. Which of the following transporter activities increase during oral rehydration solution in diarrhea therapy? In diarrhea therapy, this was the exact question, I believe. They didn't ask that which transporter activity increased in diarrhea. Okay, so look at here. If this is the exact question that which of the following transporter has increased activity in the therapy of diarrhea, then all of you know that we generally give the oral rehydration solution, and the oral rehydration solution is glucose and solution is absorbed by glucose and solution is absorbed by which one? Is absorbed by the SGLT transporter, by absorbed by the SGLT transporter, right? So here the answer will be SGLT1. Okay, chalo. In which of the following area the neuron can regenerate and increase in number? I believe wrong stem of the question or maybe wrong options. Either wrong recall or wrong option. एक बार आप check करो everybody. Even if the no ORS is given, so I am taking this that no ORS rehydration was given, that therapy in diarrhea, then also you have to choose this SGLT1 only. Okay, SGLT1 only. In which of the following area can neuron regenerate and multiply or increase in number? This increase in number was there in the choices or not? Dentate gyrus was there in the choices. It was there. Very good. Very good. Then it will be the answer. That's why I was thinking. That's why I was thinking. Okay. Because you know, hippocampus is the area. Purkinje cell nahi tha? Okay. Purkinje cell nahi tha. Okay. बाकी था ना ये सब. But dentate gyrus आ गया ना तो आंसर हो गया आपका. क्वेश्चन था dentate gyrus, everybody? Dentate gyrus और हिप्पोकैम्पस ऐसे टाइप का कोई ऑप्शन था? Okay, if it was there, तो that will be the answer. Otherwise, none of them is possible to answer. But if suppose nothing is there, this dentate gyrus was not given in the choices, then you have to go for the single base choices of the anterior horn cell. But I believe that dentate gyrus was given in the choices, so this is the correct answer you have to take. Okay, locus ceruleus नहीं था तो और क्या था? CNS was written. Okay. CNS was which area of CNS? Okay, CNS was written. लिख लिया. Okay. So CNS में हम लोग जानते हैं हिप्पोकैम्पस में एक होता है और एक ऑल्फैक्टरी बल्ब में होता है और सबवेंट्रिकुलर जोन में होता है. ये तीनों में से कोई एक ऑप्शन होगा. Locus ceruleus option was there or not? I am not interested. This is not going to be answer. This is not going to be answer. This is not going to be answer in any cases. Okay. Hippocampus, olfactory bulb, and subventricular area. This was the three area where this neuronal regeneration is possible. Even if it is olfactory bulb is also given, hippocampus is also given, then also you have to go for hippocampus, right? Chalo. Next one. Loss of hand-eye coordination. ये question बोल रहा था ना, so this is a very completely new questions. Okay. Loss of hand coordination is the problem of the parietal lobe. Okay. I have noted that CNS was there in the choices. Parietal lobe was there. Okay, so parietal lobe will be the answer. Very good. ठीक है. चलो, ये भी हो गया आंसर. Neuropraxia, ये तो आपका बहुत ही simple question. So the Orthopedics teacher will also discuss of the answer of this question, I believe. But here you know कि neuropraxia is the first grade according to classification system. So only the physiological conduction block will be the correct answer in this question. ठीक है, ये question का भी ठीक है. Recall neuropraxia direct था ना? Yes, inferior parietal lobe, exactly. Endoneurium option में था? Okay, okay. Endoneurium. Same question, but here neuropraxia is only physiological conduction block. Okay. ठीक है, ठीक है, ठीक है. Either this or this. चलो. Okay, next question. Which of the following are correct in night vision? Okay. So look at the option first. Pupil size increases. ये तो होता है during night vision. Increase sensitivity to light. This is also correct. So ये option था. Visual acuity increases. No. Option wrong. So क्या option था? Could you recall? Okay, हो सकता है option wrong because this is direct recall and just 1-2 घंटा ही हुआ है, so visual acuity increases was not there. Okay, it was not there. Okay, ठीक है. Okay, first line duration man goes from dark room. Okay, so they are basically asking about the dark adaptation. Okay, I'm writing here. So this question is basically a question on adaptation, dark adaptation. Time was very long period. 1, 2, 3 correct. Retinal and opsin changes back to pigment. But if this is the option, this is wrong. If this is the exact option, this is wrong. But ये option था कि इसका उल्टा option था. But whatever you are saying, that is just opposite of this. 1, 2, 3, if it is correct, then there will be more generation of the, yes, photo generation time. Okay. I am looking at your option. I am looking at his chart box. Opsin and retinal changes to vitamin A. Both were there. Okay, option was same. Last option are retinal and opsin changes to photopigment. Okay. Opsin. Now what will be the answer? So choices is not correct. Okay. Dark adaptation. Yes, I got it, doctor. I got it. Yes. 2, 3 and 4. Yes, 2, 3 and 4 will be the correct option in these cases. But option यहाँ पे wrong है. But I believe you got the correct thing. Okay. So pupil size increases sensitivity to light, and retinal and opsin changes to photopigment. So this will be the basically the correct answer. Exactly. Right. Very good. So dark adaptation, if this is the question, then this 2, 3 and 4 will be the correct answer in these cases. Okay. चलो ठीक है. Next question. Match the following clinical condition with acid base disorder. Cardiac muscle wala I'm coming back to there. Okay. Cardiac muscle I'm coming back to there, but first look at this question. So I believe this is easy for you. So hyperventilation होगा तो respiratory alkalosis. बाकी आप लोग ऐड करो, ऐड करके मेरे को आंसर बताओ कौन सा आंसर मार के आए हो. राइट. ओके. यहाँ पे आ जाओ. वॉमिटिंग. सो वॉमिटिंग होगा तो क्या होगा? persistent vomiting, तो इसके साथ चले जाएगा. ओके. Ethynyl glycol, all of you know this, and respiratory, this you all know. Okay. So which one is matching? So in this option, so A will be the correct answer, है ना, Dr. Saab? Everybody look at. Look at everybody. So this is all the question I believe that I have received from your student, Okay. हाइपरवेंटिलेशन एक मैच करके पूरा हो रहा है. यस यस यस. इफ यू मिस हाइपरवेंटिलेशन 1, सो एक मैच करके 2 आपको देखना होगा. B1 दोनों के साथ हो सकता है. सो A एंड D के बीच में आपको ऑप्शन चूज करना होगा. बट इट इज इजीली, यू कैन इजीली डू इट. सो दिस वाज ऑल द क्वेश्चन, टोटल 16. नाउ आई विल गो बैक टू दिस question of desmosome wala question. Okay, here. So some of you are saying that question was that composition of intercalated disc. There was no image given. यही बोल रहे हो ना? Composition of the intercalated disc. No image given. So in that cases, मैंने आपको बोला ना कि what is the intercalated disc? That is the fusion of the two cell membrane, and the fusion occurs because of the help of desmosomes. So desmosomes will be there, and along with the desmosomes, the gap junctions is also present at the level of the intercalated disc. So if this is the question, then you should go like this: intercalated disc and cardiac muscle. Image था sir. Okay, देखो आप फिर से बोल रहे image था. Okay, so image था तो image रहने देते. But I think ये जो मार्क करके रखा है इमेज में, so this is the intercalated disc. Okay, so image was there, image was marked at the intercalated disc. Okay, and they asked that what is the composition. यही तो पूछा था ना, यही बोल रहा है ना. So उसमें tight junctions नहीं होगा, adherent junctions नहीं होगा. Okay, so your answer will be desmosomes and gap junctions. Okay, no problem dear, no problem dear, whether image was there or not, but look at the answer will be the desmosomes and the gap junctions. The answer will be desmosomes as well as gap junctions. No image, no image. Okay, चलो ठीक है, कोई बात नहीं. और कोई प्रॉब्लम, और कोई प्रॉब्लम? सो ये सब तो क्वेश्चन हम लोग डिस्कस कर लिया. बाकी आई बिलीव एनी अदर क्वेश्चंस? ओके, सो सीवियर. Okay, in severe hyperglycemia, insulin causes glucose entry in muscle cells. So this is a very easy question. Okay, glucose entry in the muscle cells, GLUT4. So if that was okay, so I'll make the option fascia adherence, tight junctions, gap junctions, hemidesmosomes. Okay, okay. So even desmosomes was also not there. Then gap junctions is only with the correct statement there. Okay. Case scenario: diarrhea, eating fried rice. Okay. Okay, so this is not my coagulation necrosis. Pathology teacher will be pathology discussor will be discussing. Okay, ठीक है. So I believe all the questions more or less we have discussed. Only there is 2 questions where the confusion is arising. This protein wala question was there. The increased filtrability of the glomerular capillary, which substance is going to be filtered? That is one question. And this cardiac muscles intercalated. That is the 2 questions where the confusion is originating. Rest of the questions I believe done. Okay, so thank you so much. So I believe the next faculty is waiting. So just give us few minutes so that we can reconnect with the next faculty. Thank you so much. Best of luck for your exam result. Take care. Bye bye.
Hi guys, welcome back. So I hope you did well in the exam. Start करते हैं फिर surgery. Clear? So let's start the questions one by one. Which of the following features best distinguishes small bowel obstruction from paralytic ileus? Can you tell me what's the correct answer? Yes. Guys, the question was same. So it was same. The language was same. Yes, so everybody is correct, obviously. In para, okay, same, very good. So Vipul, it's same. So which of the following features best distinguishes small bowel obstruction from paralytic ileus? You know that in paralytic ileus, there is no hyperperistalsis. And in small bowel obstruction, since there is hyperperistalsis, there will be colicky abdominal pain. There will be colicky abdominal pain. Abdominal distension is seen in both. Tachycardia is seen in both. Vomiting can be seen in both. So it is colicky abdominal pain, which is correct answer. Right? Okay, guys, see the second question. Which of the following is not included in the lethal triad of massive blood transfusion? Lethal triad of massive blood transfusion. Okay? It was same or it was different? Guys, tell me. The language was same or it was different? Yes. डॉक्टर हाइपोकैल्सीमिया था, हाइपोकैल्सीमिया भी था. ओके, राइट. सो मल्टीपल ऑप्शंस वर देयर. वन पर्सन इज टेलिंग दैट सर हाइपोकैल्सीमिया भी था. वेरी गुड. सो हाइपोकैल्सीमिया भी था. हाइपरकैलीमिया, हाइपोनेट्रीमिया नहीं था. गाइस टेल मी, हाइपोकैल्सीमिया था, हाइपोनेट्रीमिया था कि नहीं था? हाइपोनेट्रीमिया. Okay, question was which one is involved in lethal triad, right? So see, which one is involved in lethal triad, involved. ठीक है, तो जो lethal triad of trauma है, that is the lethal triad of massive blood transfusion. इसमें होता है क्या? How to remember? Mnemonic is HCM. So what we include, guys? Can you tell me? It is HCM, that is hypertrophic cardiomyopathy. So you can see that there is hypothermia. It is hypothermia. And then there is coagulopathy. Okay, hypothermia, coagulopathy, metabolic acidosis. So coagulopathy, metabolic acidosis. Clear? Don't worry. I'm going to discuss the triad also, diamond also, pentad also. Right? So here, there is hypothermia, coagulopathy, metabolic acidosis. Clear? So if you see the triad of death or triad of massive transfusion, there is hypothermia, there is coagulopathy, and there is metabolic acidosis. Then there is a diamond. And what is that lethal diamond of severe blood loss? There is one additional feature, hypocalcemia.
Hello.
And if you want to see the pentad, in pentad, we are going to add hyperkalemia also. So in pentad, we add hyperkalemia also. Clear? So hyperkalemia also, okay? So hypothermia, coagulopathy, hypocalcemia, hyperkalemia. अगर इन चारों में आपको चूज करना है, you have to choose hyperkalemia. Clear? So it is hypothermia, coagulopathy, metabolic acidosis. Fourth, you can add hypocalcemia. Fifth, you can add hyperkalemia. Depending upon that, you can mark. Okay, so triad पूछा था, it is hypothermia, coagulopathy, metabolic acidosis. If it is lethal diamond, you can add hypocalcemia, and if it's pentad, then add hyperkalemia. अगर मल्टी ऑप्शन करेक्ट है तो ये दोनों करेक्ट होगा. अगर आपको ट्रायड में से चूज करना है, यू टू चूज फ्रॉम द ट्रायड, सो चूज हाइपोथर्मिया एंड कोगुलोपैथी. सो गाइस, वी डिस्कस डिपेंडिंग अपॉन द लैंग्वेज यू कैन मार्क द करेक्ट आंसर. ठीक है, ओके, ट्रायड पूछ रहा था. नेक्स्ट, match the clinical conditions with most appropriate investigations. Tell me what is the correct answer. Easy question. Pancreatic pseudocyst, you know the investigation of choice, it is CCT. Thyroid nodule, FNAC. Prostate cancer, you can go for PET scan. Obstructive jaundice, you can go for MRCP. So here you can see it is A4, B1, C3 and D2. A4, B1, C3, D2. Anybody is having confusion here? Anybody? Okay, so everybody is correct, guys. Everybody is correct, right? Option was PMSS scan. Okay, PET scan की जगह PMSS scan. Okay, PMSA PET. Okay. Okay, it's fine. So PMSA PET, obviously it is for prostate. ठीक है, राइट. अगर आपको आंसर चूज करना है पुराने वाले क्वेश्चन में, चूज हाइपरकैलेमिया, चूज हाइपरकैलेमिया. व्हाट इट? प्रोस्टेट का पीएमएसए पेट लिखा था, इजी. सो पीएमएसए पेट, सो करेक्ट आंसर इज ऑब्वियसली A4, B1, C3, D2, राइट. नेक्स्ट, a patient with thyroid nodule undergoes FNAC which suggests follicular carcinoma. Guys, can you tell me what's the correct treatment here? Next step in management. Next step in management, tell me. Same question, very good. Very good, because it should be follicular neoplasm. It should be follicular neoplasm. Clear? It's follicular neoplasm. And if it's follicular neoplasm, we have two approaches. What you do, if it's follicular neoplasm, you are not sure because you know that FNAC cannot differentiate follicular adenoma from follicular carcinoma. इसलिए इस केस में हम क्या करते हैं, we go for biopsy, or preferred option is go for hemithyroidectomy. When you go for hemithyroidectomy, what will happen? After that, you are sending one lobe with isthmus to the pathology department, and they will send you the biopsy report, confirmed report, whether this is benign or malignant. Imagine it's malignant. Imagine it's malignant. And if it comes malignant, go for completion thyroidectomy. We go for completion thyroidectomy. So we go for completion thyroidectomy. Completion thyroidectomy, clear? So it was solitary thyroid nodule. Somebody is saying that, sir, patient was having solitary thyroid nodule, undergoes FNAC, there was follicular neoplasm, and in that case, what's the next step in management? You go for biopsy or confirm it by hemithyroidectomy, remove the thyroid and send it, remove the thyroid, half of thyroid means one lobe with isthmus, send it to pathology department, you get the biopsy report, and after that, if it's malignant, go for total thyroidectomy. Okay, so everybody is saying that, sir, it was solitary thyroid nodule, obviously we go for hemithyroidectomy, uske baad completion thyroidectomy, right? Completion thyroidectomy. Okay, easy exam. Okay, now see the next question. Now see the next one. You can see the next question here. According to American Association for Surgery of Trauma, AAST, colon injury scale, a colonic laceration involving more than 50%, it's more than 50% of bowel wall circumference without complete transaction. Guys, can you tell me the correct answer? If it is less than 50% or up to 50%, it is grade 2. And if it's more than 50%, it is grade 3. Let me tell you, this question was asked for the first time. For the first time, they asked this question. Previously, they asked liver, they asked spleen AAST grading. But here, for the first time, they asked colonic trauma AAST grading. So let's discuss what is grade 1. In this patient is having either contusion or hematoma without devascularization or partial thickness laceration. Grade 2, this you have to remember. Less than 50% of colonic circumference is there in the laceration. Grade 3, more than equal to 50%. And grade 4, there is transaction of the colon, complete circumferential disruption, and whenever there is complete devascularization, that is grade 5. So grade 2, less than 50, grade 3, more than equal to 50, grade 4, complete transaction, and grade 5, complete devascularization. Devascularization. Easy, guys. Next question. In prostate, biopsy reveals Gleason grade of 8, that is 4 plus 4. This was asked previously also. Similar question was asked previously. What is the corresponding grade group of the tumor? So this is integrated question between surgery and pathology. Tell me the group. What is the corresponding group? Yes? Hey, guys, I'm waiting for the reply. Neera, very good. Suprakti, almost everybody is correct. So guys, this is grade 4. Grade group 4. Clear? Let's discuss. It's very easy. If the Gleason score, you know that there is primary grade plus secondary grade. You know, Gleason score is primary grade plus secondary grade, secondary grade. And you know, How much is the score in primary grade 1 to 5? Secondary is 1 to 5. Suppose the addition of both is Gleason score. So addition of both primary plus secondary, it is Gleason score. Got it? So if the score is 6 or less, it means it is low grade, that is group 1. So grade 1. If the score is 7, it is 3 plus 4. Remember, the primary grade is 3, secondary is 4. Then it is group 2 or grade 2. And if it is 4 plus 3, then it's grade 3. And if 8, it is grade 4. If it's between 9 to 10, it is grade 5. Clear? Okay, Shivans, don't worry. Result acha hoga, lekin don't worry. Okay, so guys, here it is grade 4. Grade 5, 9 to 10 hai. Grade 2 mein 7 hai if it is 3 plus 4. And if it is 4 plus 3, it is grade 3. Next, the principle of total mesorectal excision. Can you see here? The term is self-explanatory. It is total mesorectal excision in rectal cancer. कैसे निकालते हैं थोड़ा सा देख लीजिए आप लोग. This is the rectum and this is the mesorectum around the rectum. So we go for circumferential excision. Can you see here? Rectum, apart from that, circumferential excision of mesorectum should be done. So this is total mesorectal excision. Excision of only peritumoral fat, it's incorrect. Removal of entire mesorectum as a single intact unit, correct. Routine removal of pelvic autonomic nerves we are not removing. Ligation of internal iliac arteries not done. So this was quite easy question. Total mesorectal excision, remove the entire mesorectum as a single intact unit. No, don't go for blunt dissection, guys. Blunt nahi, we go for sharp dissection. We go for sharp dissection. Okay, so sharp dissection was mentioned. Okay, so we go for sharp dissection, right? So we go for sharp dissection. Okay, one was sharp dissection, one was blunt removal. Blunt removal, we are going for sharp dissection. So we are going for sharp dissection. She was not there. Okay, so this was blunt removal. This is sharp dissection. So we are going for sharp dissection. Okay, next. According to ATLS guidelines, arrange the following steps in correct sequence of trauma. ठीक है? आपको पता है protocol ABCDE. You know the protocol ABCDE. There is slight twist. What is the twist? We are going for ABCDE, but see, if you see option D, catastrophic bleeding control. Whenever any patient is having catastrophic bleeding, in that case, first control the bleeding. Otherwise, patient might die because of, catastrophic bleeding rather than airway obstruction. So it is control the catastrophic bleeding first. So it is D, after that airway, after that circulation with hemorrhage, after that disability. So it is DABC. It is DABC. So correct answer is D. DABC. Let me tell you, we have to follow ABCD protocol. But whenever there is catastrophic bleeding, you have to control the catastrophic bleeding first. Clear? Okay. So here, correct answer is option B. So usually we follow ABCD protocol, but sometimes XABCDE. What is X? X is catastrophic bleeding control, because if patient is having exsanguinating external hemorrhage, it should be stopped immediately using direct pressure or tunicking. After that, we go for airway with cervical spine protection, circulation with hemorrhage control, and disability assessment. Sabka sahi hai? Very good. Doc Lokesh, very good. Simple logic. Next question, guys, you tell me what's the correct answer. It's very, very easy question. A 60-year-old patient presents with pruritus. Itching is there. Patient is having obstructive jaundice. Palpable non-tender gallbladder is noted. Tell me, what is the correct answer? Easiest question. Guys, I'm waiting for your reply. Tell me what's the correct answer. Yes, it is carcinoma head of pancreas or cholangiocarcinoma. Very bad. Guys, see, it's very, very easy question. Whenever gallbladder is palpable in a case of obstructive jaundice, what's the name of this law? All of you know, this is Kurweiser's law. You know, what is the name of this law? Kurweiser's law. And what is Kurweiser's law? In a case of obstructive jaundice, gallbladder is seldom palpable due to stone disease. Rule out the stone disease. It is palpable because of periampullary carcinoma. You know which malignancies are included in periampullary carcinoma? Ampullary carcinoma, carcinoma head of pancreas, distal cholangiocarcinoma, and duodenal carcinoma. So it is palpable. Gallbladder is palpable in periampullary carcinoma. It is palpable in periampullary carcinoma. What are the malignancies included in periampullary carcinoma? You know, CA head of pancreas, carcinoma head, ampullary carcinoma, all of you know. Ampullary carcinoma, distal cholangio, not all cholangiocarcinoma, only distal cholangio. And what else? Duodenal carcinoma. So guys, what is the correct answer? Carcinoma head of pancreas. आप लोग बताइए कितने लोगों का सही हुआ? How many of you? Yes, non-palpable तो हो ही नहीं सकता, because if it's non-palpable पूरा logic खत्म हो जाएगा. It must be palpable. Very good, everybody. Very good, guys. Very, very nice. Everybody mark the correct answer. देखिए, carcinoma head of pancreas में in all cases gallbladder will be palpable. Yes, and in cholangiocarcinoma only in distal cholangiocarcinoma. ठीक है? Only carcinoma pancreas, then also it's fine. अगर सिर्फ carcinoma pancreas भी दिया है तो भी it's fine. We assume the most common type is carcinoma head. So most common type is carcinoma head. ठीक है? Next question. Assertion: easy blood transfusion. Sorry, it's early. Early blood transfusion in patients with hemorrhagic shock is beneficial. Blood transfusion increases oxygen delivery to tissues by increasing hemoglobin concentration. Guys, I'm waiting for your reply. Tell me what's the correct answer. Tell me. The same, Vipul, Arpita, very good. It was the same question. So tell me, what's the correct answer here? Correct answer. Everybody is correct. Guys, you know that assertion is correct. Early blood transfusion in patients with hemorrhagic shock is beneficial, it's correct. And if you go for blood transfusion, obviously, it is going to increase the oxygen delivery to the tissues by increasing hemoglobin concentration. This is also correct. And you know, the region is correct explanation for A. So correct answer is option A. It is option A. Clear? So that's option A. Next, in trauma, patient is assessed during GCS. The patient localizes pain, produces incoherent sound, and opens eyes to painful stimuli. Can you tell me what is EVM? EVM. Eye opening to painful stimuli. It means E2. Verbal response to incoherent sound. V2. M. Guys, tell me M. M5. So it is 9. Yes, it is 9. So can you tell me the correct answer? Correct answer is option A, 9. Correct answer is 9. Trauma resuscitation, that is also fine. Even if it's trauma resuscitation, in that case also if patient is in the state of shock, आपको पता है most common cause of shock in trauma patient is bleeding. Bleeding का मतलब है hypovolemic shock. So it doesn't matter. It's 9. Quickly, you know how to remember SPLP. अगर spontaneous eye opening है, it is 4. Loud voice या speech 3. Pain 2. No response 1. तो यहाँ पे to pain or pressure. To pain or pressure. So यहाँ पे था E2. Here, patient was using incomprehensible sound. If patient is oriented, it is 5. Disoriented or confused, 4. Inappropriate words, 3. Incomprehensible sounds, 2. No response, 1. So it was V2. And patient was localizing pain. So this is 5. Obey command 6. Localizes pain 5 with travel 2. Pain 4. Abnormal flexion 3. Extension 2. No response 1. Easy? Trauma resuscitation doesn't matter. Trauma resuscitation था, hemorrhagic shock था, कोई बात नहीं. Answer same रहेगा because you know that even in trauma, the most common cause of shock is blood loss, that is hypovolemia, and it is hemorrhagic or hypovolemic shock. So here, score is 9. Next, guys, this question was asked for the first time. For the first time. और जितने भी laparoscopic related question थे, मैं आपको बता दूं, सब में answer कितना था, बताइए. जितने भी question थे, सब में answer था 2 centimeter. In all questions which were asked today, in all, yes, the answer was 2 centimeter. देख लीजिए. During laparoscopic cholecystectomy, achieving critical view of safety requires adequate dissection of cystic plate. Minimum length of cystic plate dissection required. Minimum we are going to dissect. Minimum. Okay, this was not the question. Doesn't matter. एक ऐसा ही मिलता जुलता question था. Some people are saying कि सर ऐसा नहीं था. ठीक है? We are going to discuss, don't worry. So whenever you have to perform the dissection, critical view of safety में it's 2 centimeter. ठीक है? So for satisfying critical view of safety criteria, you should go for proportional clearance. Lower 1/3 of gallbladder must be separated from liver, and cystic plate should be exposed for a minimum of 2 centimeter. Okay, inguinal myopectineal orifice का भी था. Don't worry, I'm coming to that also. There was some confusion, that's why we framed the questions like this. हमारे पास वो question भी है, don't worry. ये question नहीं आया था. Okay, leave it. Now see the next question. ये वाला आया था, आप लोग बताइए. During difficography, rectocele is considered significant when there is anterior bulging of rectal wall into posterior vaginal wall. Anterior bulging into posterior vaginal wall. Rectocele when there is anterior bulging of rectal wall into posterior vaginal wall. ये क्वेश्चन था. वेरी गुड. सी के मेडिक बोल रहे हैं कि सर ये वाला था. सो इट इज अगेन, मैंने बोला था 2 सेंटीमीटर. थोड़ा सा डिस्कस कर लेते हैं. रेक्टोसील थोड़ा देख लीजिए. Rectocele is considered pathologically and clinically significant once it is significant when the anterior bulge is going to exceed 2 centimeter. Remember, during maximum straining or evacuation, it should exceed 2 centimeter. इसके 3 grades होते हैं. What is mild? Less than 2. Grade 2 is moderate or significant, 2 to 4 centimeter. Grade 3 is large or severe, more than 4 centimeter. Okay, so obviously 2 to 4. So more than क्या option में था? Aditya wants to say that. Aditya, yes, more than equal to 2. Yes, if it is more than equal to 2, it's correct. So यहाँ देखिए, if it was like this, more than equal to 2. Option was like this, more than equal to 2. So it was more than equal to 1 centimeter, more than equal to 2 centimeter, more than equal to 3 centimeter, more than equal to 4 centimeter. So definition ये रहेगा more than equal to 2 centimeter. Clear? It is more than equal to 2 centimeter. तुक्का सही. Very good. Clear? Next question. 55 years old patient presents to emergency department. Clear? With abdominal pain, distension and vomiting. Can you see? Abdominal pain, distension and vomiting. इसका मतलब patient is having small bowel obstruction. Abdominal pain, distension, vomiting, small bowel obstruction. ठीक है? One thing is clear. Imaging confirms the diagnosis of cecal volvulus. Which of the following risk factor accounts for 50 to 70% of cecal volvulus? Guys, ऐसा सेम था. 50 to 70% नहीं था. Okay? Guys, I'm asking 50 to 70% cases का था कि नहीं था? Tell me, it was there or not? Yes. So everybody is marking correct answer. देखिए, cecum is not a mobile organ, it's not a mobile. And if cecum is mobile, it is because in previous surgery you have dissected or ligated or excised the ligament. So 50 to 60, कुछ लोग बोल रहे हैं कि सर 50 to 60 था, 30 to 70 मान लेते हैं आपका. Yes. Suppose even if it's 30 to 50, 50 to 60, 30 to 70, ये सब केस में है. इसमें देखिए, high fiber diet, lactulose abuse is not a risk factor. Female sex is risk factor. Which female? Multipara. So actually speaking, all females, it's not a risk factor, it's multipara. यहाँ correct answer क्या होगा? Actually speaking, 50 to 70% cases में, the patients who are having cecal volvulus, they have history of previous abdominal surgery. 50 to 60% मान लेते हैं, 50 to 60. So correct answer is history of previous abdominal surgery. Okay? Previous abdominal surgery. Next. This question was asked for the first time. First time this question was asked. Okay? आप लोग बताइए, 65 years old male with diabetes. There is purulent discharge. Per rectum diagnosed with fistula in ano. Planned for surgical management, which is sphincter preserving surgery. Easiest question, guys. Tell me, which one is sphincter preserving surgery? देखिए, fistulotomy and fistulectomy, these are not sphincter preserving, because in fistulotomy you incise the fistula tract. You excise. Here you incise the fistula tract. Here you excise. These are not sphincter preserving. Lift and phylac. What is lift? It is ligation of intersphincteric fistula tract. देखिए, very easy. You can see the patient. This is the fistula. Clear? In that case, what you do? You don't dissect the tract. You just ligate. So you ligate the fistula tract. So ligation of intersphincteric fistula tract. Internal or external opening? Okay, it was not asked. Okay, internal oblique question was there. Waft was there in the option. Somebody is saying that waft. Waft. Clear? Okay. Which one is not sphincter preserving? Which one is not sphincter preserving? Okay, not. Okay. So one is, let me tell you, lift is sphincter preserving. That is ligation of intersphincteric fistula tract. Phylac is also to some extent sphincter preserving. Waft is also sphincter preserving. Fistulotomy tha ki nahi tha? Okay, now it's correct. Fistulotomy nahi tha. It was waft. It was waft और फिस्टुलेक्टोमी था. Now the question becomes very easy. इन तीनों में obviously हम फिस्टुला के साथ track के साथ you are going to excise some sphincter also. So it's the fistulectomy in which we are not going to preserve the sphincter. Otherwise in these three we are going to preserve the sphincter. सबसे अच्छा कौन सा होता है? Which one is gold standard for preserving the sphincter? It is lift. It is lift. Clear? So what is lift? It's ligation of intersphincteric fistula tract. So it is sphincter preserving technique. Fistula leisure closure phylac. That is fistula leisure closure. This is also to some extent, yes, it is going to preserve the sphincter. So in this case, what we do, we are going to insert a laser fiber to seal the tract from within. Waft में भी हम क्या करते हैं? We are, that is video assisted anal fistula treatment. So what we do, we are going to cauterize the whole tract. Phylac, okay? नहीं, it was fistulectomy, guys. Best है sphincter preserving के लिए we go for lift, ligation of intersphincteric fistula tract. We can go for phylac also. Waft भी हम करते हैं, but fistulectomy आजकल हम नहीं करते because it is going to create the wound and what sphincter can be injured. Okay. Next question. What is the main electrolyte abnormality underlying refeeding syndrome? Guys, tell me. What's the problem in refeeding syndrome? Yes, main electrolyte. I'm waiting for your reply. Let me see how many of you mark the correct answer. Main electrolyte. Very good. Hypophosphatemia. देखिए, what is the big problem in refeeding? Initially, the substrate is fat. And when you start the feeding, you are changing it to sugar or carbohydrate. Because of increased carbohydrate, there is increased insulin secretion. And because of insulin secretion, what will happen? Most of the electrolytes like potassium, magnesium, phosphate, all these are going to enter into the cell. And if all these are going to enter into the cell, what will happen? Tell me. Hypokalemia, hypomagnesemia, hypophosphatemia. Which one is most dangerous? The most dangerous is hypophosphatemia. And can you tell me why this hypophosphatemia is most dangerous? Because it leads to, remember, respiratory failure, cardiac arrhythmia, seizures and death. So there can be hypophosphatemia, hypokalemia, hypocalcemia, hypomagnesemia. क्योंकि phosphate calcium के साथ bind कर जाता है. Clear? So what is the problem here? Most important, it is hypophosphatemia. Clear? So that is hypophosphatemia. I hope everybody marked the correct answer. Everybody marked the correct answer? Right. Now see the next one. This was the questions. Guys, see the language. The same question was there in exam or there was some modification? Tell me. In laparoscopic inguinal hernia repair, what is the minimum distance of dissection below inguinal ligament to adequately expose the myopectineal orifice? Yes, Vipul, वो question आ गया है. आ गया question. Vipul, same question था. Very nice, very nice. और हम लोगों ने discuss किया कि जितने question आए थे सब में correct answer कितना था? 2 centimeter. So it was 2 centimeter. Yes, Cooper's ligament was asked. So we have to expose myopectineal orifice till 2 centimeter. Okay, don't worry. There might be some modification of the language. Right? I'm going to discuss, don't worry. So to adequately expose inferior boundary of myopectineal orifice, especially Cooper's ligament. Somebody wants to say कि sir, myopectineal orifice की जगह Cooper's ligament था and femoral canal. The pre-peritoneal dissection must extend at least 2 centimeters below the level of pubic bone and inguinal ligament. Why? Because You have to rule out concurrent defects. There might be some hidden defects. You have to cover that also. And at least how much overlap should be there around the mesh? 2 centimeter. So at least how much overlap should be there? 2 centimeter. 2 centimeter. Clear? So here, remember it's 2 centimeter. Rule out concurrent defects and prevent the mesh failure. Overlap should be at least 2 centimeter. Okay. Space of red GS was also mentioned. Not a big deal. How much coverage should be required, guys? 2 centimeter below the level of pubic bone and inguinal ligament. Okay. Now see the next one. This is easy question. Can you see? You can see this picture. Can you tell me what is this organ? On ultrasound, can you tell me what is this organ? Easy question. Tubular, blind, ended. Can you tell me what is this organ? This was not even the question. Okay. Now read the language. Patient undergoes ultrasound guided procedure. Very good appendix, everybody's correct. So patient undergoes ultrasound guided procedure and subsequently develops pain in right iliac fossa. Ultrasound images as shown after 48 hours, pain persists and worsens. What is the next best step? Okay, one was plain ultrasound and one was deeper. Before and after. Okay, not a big deal. So it was appendicular lump. Okay. One was of appendicitis and later patient developed appendicular lump. Let me tell you, if patient is not going to improve, obviously you have to confirm whether patient is having appendicitis or not. You have to rule out whether patient is having a lump or not. दोनों के लिए हम क्या करेंगे? CT. Let me tell you a simple principle. Any kind of procedure is performed in abdomen. Any kind of diagnostic or therapeutic procedure percutaneously. Any kind of procedure is performed, it can lead to either visceral perforation, it can cause hematoma, it can cause abscess, or there might be lump. For all these cases, which investigation should be done? And everybody is correct. Yes? CT. Somebody is saying कि sir, ultrasound guided procedure था. ये लिखा हुआ है guys. This is already mentioned. Ultrasound guided procedure or ultrasound guided aspiration. Most probably patient might be having what? Abscess. Clear? Because of that, ultrasound guided aspiration was done, but patient is not improving. Confirm the finding. So go for CCT. Yes, go for CCT. Best step in management. Next best, immediately you are not going for surgery. Yes, after 48 hours, pain persists and worsens. First, confirm the diagnosis. Without diagnosis, you cannot proceed. If patient is having lump only, just go for Ochsner-Sherin regime. And if patient is having appendicular perforation sometimes, in that case, we go for surgery. So what you go for? You go for, yes, 2 images. 2 images tha, ek appendicitis ka, and one was of lump. 2 images were there. 2 images. And guys, what's the correct answer here? Yes, correct answer is go for CCT. Let me tell you, before starting conservative management, you should confirm. So we go for CCT. Guys, now you can see. Now I'm audible. Audible now. Okay. So I'm repeating it. Don't worry. I'm repeating. Very easy question. You can see the first one. Assertion. Assertion is always examine the superficial inguinal lymph node in patient presenting with testicular or scrotal swelling. So obviously it's correct. It's correct. It's correct. And lymphatic drainage of the testes is to superficial inguinal lymph node. No, it's the scrotal lymphatic drainage which goes to inguinal lymph node. Testis का lymphatic drainage कहाँ जाता है बताइए? It goes to para-aortic. So you know it goes to para-aortic. Goes to para-aortic. So you know that assertion is correct. Region is false. So A is true, R is false. A is true, R is false. I hope everybody mark the correct answer. Okay, no testicular. ठीक है? So always examine superficial inguinal lymph node in patient presenting with, even if we remove testicular, then also this is correct. Only scrotal mass, then also it's correct. Then also it's correct. ठीक है? और region में बताइए lymphatic drainage of testes. Lymphatic drainage of testes to superficial inguinal lymph node. यहाँ पे guys tell me there was testis or there was only scrotum? Tell me. There was testis or only scrotum? Testis or only scrotum? I'm waiting. If only scrotum, then it will become correct. अगर दोनों में सिर्फ scrotum था, so region correct हो जाएगा. So both A and R will be true and R is correct explanation. So it depends. It depends. अगर scrotal था, some people are saying testis, some people are saying scrotal. I'm discussing both. If it is testis, then it's wrong. If it is scrotum, then it's correct. और दोनों में अगर scrotum था, in both, if it was scrotum, then both A and R were true and R is the correct explanation. So it depends. Doesn't matter, guys. It depends what was there. Okay? You can interpret accordingly. So, guys, these were the questions. I hope you did well. So, all the best. All the best. The rest of the faculties are waiting. You can check other subjects' question. All the very best for the result. It was nice interaction with all of you. Thanks, guys. Thanks. Thanks a lot.
Good evening, dear friends. This is Dr. Jambakesharan and PrepLadder's orthopedic faculty for you. So we are on recall session, and this is our orthopedic session. Okay. So roughly we got. Can somebody just say? Just give me a thumbs up sign in the chat box. Hello. Anybody? Able to see me and visible clearly? Hello. Just give me some thought. Yes, yes. Hello. Somebody just give me a thumbs up sign. Hello. Yes, okay. Right. So we got roughly some 7-8 questions in orthopedics. 7-8 questions in orthopedics. Most of them they had framed in a clinical fashion. So we'll straight away we'll go to the first question. A 25-year-old patient was injured in an RTA. He had unstable vitals and London sign positive. London sign positive. What is London sign in general medicine? We would have read this London sign in blunt injury abdomen. When you see a patterned abrasion, that is called the London sign. For example, the abrasion takes the pattern of the object which hit it, the abdomen. That's called London sign. So whenever there is a London sign, it says that the internal organs are damaged very seriously. That is why they are given unstable vitals and London sign. Okay, so it is a polytrauma case. So the patient has a right hand tenderness with bilateral tibia as well as femoral fractures. Bilateral tibia as well as femoral fractures. So what they did they stabilized the patient hemodynamically. What will you do next? That is the question. After stabilizing the patient hemodynamically, okay, what will you do? So that is the thing, right? So yes, sir, yes, sir. Now I am able to see a lot of chatting. Good. Okay. So the answer, ortho too tough, not tough, man. The question they are asked in a clinical fashion and you are not able to get it's not a single liner. That's the problem. Okay. Options. There was an option according to surgeon's experience. Yes. See, instead of external fixation for both tibia and femur, one option was according to surgeon's experience. Surgeon experience one was to throw us. Okay. So this was the thing. See, next thing after stabilizing the patient, we should go for definitive management. And in the question, I inquired 2 or 3 of my students. They said compound fracture, that word was not there. Open injury was not there. When open injury is not there, external fixation is directly ruled out. It is directly ruled out. So you should go for definitive fixation. Definitive fixation for lower limb fracture is nailing. If they had given the choice, pure nailing, go for nailing of both femur and tibia. If they are given nailing and plating, okay, nailing of tibia, nailing and plating, you have to go for that. Okay, so I am asking you a question, dear friends. Did in the 4th choice, nailing of both femur and tibia, any choice was like that? Just give me your this thing. Yes. Yes. The option should be nailing or external fixation of both. Oh, an option should be nailing or external fixation based on surgeon's experience. Okay. So they had not. So the best thing is they had given both, sir. Okay. So then, see, nailing or external fixation according to, see, one choice from the chat box, I got a thing, nailing or external fixation based on surgeon's experience. There is nothing mentioned about compound fracture. When compound fracture is not there, you should not do external fixation. You should not do external fixation. External fixation is indicated only for compound fracture. So it should be nailing and plating. Okay. Quick nailing was there in both option 1 and 2. Okay. So nailing for both femur and tibia should be the right answer. Okay. We will move on to the next question. A patient involved in RTA presents with raised intracompartmental pressure of 90. Okay. So obviously it is a compartment syndrome. What is the most appropriate management? Most appropriate management for the second question is emergency fasciotomy. Is emergency fasciotomy. Okay. So this is the emergency fasciotomy. This is the best answer. So there is no controversy in this question. Okay, good. Most of you have answered it A. Excellent. Okay, so excellent. Pulselessness was there. All these are signs of compartment syndrome, otherwise called Volkmann's ischemia. Very good. We will move on to the third question. Based on the image given below, what is the most appropriate? They had given an MRI finding of tendo, and they had shown something highlighted about rupture of the tendo oculis. Rupture of the tendo oculis. So what's the most appropriate answer? So they had asked a clinical sign that is concerned with tendo oculis injury. Tendo oculis injury, we all know, the great sign is called Thomson sign. The sign is called Thomson sign. What is Thomson sign? Put the patient in prone position, flex the knee joint to 90 degree, just squeeze the calf muscle. If, for example, you just look at me, you see, you imagine this, you see, you are seeing you can imagine this as my leg. This is the tendo oculis area. This is my foot. When I squeeze the calf muscle, foot should go for plantar flexion. Foot should go for plantar flexion. This is normal. In tendo oculis injury, when I squeeze, my foot has no action. This is called the positive Thomson sign. Okay, that's called a positive Thomson sign. So that is the most appropriate thing that will fit. Okay, no rupture was there. What is the management for this? Last option was IA corticosteroids. Sir, according to me, there was no tender Achilles injury and the answer should be apply cast. What was, see, this is the picture that they had given me. This is the picture which I received. Okay. So they said that they have asked the management. They had asked the management. Okay. No Gover sign. I did steroid, no tendon rupture. So they asked the management means I need the exact picture. What is the exact picture? Okay. Was it if it is a case of tendo oculis, just a strain, the best thing is POP application. Apply a plaster cast. Okay. Apply a plaster cast. So I need the correct picture, right? So no tendon rupture. If you are sure, if it's a tendon sprain, that was the thing. The tendo oculis rupture image was not given, then better go for POP. Okay, application of POP. We'll move on to another question. A 2-year-old child with history of injury to the knee long back now presented with varus deformity of the left knee. The deformity didn't get corrected even when flexing the knee. See, the important point here is, dear friends, you see, the deformity didn't get corrected even in flexion of knee. So you should be able to differentiate whether this is a case of genu varum or tibia varum. When you flex the knee, genu varum may get corrected. Tibia varum won't get corrected. So this question is about tibia varum. And in that question, blood reports are normal. That's what given. What is the diagnosis? Okay, what's the diagnosis? Blood reports are normal. Straight away rules out these rickets. It rules out rickets. Blood reports are normal. So he had a history of injury long back. So this can be this image, everything when you take into account, this can be a malunited upper tibial fracture. It can be a case of malunited upper tibial fracture. Okay. Yes. We will move on to the next question. A patient injury given. A patient, yeah, tibia varum. Okay, right. So a patient, a patient presents with normal serum calcium, low phosphorus level, elevated parathormone. Okay, raised alkaline phosphatase. What's the most likely cause? Obviously, this should be a case of secondary hyperparathyroidism due to vitamin D deficiency. Okay, so that should be the answer because we read Humpty number of times. Serum calcium is not a good marker in case of rickets because once there is low serum calcium, that will trigger the parathyroid hormone, which will come and the level of vitamin D will become normal. The only consistent marker is elevated serum calcium. So, secondary hyperparathyroidism due to vitamin D deficiency is the most fitting answer for this. Okay? Yes. Now they had asked a question, this we discussed in LRR of our INI-CET. This again, they had changed the question. A patient with previous history of tuberculosis completed ATT, now presents with low backache, and they had given an MRI finding like this. Okay, what is the most appropriate next step? What's the most appropriate next step? The previous question, somebody had said that the last option, somebody is giving the answer, last option is osteomalacia. Osteomalacia, okay. So, but even if it's osteomalacia, the secondary hyperparathyroidism, because the question elevated parathormone level is there. So that is the best answer, okay. Yes. So, what is the next best management? What's the next best management? That's the question. See, fourth option, I don't know. They are not given the fourth option. They are given only three options: needle biopsy, CT chest MAN2. Okay, fourth option they have not given. Anybody knows the fourth option? Okay, they had given protein electrophoresis. Okay, so even whatever they had given, see, a patient already a known case of pulmonary tuberculosis, completed the medication, now complains of low backache. They took an MRI. MRI shows a lesion. If you want to confirm the biopsy, it should be culture and sensitivity. Culture and sensitivity is not there, so better go for needle biopsy. That is the best answer. Okay? Yes. We'll move on to the next question. What is seen in neuropraxia? This again a very straightforward cakewalk question. Neuropraxia is nothing but physiological conduction block. It is physiological conduction block. No injury. Okay. Physiological conduction block. Neuropraxia. Yes. Good. We'll move on to the last question. A child has a feature suggestive of septic arthritis, which shows sensitivity to oxacillin and ceftazidime. What is the drug management you will give? Okay. When you read that, cloxacillin is there in the choice. Okay. Penicillin is a vague answer. It doesn't need vancomycin or meropenem. So better go for cloxacillin. So in short, the given question and choices, I am not 100% sure. The given question and answers, these should be the most appropriate answers. Okay. So we will come. Okay. So let us see. Right. So all the best, dear guys. Okay. All the best. Okay. These are the 8 questions we had discussed. The questions which I got, the probable answers for this from the choices that is given. There may be some disparity. We will see in the future. Okay. So thank you so much, dear friends.
Can we start? So, good evening. Welcome. I know you have done your part. You have prepared adequately. You wrote your exam, and now you're here for a recall session. That by itself tells you that you have been focused all along, and you remain focused. And you're here to know about what you would get in the future. So past is past. Do not worry about any of the silly mistakes that you've committed. Please remember, you're here only to know where you are. Okay. So about INI-CET May 2026 biochemistry session, this is an overview of what we saw in this paper. There were totally 16 MCQs. Covering 6 topics, and there were 3 image-based questions, and I would say 44% of the questions were easy and 25% were hard. Hard in the sense they were not based on previous year question papers. Okay, so about the topics that were covered, as always, right? This has been always a trend, as always. Genetics and molecular biology put together, there were 5 questions, 5 out of 16, and that is followed by metabolism. Amino acid and protein metabolism always has been frequently asked. So 3 questions from that topic, carbohydrate metabolism, 3 MCQs. And clinical biochemistry 2, bioenergetics 1, and then oncology, I would say 1, and then pharmacokinetics 1. I've included pharmacokinetics here because it's about order of reaction. Okay. So with that introduction, let's start discussing the MCQs that we found in the latest INI-CET May 2026. The first MCQ, I would say, is a clinical MCQ, hypertriglyceridemia seen in all of the following conditions except. I'm not going to get you into the suspense mode, starting to explain everything. Let me give you the right answer first and then give you an explanation for it. The right answer for this MCQ is A beta lipoproteinemia, right? Yes. So the answer for this question is A beta lipoproteinemia. As you know, it is because of the defect of MTTP protein, triglyceride transfer protein, which is not able to transfer triglyceride to ApoB. So any lipoprotein which has got ApoB will not be able to carry triacylglycerol. So serum triacylglycerol level in this condition would be low. There is an expected low level of chylomicron, low level of VLDL, hence triglyceride level in A beta lipoproteinemia is expected to be low. But apart from that, as you all know, in type 2 diabetes, there is hypertriglyceridemia, high fructose diet. This we discussed even in the LRR session. I told you specifically when compared to glucose-based diet, fructose-based diet is even more lipogenic. Nephrotic syndrome is characterized by hypertriglyceridemia. So the answer for this MCQ is choice C. Very easy paper. Yeah, I would say yes, it was very easy. When it comes to biochemistry, almost all MCQs we had already discussed except for this addiction, right? Cancer addiction. Apart from that, everything else we had discussed. So which of the following vitamins or coenzymes plays the most important role in transamination reaction? This we have discussed so many times. Transaminases are dependent on B6 or pyridoxal phosphate, right? So the answer for this MCQ is choice B. B6 or pyridoxal phosphate is necessary for transamination reactions. I've also told you this is also necessary for decarboxylation reactions. So the answer for this question is choice B, pyridoxal phosphate. Many are saying INI-CET is much easier when compared to FMGE. Yes, I always say this, do not underestimate FMGE papers. Lately, FMGE paper has been very difficult. I won't call it as difficult. It has become completely clinical, right? So this MCQ, Benedict's test is positive with all of the following substances except. Haven't we been discussing that sucrose is a non-reducing disaccharide, right? Sucrose being non-reducing does not answer Benedict's test positively. So the answer for this MCQ is choice C, because it's a disaccharide which is made up of glucose and fructose, and the linkage that is present in sucrose is alpha 1, 2, and that makes it non-reducing. I've also told you all monosaccharides, be it glucose or fructose or any monosaccharide is reducing. And what did we learn about ascorbic acid or vitamin C? What did I say? Vitamin C is an antioxidant, meaning it's a reducing substance. So this MCQ we have clearly discussed. The answer for this MCQ is choice C, which is sucrose. The next one, this we discussed, right? Match the following acid-base disorders with the most appropriate clinical condition. So haven't we discussed that glycol poisoning or any alcohol poisoning, alcohol becomes an aldehyde, that becomes an acid. So that causes metabolic acidosis. Metabolic acidosis is caused by an alcohol poisoning, which is glycol poisoning. Metabolic alkalosis, we know vomiting causes metabolic alkalosis. So pyloric stenosis causes metabolic alkalosis. I even explained you the mechanism behind why vomiting causes metabolic alkalosis. This is not for that. So I'm going to give you straight away the answer 2 to be paired with B. Respiratory acidosis. We know bronchopneumonia causes respiratory acidosis because gas exchange is affected. Respiratory alkalosis, we know, is caused by hyperventilation. So what is the right answer? Metabolic acidosis to be paired with D. 1 to be paired with D. 2 to be paired with B. That by itself gives us the right answer, choice A. Okay, so all that you will have to know is alcohol poisoning causes metabolic acidosis, vomiting causes metabolic alkalosis, bronchopneumonia affects gas exchange, that causes respiratory acidosis, hyperventilation, you wash away carbon dioxide, that causes respiratory alkalosis. So the right answer is choice A. Okay. Which of the following enzymes are active in the dephosphorylated state during glucose metabolism? So I've told you dephosphorylated state is done by insulin, right? Dephosphorylated state is done by insulin. Insulin is an anabolic hormone. So all anabolic enzymes will be stimulated by dephosphorylation. With that in mind, look at these choices. Glycogen synthase mediates glycogen synthesis, that is anabolic, that is stimulated by a dephosphorylated state. Glycogen phosphorylase mediates glycogenolysis, that is catabolic, that will not be stimulated by dephosphorylation. And then PFK2 fructose 2,6 bisphosphatase. I told you PFK2 and fructose 2,6 bisphosphatase are two enzymes of a tandem enzyme. Fructose 2,6 bisphosphatase is a catabolic enzyme that will not be stimulated by dephosphorylated state. So the answer is phosphofructokinase 2 as well. So just remember this, yeah. Suppose you're writing another exam, the upcoming NEET PG also you're trying. In that case, all that you will have to remember is dephosphorylated state, meaning anabolic, right? Only anabolic enzymes get activated by dephosphorylation. So look at all the choices given. choose those enzymes which are anabolic enzymes which get activated by dephosphorylation. Here, glycogen synthase is stimulated by dephosphorylation. PFK2 is stimulated by dephosphorylation. So the answer is A and C. Okay, choice C. PDH was also there. If there was PDH, then that also gets activated by dephosphorylation. PDH also gets activated by dephosphorylation. Okay, Ramya, ready? In that case, it would be anything other than glycogen phosphorylase. All the other three enzymes get activated by dephosphorylation. Okay. If there was PDH, it gets activated by dephosphorylation. Which of the following enzymes is responsible for synthesis of RNA primers during DNA replication? Did we learn about this? Yes. In the not in the recall session, in the rapid revision session, I told you specifically DNA replication needs RNA that is synthesized by RNA primase. So the answer here is choice B. The answer is primase. Okay. Options were different. PDH is anabolic. So we have come to the next MCQ. And in this case, DNA polymerase 2. DNA polymerase 2 helps in proofreading and repair activity. DNA polymerase 3 is the main enzyme of replication in prokaryotes. And DNA polymerase 3 helps in leading strand synthesis as well as in Okazaki fragment synthesis. So the answer here is primase. Good evening, Ramanathan. Which of the following techniques is most suitable for analysis of FFP tissues, right? Formalin fixed paraffin embedded tissue section. The answer is immunohistochemistry. So in immunohistochemistry, all that needs to be preserved is antigen. And in formalin fixed paraffin embedded tissue section, antigenicity is preserved. So immunohistochemistry would prefer this tissue. Okay, whereas if you look at flow cytometry, the answer is choice A, everybody. But if you look at other choices, flow cytometry needs a single live cell. It should not be fixed. Okay, it needs a single live cell. Western blot just needs a protein. It does not even need the tissue, right? You don't need tissue at all. You need to remove the antigen and then allow it to react with the antibody. For fish also, FFP can be used. Okay, for fluorescent in situ hybridization also, we can use FFP. But among these choices which are related to proteins, I would go for immunohistochemistry. Because in the case of fish, we are going to detect DNA or RNA. Okay, so the answer here is choice A. Yeah, if the question was to see proteins, then it goes without saying it is immunohistochemistry, because in situ hybridization is for detecting a DNA or for detecting an RNA. Which of the following is true regarding incomplete penetrance? The name by itself tells you everything. It's self-explanatory, right? Incomplete penetrance meaning there is a genotypic defect. Right? There is a genotypic defect, but you don't see an effect on the phenotype. Phenotypic effect is not seen. This is called as incomplete penetrance. So this is characterized by generations getting skipped. So what is the right answer? When a self-explanatory question, even if you knew nothing about genetics, incomplete penetrance, some generations are skipped. So the right answer is choice A. Okay. Western blot MBBS Medico, the question was FFPE tissue. For Western blot, I don't need a tissue. I remove the protein from the tissue. I allow the protein to react with antibody. Do you understand this? The question was FFP is used for which of the following techniques? That is why it is not Western blot. Okay. The next MCQ. So this image was given, something similar to this was given, and I know there was Cas9 which was labeled in the image. So Cas9 CRISPR system is used for gene editing, right? I think the choice was gene editing. If I'm right, If I'm wrong, please make corrections in the chat. I'm not audible. Am I audible? I'm not audible. Yeah, answer is choice A. It was not labeled. I think there was a scissor, DNA scissor, which is cutting, making a double-stranded DNA break. Anything which creates a double-stranded DNA break, remember CRISPR-Cas enzyme. I've told you Cas enzyme is an endonuclease which creates double-stranded DNA break. So it is all about CRISPR-Cas9 mediated gene editing. Okay, it is not interference. It is not interference. Had it been interference, they would have shown you just a single-stranded RNA hybridizing with an mRNA. That would have been interference. So answer is CRISPR-Cas system gene editing. Okay. The next MCQ. Which of the following amino acid classifications are correctly matched? Right, on the live YouTube session that we conducted, I discussed about classification of amino acids. I also gave you examples. Uncharged amino acid is cysteine. Cysteine has a sulfhydryl group. It is uncharged. Let me tell you the answer first. The answer is all of the above. All these are correctly matched. Uncharged amino acid is cysteine. Non-polar amino acid is proline. As you all know, proline is an amino acid which is non-polar. And then for basic amino acids, I gave you a mnemonic. The mnemonic which I gave you is HLA, histidine, lysine, and arginine. So all these are true. Okay, so answer is choice D. There was an option which said microRNA technique. Also, Cas9 was not in the image. Okay. So microRNA, miRNA is a precursor of siRNA. Had it been siRNA, they would not have given you the DNA scissor. All that siRNA does is it just goes and hybridizes with the mRNA and then the mRNA is fragmented. Okay. So this is not interference phenomenon. This is CRISPR-Cas9 mediated gene editing. Okay. All of the above was not in the option, only 2 options correct. Okay. So was there uncharged amino acid with cysteine? If that was this combination, that is true. Non-polar amino acid is proline. And basic, these 2 are basic amino acids. Okay, this was interchanged. Okay, then C and D are right. Basic amino acid is histidine. Basic amino acid is lysine. Cysteine is not non-polar. Cysteine is polar but uncharged. Do you understand this? Cysteine is polar but uncharged. Had they matched cysteine with non-polar amino acid, that's not the right combination. Basic amino acids is histidine, lysine, and arginine. Okay. So an assertion reasoning MCQ, glycome is more diverse than the proteome. That is a true statement. Because glycomes are more diverse because there can be multiple types of linkages that are possible. Don't we know that? In the case of carbohydrates, alpha 1, 1, 1, 2, 1, 3, 1, 4, 1, 5, 1, 6, beta 1, 2, 1, 3, 1, 4, 1, 5, 1, 6, and then there is a branch point. So using all these linkages, you can create diverse molecules. So please remember glycome. Glycome is a kingdom of carbohydrate that is more diverse than the proteome, which is a kingdom of proteins. And the reason is various linkages are possible. So what is the right answer? Both assertion and reason are true, and reason is the correct explanation for assertion. Okay. So the right answer is choice A. Which of the following statements regarding hormones and their metabolic actions are correct? So what are the right answers here? Insulin increases protein synthesis. That is a true statement. Thyroxine, no. Thyroxine increases the basal metabolic rate. That is a false statement, right? It does not decrease, it increases the basal metabolic rate. Yes, insulin decreases blood glucose levels. And epinephrine increases glycogenolysis. Glucagon increases gluconeogenesis. Okay, so which is the false statement here? Thyroxine decreases basal metabolic rate is a false statement. We know thyroxine increases the basal metabolic rate. Okay, so the true statements include choice A, C, D, and E. Thyroxine decreases blood glucose level was given. That is a false statement. Thyroxine decreases blood glucose level. If that was a statement, that is false, because thyroxine increases the blood glucose. As you know, thyroxine causes upregulation of GLUT transporters across enterocytes, and thyroxine causes alimentary glycosuria. So that is a false statement. Okay. Anything else that is wrong among these options? So the true statement is insulin increases protein synthesis, insulin decreases blood glucose levels. Epinephrine and glucagon, they are hyperglycemic hormones, so they stimulate glycogenolysis and gluconeogenesis. Okay. Choice A is also wrong. Insulin increases protein synthesis. Dr. Venki, if thyroxine decreases blood glucose was one of the options, that's a false statement. The next one, uncoupler. We learned about uncoupler in and out. A patient is exposed to an oxidative phosphorylation uncoupler. Which of the following changes is most likely to be observed? As you all know, uncoupler uncouples oxidation from phosphorylation. Oxidation happens continuously. If oxidation happens continuously, it means oxygen is utilized more. Okay. And what is not happening? Phosphorylation is not happening, which means ATP is not produced. So we already know two answers. There is low ATP production. There is increased oxygen utilization. If there is no ATP production, energy will be liberated out as heat. So there is increased heat production. So what are the right answers here? Here, increased ATP production, no false statement. Yes, decreased ATP production with increased oxygen consumption and increased body temperature. So the right answer is choice B. Very good. Yes. So this graph was shown, elimination kinetics. As you all know, this is first order kinetics. Had it been zero order kinetics, what should have happened? Irrespective of whatever is happening in the medium, as time passes, concentration should have decreased linearly. In that case, you would have called it as zero order kinetics. In this case, you don't see it as zero order kinetics, it is first order kinetics. You respect me for saying what? Semi-log graph, yeah. Semi-log graph. This is first order kinetics. Okay. Now, oncogene addiction, right? Now, it is all about oncogene addiction. Till some time back, we were saying HER2 expression in a cancer cell means bad prognosis. Now, that's a good news because we have HER2 inhibitors, right? Similarly, BCR-ABL translocation. In that case, we have a specific targeted therapy. So, oncogene addiction is nothing but a cancer cell getting addicted to one particular pathway for survival. Do you understand this? A cancer cell getting addicted to one particular pathway for survival. If you can identify that specific pathway, then targeted therapy is going to be easier, right? For example, EGFR. If a tissue expresses EGFR more, then EGFR inhibitors can be a targeted therapy for this patient, right? And if there is HER2 expression, HER2 inhibitor, monoclonal antibody directed against HER2 receptors will help the patient. So that is about oncogene addiction. So the right answer here is choice A. Depends. The cancer cell depends predominantly on a single oncogenic pathway for survival, allowing targeted therapy against that pathway. So the right answer is choice A. A newborn with craniofacial defects. Haven't we discussed about this multiple times? Yeah. Hypotonia, seizures, and serum shows high, very long chain fatty acids. So that is classical of which disorder? Peroxisomal biogenesis disorder, which is Zellweger syndrome. right? I told you this specifically in Zellweger syndrome. There is severe hypotonia, several developmental defects, and serum shows very high, very long chain fatty acids, high branch chain fatty acids. So if you see all this, that is Zellweger syndrome, which is peroxisomal biogenesis disorder. So the right answer is choice A. Happy to see that you're all saying it was easy. Yeah, biochem, I would say, was very easy. Okay, because all these we have discussed except oncogene addiction. Answer is choice A. So these are the 16 MCQs that were asked in biochemistry in the latest INI-CET May 2026. And when all these MCQs were based on previous year questions. So the take home message for all of you here is, if you're very clear about previous year topics, then you will be able to get any rank or any seat of your choice in any of your competitive exams. So always focus on previous year question papers. Yeah. So thank you. You got 3 wrong. Please don't worry about it. Yeah. You have done your part. Thank you.
Hey, also, welcome back. So, you just had your INI-CET session today. I hope the exam went well for all of you. So, just a quick look at the questions now, guys. Yeah, just a quick look at the answers, the questions from PSM. Now, before I show you the questions, guys, again, this is completely recall based, everybody. But yeah, trust me, PSM was very conceptual this time. I would say that to my shock as well, there was no biostats, but then it was a conceptual paper where you have to think a bit, guys. It's not like we haven't touched those, but then it requires a little bit of thought from your end. But then, whatever all said and done, the paper is over. Relax, just have a look at the answers. And anybody who's preparing for NEET, PG, FMGE exams, we really have to give PSM a kick because it's going to be a rank decider subject. Okay, so let us have a look, guys, at the first question. Now you can see something came like this. Now again, this is a recall, so we'll try to get closer to the answers, guys. Researcher compared the per capita alcohol consumption and prevalence of liver cirrhosis in 10 different countries. Countries was your buzzword. This topic we have done very many times. I would say it was a PY2, indirectly a repeat of a PYQ, and any study design where the unit of study is population. What is your answer, guys? I hope each one of you wrote that. Ecological study design. Okay, are you able to see the question, everybody? Yeah, Okay, so here the answer was ecological study design. As for me, if this was what was asked, countries, it was ecological study designs. Okay, chalo, let's move to the next one. Name 3 components of attitude. Did we have a question like this where they asked you components of attitude? So this we cover in sociology, guys. There is an ABC model for attitude. Okay, ABC model, we have talked about it in classes also. There is an affective component, which means emotional related to feelings. Then there is a behavioral component based on what you are going to do, and then there is a cognitive component. So if this was the question, your answer over here becomes, if this was the question, guys, your answer over here becomes, as for me, cognitive, behavior and affective. Okay, I hope you were able to get closer to this question. Okay, it was just a simple question from sociology. We repeat this in sociology also a couple of times. Okay, now did you have a question like Pearl index ka definition? I'm not very sure of this one, but some of you did send this question out that there came something like Pearl index. Okay, Pearl index, you all know Pearl index कैसे express करते हैं? Accidental pregnancies 100 woman years, so number of pregnancies per 100 woman years of exposure. I would have preferred writing here accidental. That would have been a slightly better answer for this question. If it was there, then B is the answer. Okay, I'm not taking too much of your time, guys. We will do it again quickly. If this was there, this again is a PYT. I'm just mentioning attitude wala bhi ek PYT hai, but aisa nahi hai ki sab PYT the. You will see a couple of questions in the later half of the session, which were something, one question was a very nice question, which was, I will get to that question. Okay, chalo. Iska answer kya tha? Guys, what was this? In a community study, it was okay, if it was pregnancy loss, Abhishek, I would prefer going to this, because देखो ऐसे options में ना हम लोग को बहुत accurate options नहीं मिलते हैं, so we try to get closer to that. Otherwise, you all know Pearl index is number of accidental pregnancies reported. ठीक है, 100 woman years of exposure. That's how we express it. But this, I would want each one of you to do it correctly. Did you do this question correctly, guys? ये question था, in a community study, it was found that 2/3 of stroke patients had hypertension as a risk factors. Researchers concluded that reducing hypertension in the population could substantially decrease the burden of stroke. So what is the answer over here, guys? When you talk about population, everybody, when you talk about population, इसमें क्या हो जाता है? Very good. The answer straight away becomes population attributable risk. Okay, this has been asked many times. If the buzzword over here, please look at the buzzword, guys. Buzzword यहाँ पे क्या था? Buzzword यहाँ पे population था. अगर population है, then the answer automatically is population attributable risk. And this was 2/3. उसको आप percentage में भी कर सकते हो. ठीक है? Okay, chalo, let's go to the next one. Now, I didn't exactly get the wording of the question, but as far as I know that you were given to calculate odds ratio. Again, this was the PYT. Odds ratio, you know, is calculated from a case control. You just have to remember the correct order of ABCD. It's a Z, guys. ABCD. अगर ऐसा था 2/2 टेबल दिया हुआ था, अगर 2/2 टेबल नहीं भी दिया हुआ था, तभी भी आपको पता है, you had to figure out from the words. Then odds ratio is cross product ratio AD upon BC, which you guys, everybody 80 into 60 by 20 into 40 है ना. तो इसका आंसर तो बहुत ही अच्छा है. इसका आंसर was 6, which means odds ratio was more than 1, which means we are talking about a risk factor over here. ठीक है. Can I move to the next one, guys? Not taking too much of your time. I know abhi exam khatam hua hai. Let's quickly just have a look at the answer. Now, nested case control is the previous year topic. Okay, we discussed in LRR also, but the way they have put out the question really speaks a lot about this question, guys. Now, see, I needed very correct statements to give you the most correct answer here, guys, because I was not there in the exam, so we're trying to get closer. See, now you all know that nested case control is a smaller case control, or is a case control in a bigger cohort. I write smaller.
Okay, what is it? It is a case control, guys, in a bigger cohort, है ना, bigger cohort. तो अगर यहाँ पे लिखा रहेगा nested case control study gives a better, I would not say better सही word है, it would have been written valid or precise estimate of odds ratio. This is true. Of course, nested case control is a case control only within a bigger cohort. And the best thing about nested case control is, guys, that, you know, because cases and controls have been derived directly from the same well-defined cohort, recall bias या selection bias सब reduced हो जाता है. So of course odds ratio is a better estimate. ठीक है. Now reason देखो, it is derived from a cohort study. First statement only, if you see it is derived from a cohort study, yes, this is absolutely true. You derive nested case control from a cohort. It's a smaller case control in a bigger cohort. And can you measure incidence? Of course you can measure incidence, because study subjects are followed over a period of time, and percent time risk, okay, percent time risk is precisely known. We know that percent time risk is precisely known, so we can very well go and calculate the incidence from here. Okay, so reason, if you see, if you look at this, because availability of percent time data precisely makes, okay, availability of percent time data, this line is very important according to me. Availability of percent time data precisely makes OR estimate, okay, OR estimate mathematically valid, OR estimate mathematically valid. इसीलिए मैं बोलूंगी अगर term valid था यहाँ पे, तब according to me B should be the answer. ठीक है, because it is a smaller case control in a bigger cohort, तो आप follow up कर ही रहे हो, so you have an idea of person years, so it gives you person time, your risk is precisely known, so it makes OR estimate mathematically valid. Okay, अगर ऐसा क्वेश्चन था, even better term I would not say is a very correct word over here. The term should have been valid or more precise estimate. ठीक है. So again मैं stress करूंगी, nested case control is the PYT in INI-CET, but the way they have asked the question is where we have to, you know, try to get a hold of our main videos and try to get the concept from them. ठीक है. Chalo, let's see this one. Did you do this question? If it was framed this way, then it was a beautiful numerical which came. It is a PYT, guys. Again, a screening test was evaluated in a population of 1,000 individuals. Out of 100 individuals who truly had the disease, the test correctly identified 90 as positives. बताओ कितना अच्छा question था. And we had done this in our LRRs also. We had revised this topic many times. ठीक है. So what is the answer over here? Yes. So यहाँ पे ऐसे हो जाएगा ना guys, देखो disease, you did not actually need to draw the 2x2 table. I'm only trying to help you out with the understanding, positive, negative. बहुत जल्दी बताती हूँ. First row all positives, TP, FP, FN, TN. ठीक है. Now out of 100 individuals, so 100 was here who truly had the disease. Test identified 90 as positives. Okay. Actually, additionally 50 individuals without the disease, guys, जिनमें नहीं था, were also tested as positives. So this 50 became your false positive. So what is your PPV, guys? It is TP upon TP plus FP into 100. So I think most of you got it correct. 90 plus 50 कर दो, है ना, into 100 कर दो, 90 upon 140 into 100 कर दो, around 64% के आसपास आएगा, which would have given 63 के आसपास. ठीक है. चलो अब ये बताओ, मेटा एनालिसिस, यू ऑल नो मेटा एनालिसिस इज अ fab INI-CET question, again a previous year topic, and if you check out the videos in the, I would say honestly guys, ये मेन वीडियो में ही मिलता है. ठीक है. असेसमेंट ऑफ हेट्रोजेनिटी हमने पढ़ा है. दैट नेक्स्ट मेटा एनालिसिस में there is a very big problem that the studies that we are including might be different. Okay, so heterogeneity मतलब क्या हो जाता है? Heterogeneity is evaluating the variation between included studies. Okay, it evaluates the variation between included studies, and we have to do away with this heterogeneity. So when we do away with this heterogeneity, we have to, you know, have strict inclusion exclusion criteria. We need to do a subgroup analysis. ठीक है, जहाँ पे हम लोग कुछ इफेक्ट्स पढ़ते हैं. ठीक है, स्टडीज डिफर, सो उसको क्या बोलते हैं? एप्पल एंड ऑरेंज इफेक्ट. अगेन मैं बोलूंगी ये कॉन्सेप्चुअल है जो तुमको मेन वीडियोस में दिखता है. ठीक है, एप्पल एंड oranges effect, where the studies are different from each other. They might be different. So we have to eliminate that heterogeneity by using some subgroup analysis and making stricter inclusion exclusion criteria. इसको rule out कर सकते थे. Publication bias पता है आपको funnel plot से होता है, ठीक है. Then it has nothing to do with calculating incidence rate automatically. It gives you more overpooled effect. Again, confounding factors को subgroup analysis से हटाते हैं. चलो, now this is a pure conceptual question. So guys, if you see the chapter of health planning, ठीक है, health planning and management में under evaluation we discuss two terms. Those two terms are efficacy and effectiveness. Okay, what is efficacy? Look, efficacy means reduction in disease risk under ideal clinical trial conditions, and effectiveness means reduction in disease risk in real world conditions. Okay, in real world conditions. So over here now, vaccinated individuals have 90% lower risk under ideal clinical trial conditions. Efficacy is 90%. efficacy का मतलब होता है ideal clinical trial conditions. So ये सही है, ठीक है. इफेक्टिवनेस 85%. इफेक्टिवनेस होता है रियल वर्ल्ड सेटिंग्स में. दिस इज ऑल्सो करेक्ट. Okay, now to be very honest, this you might find in your RRs as well as main videos. Okay, but understanding the two terms from both pharma and PSM is important. क्या वैक्सीन complete protection दे देगा against influenza? नहीं. अगर if any vaccine gives complete protection, then none of the people who are vaccinated should get the disease, है ना. Anyone who's vaccinated should never get the disease. तो वो 0% हो जाएगा, like which is not possible. Vaccine effectiveness may be lower than efficacy in real world setting. Yes, because effectiveness we test in real world settings. In real world settings, cold storage, cold chain effect हो सकता है, dosing effect हो सकता है, methods effect हो सकता है. So as per me, if these were the options, guys, then I would say A, B and D only. But if they were the questions, okay, is it clear? A and B is interchanged. कोई बात नहीं, तुम मतलब समझ लो. दैट इज व्हाट मैटर्स, है ना. MBBS मेडिको. आई होप यू अंडरस्टूड गाइस. देखो अभी क्वेश्चन में एग्जैक्टली हाउ इट वाज पुट इवन आई डोंट नो, टू बी वेरी ऑनेस्ट. आई एम जस्ट हियर टू मेक यू अंडरस्टैंड द टर्म्स एफिकेसी और इफेक्टिवनेस क्या होता है, ठीक है. थोड़ा सा उसको समझोगे, देन द थिंग्स माइट. एंड नन ऑफ द वैक्सीन इज 100% इफेक्टिव. एफिकेसी होने का मतलब है जिसको एनीबडी हु इज वैक्सीनेटेड शुड नेवर गेट द डिजीज, व्हिच आई डोंट थिंक इज पॉसिबल इन रियल वर्ल्ड. ओके, चलो. Now what was this? Now this was a very beautiful designed question. I would say it is a PYT. हमने हमेशा पढ़ा है epidemics, but look at the way. Now this is application of epidemics. Okay, this is a pure conceptual application question. But you could have easily eliminated two options. Were you able to eliminate two options, guys? इसमें से see, it has multiple successive peaks, and if you remember the image of epidemics, multiple successive peaks. हमने एक image देखा था, ऐसे करके जाता है, ऐसे करके आता है, ठीक है. So it's rising, it's falling, again rising, falling. So this was a classic case of propagated epidemic, guys. ये classic example था propagated epidemic. अब अगर मुझे propagated के लिए मार्क करना है, why would I go for food poisoning? You all know food poisoning is क्या बोलते हैं उसको, सिंगल एक्सपोजर एपिडेमिक, ठीक है. साल्मोनेलोसिस अगेन फूड पॉइजनिंग हो गया, वेरी डेंजरस वन, ठीक है. टाइफॉइड के लिए प्रोपोगेटेड नहीं. टाइफॉइड, रिमेंबर, इट इज व्हाट, इट्स अ कंटिन्यूअस सोर्स ऑफ एक्सपोजर, कॉमन सोर्स कंटिन्यूअस एक्सपोजर. आई वुड सजेस्ट ओवर हियर दिस वुड बिकम व्हाट, common source continuous exposure. जैसे एक contaminated well. I would say guys, यहाँ पे you could have reached the answer by ruling out. Okay, because याद करना था multiple peaks मतलब either it would be a common source continuous exposure or it would be a propagated epidemic. Now if it was a common source continuous exposure, the epidemic would not have been so haphazard. Okay, it would be have a smooth rise and a prolonged plateau, and then it would have fallen. This is continuous exposure, but image में ऐसा था नहीं. And for typhoid mostly we will see a contaminated well, and these are food poisoning. So by that, what becomes your answer? Measles. ठीक है? Okay. Chalo. Next, let's see regarding HPV vaccines, which of the following statements are correct, guys? So target group, abhi HPV was on the hold and we discussed HPV in the update sessions also. So target group in girls aged 9 to 14 years, yes. Single dose schedule, abhi India ne bhi accept kiya hai. 14-year-old ko we are giving a single dose schedule of Gardasil vaccine, which WHO is also promoting, theek hai. HPV vaccine provides complete protection, to koi bhi vaccine nahi deta hai. And HPV vaccine coverage is important for elimination strategy. Yes, we are trying to aim a 95% coverage. If these were the options, then I would say 1, 2, and 4 only. Okay? Okay. No image. Okay, theek hai. If there was no image, we would not keep an image. Even if there was an image or there was not an image, guys, you have to look at this term, multiple successive peaks. Okay? And by that, you could have derived the answer. So, isme I would say this. Guys, I've brought this. It could be very important for your NEET PG, although this we have discussed in the videos on app. But अभी आप एक बार देख सकते हो. WHO ने बोला है cervical cancer को eliminate करने के लिए all countries must reach an incidence rate of below 4 per 1 lakh women, and we need to vaccinate 90% with HPV vaccine by age of 15, screen 70% of women using high performance test by age 35, then again by 45, and treat 90% women with pre-cancer treated and 90% women with invasive cancer managed. This could be very important for NEET PG and FMG aspirants also, which I will discuss again in some other session. Chalo, now come to this question. Now this I would say was not expected, but isko aap kar paaye the. I would say this is something that was a new question. I would very honestly say, guys. So RM and CAH plus N में ना एक score card होता है, which is calculated. ठीक है? Score card में we have red, green color coding. So this is the color coding. All India average for each indicator is taken as reference point, and for जैसे mortality indicator, nutrition, fertility. Green में less than 20% of national average. तुम सोच सकते हो. Green means everything good. So less than 20%. IMR right now is less than 20% of national average. It's a good thing, right? Yellow is 20% below and above national average. But red, you all know red is a danger sign. So more than, जब कहीं का भी IMR is more than 20% of national average. Okay. So if you look at this, guys, infant mortality rate less than 20% अगर था below the national standard या average. Okay. This is standard या average. If you just, आपको सोचना था, certain questions, not necessary everything would be that you have practiced. Red means danger. Danger में होने के लिए IMR should be above the national average, not less than. Less than मतलब it's a green zone. Okay. TFR more than, which is okay, ठीक है, which we can still take it as this one, which is a grave risk. अगर TFR ज़्यादा होगा, we want TFR to be how much? 2.1. अब 2.1 से if the TFR is more, it's a red. It's a danger sign. तो ये सही है. Maternal mortality अगर less होगा तो it's good. No, it's a green zone. IMR less है, then it's a green zone. Children with ARI receiving healthcare less than 20%, again it's a danger zone. So this puts them in a red zone. So if this was the statement, guys, your answer becomes B and D only. ठीक है, अगर ऐसा question था. Alright, so this is your score. So that's it for PSM, everybody. I hope, see, again, I would say, guys, मेरी तरफ से one honest advice, guys, this was a PSM conceptual paper. ठीक है, अगर हमसे, like, if it's a recall, right? So if you're not very sure of the options also, if you have, you can send out to us, to the team, and we can definitely work on it and try to get more closer with the options. But everything rest assured, the exam is done, be hopeful. And I'm sure you're going to do very well. Okay, next goal is NEET PG FMG. So let's work towards it, guys, and try to get the better out of it. Okay, please remember PSM abhi thoda conceptual hai, so we need to get a hang of the subject even more. Okay, so bye bye, guys. Thank you so much. Have a good day, and thank you.
Hello, friends. Welcome to the INI-CET recall. And so we are now going to start with the OBG questions. Okay. And so I guess we have some odd 11 questions from OBG, and they were all, I would say, on the easier side, except for maybe one or two places where there has been some sort of integration, especially with PSM also. I was just watching through the PSM recall as well. So without wasting any more time, let's just recall the questions. Now, I want to point out to the students that this is going to be, this is a place where we're going to recall as much of options as possible. So we try to stay close to the options. However, again, at a later point in time, the questions can be, re-updated, and we'll have a better recall, this thing, right? So yes, let's start. All right, so this is your first question. Which of the following are considered probable signs of pregnancy? So are the options that are given correct? Were these the options, or there were some other options? So we've discussed this time and again that when you have these named signs, these are all probable signs of pregnancy, right? So I think Hagar's sign was there in the option. Goodell's sign was also there. This is also a probable sign. And you're saying there was no Chadwick sign or SET signs were there. Chadwick wasn't there. That is what you people are saying, right? Okay, so let's say that this isn't there. And instead, some other sign, which I'm not able to pronounce because I've not read about this sign in gynae at all. So this is something that is not in gynae, something that is not in obstetrics. So this is not going to be a sign, right? So Braxton Hicks contractions, they are also going to be there, right? So that is going to be probable sign of pregnancy, right? So this is going to be a probable sign. Goodell's is going to be a probable sign, and Hagar's is also going to be a probable sign of pregnancy. And again, you are saying that was it a multiple choice, multiple options correct question, or was it like which of the sign is not there? Was it a multiple options correct question? Was it like that, or was it which is not a sign? Multiple options, single type. Okay, so again, now you are having doubts in recalling. Most of you are saying that it was multiple option correct. Multiple option correct was the type of question. Then I have told you, Braxton Hicks, Goodell's and Hagar's sign, they will be probable signs of pregnancy. If shirt signs was in the option, this is not going to be a sign. Chadwick sign, aap keh rahe ho ki wo option mein tha hi nahi. So you are saying that this is not a sign. Okay. Okay. What are you saying? That you are not seeing the screen completely. Okay. Is it okay now, I think? All right. Okay. Now let's have a look at the next question. A woman 4 hours after forceps delivery complains of severe perineal pain. On examination, there is a tender fluctuant mass, bluish swelling on the right side of vagina. What is the most likely diagnosis? Yes, what did you mark for this type of question? Yes, severe perineal pain is your clue number 1. right? And there is a tender, fluctuant, bluish swelling on the side of the vagina. Now, in the clinical context of something happening after delivery, especially forceps delivery, they have mentioned, you're talking about trauma, vaginal trauma that may have occurred, right? And then you are also mentioning a swelling, right? Tender, fluctuant swelling. Now, this is a hematoma, isn't it? So puerperal vaginal hematoma was the option. Difficulty urination was also there. Very good. So if difficulty urination was also there, all the more reason. Difficulty urination was mentioned, unable to pass urine was mentioned. I have discussed this scenario many times with you, right? Vaginal hematoma, I have discussed this many times with you. So that is your answer. Okay. Now, puerperal hematoma, puerperal vaginal hematoma. Okay. So if it were, okay, this was a puerperal vaginal hematoma that was mentioned. Okay. Or a puerperal hematoma was mentioned. Or a puerperal hematoma was mentioned. So puerperal hematoma. It will not be puerperal infection. No, it is not just, it's not infection. Now it is a hematoma. So whether that mentioned a puerperal vaginal hematoma or puerperal hematoma, that would be answer. Hematoma is your answer. Yes, Dr. Lokesh. Yes, you're right. It is hematoma. Okay, it is hematoma. Now, next question. Okay, you're adding one, prolonged labor was also mentioned. Okay, so prolonged labor was also mentioned. So basically the context of, difficult vaginal delivery, that clinical context was set up. Next question. 23-year-old G2P1 with a history of preeclampsia, previous pregnancy history of preeclampsia is their most effective preventive measure for prevention. Yes. What is the preventive measure for preeclampsia? Only two. Yes. What is there? Urethral diverticulum is one option. So urethral injury may have been mentioned, or urethral diverticulum may have been mentioned in the previous question. That would not be the answer, but thank you for the correction if diverticulum was mentioned in the question. Okay. Now, one option is salt restriction. If one option is salt restriction, that is not your answer. Salt restriction is not going to be your answer. Okay. What is the answer? In C and D, 12 weeks was there to start from. Okay. Okay. So it was 12 weeks here and 12 weeks here. Low dose aspirin therapy from 12 weeks onwards. Okay. Okay. Now, most effective is asked. Okay, now BP normal is mentioned. Okay, obviously, now that is why we're talking about prevention. Prevention की बात कर रहे हैं in current pregnancy, history of preeclampsia, past pregnancy. तो अभी तो preeclampsia हुआ नहीं है, right? Right now, she's not preeclampsia. So right now, her BP is normal. That is why now we're talking about prevention. Right now, BP normal and patient has come at 12 weeks. Okay. So that makes up the entire question. So a 23-year-old G2P1 has come to the OPD at 12 weeks pregnant. Her BP right now is normal and she has a previous history of preeclampsia in her prior pregnancy. Which of the following is the most effective method, right? The answer is low dose aspirin therapy. Okay, the answer is low dose aspirin therapy. It's not aspirin plus low molecular weight heparin combined. Okay, it is not that. Aspirin and low molecular weight heparin combined, we give in one place in obstetrics, and that is for treatment of APLA. This strategy is for treatment of APLA, antiphospholipid antibody syndrome. Okay, this is not for prevention of preeclampsia. This has been covered in the latest updates also. Calcium supplementation alone is not the, I have told you once and again that the drug that has definitive role, documented results have been shown to prevention of preeclampsia is low dose aspirin therapy. Calcium supplementation alone is generally, it's not the only way. Okay, so yes, calcium supplementation we anyways do for our antenatal pregnant patients, and calcium supplementation has a role in places where in women who are known to be calcium deficient. Anyways, antenatally in our women, we are giving calcium supplementation anyways, right? But if you have to pick one, answer is low dose aspirin therapy. Okay, fine. Now, next question. What is the primary cause of mild physiological dyspnea during normal pregnancy? Mild physiological dyspnea during normal pregnancy. Yes. What happens normally in pregnancy? There is hyperventilation. Woman breathes deeper. There is hyperventilation. Okay, she takes deep breaths. That is what happens, right? Respiratory rate remains the same. There is increase in tidal volume. There is not decrease. The increase in tidal volume is there. Okay, woman needs to breathe in more oxygen during pregnancy. I have told you this, right? Women needs to breathe more oxygen. Oxygen consumption in pregnancy is increased. So there is not reduced intake. Okay, and when a person is hyperventilating, there's going to be, breathe out more carbon dioxide. So there will be decrease in PCO2 levels rather than increase in PCO2 levels. So basically it is progesterone induced stimulation of the respiratory center. There's increased respiratory drive, which is causing hyperventilation. That is a progesterone induced stimulation of the respiratory center. That is your answer. Okay, so I think in this question all options are correctly recalled. Okay, so answer would be B. Next question. Match the following endocrine profiles with the corresponding clinical conditions. I hope you got this right. Yes, hope you got this right. What did you mark for this? Yes, all hormones are going to be normal in Asherman syndrome. All hormones are going to be normal in Asherman syndrome. So that is clear, right? And your Sheehan syndrome is anterior pituitary necrosis, remember, right? So pituitary hormones are all going to be low. And as a result of that, there is going to be estrogen deficiency. So Sheehan syndrome will match with option number 4. Sheehan's all will be low. Okay, now premature ovarian failure. Then estradiol will be low and FSH and LH will be on the higher side, right? Premature ovarian failure will be this, and PCOS will be, LH will be elevated. FSH is not going to be elevated, and estradiol level are, or overall total estradiol levels are in the normal range. So that is going to be your answer for this question. Okay. So this was an easy question, straightforward. All right. Now, next question. So just to tell you, the correct answer would be option number A then. Now, next question. A woman in labor delivers the fetal head. The fetal head basically gets delivered. The head retracts against the perineum. And this thing is what we call as the turtle sign. Shoulder dystocia is diagnosed. What is the first step? Again, very easy question. First step is immediately start with the McRoberts maneuver, right? So McRoberts maneuver with suprapubic was mentioned. So that would be the answer. McRoberts with suprapubic pressure. If that was mentioned, fine. Suprapubic pressure. Okay, so that would be your answer. Wood's corkscrew, these are internal rotational maneuvers. They are done later, right? And Zavanelli is the one of the last resort maneuvers. And internal podalic version, I don't know if that was there in the option or what, but that is absolutely no. So this was not mentioned. You are saying Rubin's maneuver was there. Rubin's was there. Rubin's is also an internal rotational maneuver. That is not the first maneuver. This is when the McRoberts fail. One can go ahead with the internal rotational maneuvers. So Rubin is also not your answer. Next question. 17-year-old girl presents with Ayushi shoulder dystocia में Zavanelli last resort maneuver है, last resort maneuver है ना? So Zavanelli उसमें कर सकते हैं, but last resort maneuver है, ठीक है? Now, 17-year-old girl, primary amenorrhea, examination में normal breast, absent uterus, scanty pubic axillary hair, serum testosterone levels are elevated, most likely diagnosis. Okay, so the answer to this question is going to be androgen insensitivity syndrome. I don't know why you people are saying Mayer-Rokitansky-Kuster-Hauser syndrome. In MRKH syndrome, the serum testosterone levels are going to be normal. So that is not going to be the answer. Alfred, you are saying shoulder dystocia was not mentioned in the question. All right, fine. Maybe they gave you a situation that described that shoulder dystocia is happening. Okay, so thanks for the correction. We'll keep that in mind, right? So serum testosterone levels are normal in case of MRKH syndrome, and your pubic and axillary hair are also normal in Mayer-Rokitansky-Kuster-Hauser syndrome, which is talking about Mullerian agenesis. All right, so your answer was going to be androgen insensitivity syndrome. That is your answer, not MRKH. MRKH is not the answer. Congenital adrenal gland hyperplasia. Women can come with amenorrhea also, but their uterus is going to be present there. Okay. Turner syndrome will not present like this with absent uterus. The uterus is going to be present there. Okay. Fine. So we've got these 4 options. Answer is AIS. Next question. Now, this question was discussed with your PSM faculty also just before me. Dr. Neha discussed this question. All right. Now, again, there is a lot of this thing, thoda sa, not lot, but a little bit of discrepancy in the recall options. I will just go through the options one by one. Okay. Now, primary target age group is, this is going to be a true statement that the primary target age group is 9 to 14 years. A single dose schedule may be used for these group of women. That is also true. See, the vaccine manufacturers and all the international guidelines, they recommend this 2-dose schedule in adolescent girls, right? But the WHO specifically says now, this was an INI-CET question much earlier also, where SAGE recommendations had come, where 1 or 2 dose. I mean, so in the adolescent age group, one could just give 1 dose also. So that has been accepted by WHO, and recently, if you recall a little bit, the government of India had a campaign in the month of March where they were rolling out this vaccine, and 1 dose they were giving to 14-year-old girls. They had created this vaccine drive in the month of March also. So a single dose may be used in that clinical context where, you know, especially for public health concerns, you know, जहाँ पे vaccine shortage होता है, एक ही vaccine लगा दें, that is going to be effective enough, right? So WHO or India recommendation was asked, right? So each scholar, yes, WHO India recommendation was asked. तो उन्होंने बोला है कि अब single schedule may be used for the primary target एज ग्रुप. WHO ने पहले बोला था कई साल पहले, इंडिया ने अब इस बार मार्च के महीने से एक्सेप्ट कर लिए. Target vaccine coverage should be 90%. That is also true. And women who receive vaccination, this is false. They need future cervical cancer screening. And you are saying 100% protection. 100% protection is not there. 100% protection is false. Please understand that when we are giving HPV vaccination, that HPV vaccine contains 4 strains, okay? 4 strains जो government of India भी जो vaccine बना रही है. If you look at the vaccine drive that they are doing, no, they are in that vaccine drive. They gave quadrivalent vaccine. Quadrivalent vaccine में 2 तो warts वाले हैं, 6 and 11 and 16, 18. So it is only providing protection against the most common type of cervical cancer causing strains or high risk HPV DNA, 16 and 18 wala. But there are other high risk HPV DNA strains also which can cause cervical cancer. So it is not going to be 100% protection, and that is why women need to continue to get themselves screened even if they have had this vaccination. So 100% protection is false statement. ठीक है, तो ये सारे statements हमने cover कर लिए. Okay, so PSM recall was correct. Okay, so ठीक है, fine. If you've done it with PSM, but I wanted to highlight these important pointers. Next question. 16-year-old girl presents to hospital after alleged sexual assault by 22-year-old man. She's found to be 16-week pregnant. Which of the following is not a part of standard medico-legal management in this particular case? This is basically a forensic question because medico-legal आप वहाँ पढ़ते हैं, but I'm getting some more also more monodose is preferred over 2 dose या option था कि single dose is more effective than double dose. See, single dose is not more effective than double dose. Single dose, correct statement is single dose does not, single dose does not compromise efficacy. Okay? So single dose और double dose की efficacy comparable है, right? Single dose is definitely, अब ये better तो नहीं किसी ने बोला, WHO ने भी नहीं बोला better है, उन्होंने बोला single dose देने से vaccine coverage, ज्यादा लोगों को vaccine दे पाएंगे हम, right? ज्यादा लोगों को cover कर पाएंगे single dose देने से, it without compromising the efficacy. Okay? All right? नेक्स्ट क्वेश्चन. अब आगे उसको छोड़ दो, उस क्वेश्चन को, अब हो गया, उसमें सारे स्टेटमेंट्स हो गए. ये बताओ. ऑलराइट, नाउ दिस क्वेश्चन. 16-year-old है and she is 16 weeks pregnant, right? Let's have a look at this. The recall option seem correct to you? The recall option seems correct to you? Not a part of medico-legal management. See, less than 20 weeks में opinion of one registered medical practitioner is fine. Okay, so this is true. MTP may be performed with the opinion of one registered medical practitioner, less than 20 weeks pay. Okay, police must definitely be informed. This is also true. Okay, now DNA sample of the fetus, ये वाला choose करे या ये consent वाला? देखो इसमें अब ये है, what did they ask? So consent is required for examination. Consent will be required for MTP from the parent or guardian. अब ये बताओ, ये ऑप्शन ए सही है? ऑप्शन ए था, ऑप्शन ए यही था, एग्जामिनेशन ऑफ माइनर. अगर एग्जामिनेशन ऑफ माइनर है तो एग्जामिनेशन ऑफ माइनर, एग्जामिनेशन के 12 years इज द थ्रेशोल्ड. 12 years के बियॉन्ड एग्जामिनेशन का कंसेंट वो खुद दे सकती है, राइट? सो दिस इज ऑल्सो गोइंग टू बी ट्रू. सो दिस इज गोइंग टू बी फॉल्स देन. ओके, अगर एग्जामिनेशन ऑफ माइनर लिखा था, अगर एग्जामिनेशन लिखा था तो एग्जामिनेशन ऑफ माइनर डज नॉट, उसमें माइनर जो है 12 years के लिए बोलते हैं. 12 years से लेस में यू हैव टू टेक कंसेंट फॉर एग्जामिनेशन. बियॉन्ड 12 years शी कैन गिव हर ओन कंसेंट फॉर एग्जामिनेशन. ओके, सो दैट इज द थिंग. एक ये डिफरेंस है. ओके, एंड DNA sample of the fetus should be preserved for forensic evaluation. This is good practice. ठीक है, ये should be preserved. This is also good practice. ये भी true है. Okay, especially in medico-legal cases, this becomes very, very important. Okay. All right. Willing to MTP. Okay, so इस question में I will have to see all except was written. हाँ, so not a part of standard management. What is not? All are a part of standard management except ये लिखा होगा. Okay, so doc, yours one of you is saying कि DNA sample तो practically नहीं करते. बच्चे sample तो लेके रखते हैं, ठीक है? That sample then can be analyzed for DNA analysis in the future. That is why I'm saying कि recall कैसा है? अगर examination बोला था तो फिर examination वाला statement false हो जाएगा. लेकिन हाँ, MTP के लिए फिर consent चाहिए. ठीक है? You're getting my point? So consent किस चीज के लिए था? What was the, so that will change the answer. ओके कि कंसेंट किस चीज के लिए बोला था. कंसेंट ऑफ पेरेंट और गार्जियन is required for MTP in less than 18-year-old. In less than 18-year-old. For MTP, consent of guardian is required, but for not for examination. तो अगर examination था तो option A false हो जाएगा. Okay. और less than 20 weeks में one medical practitioner का opinion is enough. Okay. तो अब ये अगर एग्जामिनेशन था तो ये आंसर है ऑप्शन नंबर ए, राइट. ठीक है, चलो नेक्स्ट क्वेश्चन. अ मिडिल एज्ड वुमन प्रेजेंट्स विद वल्वल इचिंग, प्रूराइटिस, ग्रीनिश वेजाइनल डिस्चार्ज and erythematous vaginal mucosa. Whiff test is negative. Which of the following is most likely associated with the causative organism? Okay, एक बार मैं again one more thing I'm highlighting. अब वो कंसेंट था कि एग्जामिनेशन था, इस पे बहुत डाउट्स आ रहे हैं. आप लोग इक्वल वॉल्यूम में बोल रहे हो कि कंसेंट फॉर एग्जामिनेशन था कि कंसेंट फॉर एमटीपी था, राइट. सो कंसेंट फॉर एमटीपी अगर लिखा था तो कंसेंट ऑफ एमटीपी तो चाहिए होता है फ्रॉम पेरेंट और गार्जियन हु इज लेस देन 18 years of age, बट कंसेंट फॉर एग्जामिनेशन नहीं चाहिए होता है, उसके लिए थ्रेशोल्ड इज 12 years, राइट. सो मे बी in the coming days we will get more recall, हमें कुछ और information मिलेगी in the stem of the question that may change the answer. उस question को अब आगे छोड़ देते हैं. Okay, let's leave that question for now. Let's move ahead. Yes, which of the following features is most likely? It was trichomoniasis and flagellated. All right. So yes, if they are saying greenish frothy vaginal discharge, erythematous vaginal mucosa, okay, and whiff test could be positive in trichomoniasis, it could be negative also. Basically, it is not bacterial vaginosis, right? So presence of clue cells is in bacterial vaginosis. That is not your answer. Okay, so from the profile, it is looking like trichomoniasis. So motile trophozoites are seen on wet mount microscopy, and one option was negative diplococci. So I think you're talking about gram-negative diplococci. That is not going to be the answer. And any other option was there? Any other? Motile flagellates was given. Okay, motile flagellates was given. That is going to be your answer. So most likely they were asking about trichomoniasis only. That is going to be your answer. Pseudohyphae was mentioned. Okay, so pseudohyphae was mentioned. But if fungal infection is there, that characteristic curdy white discharge has to be there, not greenish discharge, right? And erythematous vaginal mucosa. Again, these two are going more in favor of your trichomoniasis, so not fungal, okay? Not fungal. Okay, so budding pseudohyphae also mentioned. So basically they had given you a profile, you had to identify the diagnosis and then pick the best answer. So the diagnosis is trichomoniasis. Okay, anything else was mentioned? Are Deep, no, pruritus is present. Itching is absent in bacterial vaginosis. Otherwise, in your trichomoniasis also, in your candidiasis also, itching is there. So itching is there. Okay, so frothy greenish discharge, that is very peculiar. Frothy greenish discharge is very peculiar for trichomoniasis. Okay, all right. Next question. 26-year-old ultrasound image was given to you for a pregnant woman, and this was a twin pregnancy ultrasound, right? And they had asked you least likely complication, right? So cord entanglement would be your answer. Yes, cord entanglement would be your answer because this is unique to monochorionic monoamniotic. Okay, all right, this is going to be your answer. All right, what option was there? Congenital deformities, you are saying. Congenital deformities, you are saying. And you are saying congenital deformities, anomalies, you are saying first trimester abortion risk and everything. Okay, All right. So yes, answer would be cord entanglement. Cord entanglement is unique to monochorionic, monoamniotic, the ones who are in a single amniotic sac. Okay. So the ones who are in a single amniotic sac, their cord, that is unique to monochorionic, monoamniotic. In the image, you had twins and there was an intertwin membrane. There was an intertwin membrane present. Intertwin membrane was present. That is what they were in their own separate sacs. Okay, so least likely would be cord entanglement. That is your answer. Okay, fine. Right now, whether it was monochorionic diamniotic, whether it was dichorionic diamniotic, the image had not asked you that. The image had not asked you to identify dichorionic versus monochorionic, and answer would not change. Okay, there was there was an intertwin membrane, they were in different sacs. Okay, whether they were sharing the placenta, not sharing the placenta doesn't matter, but they were in two separate sacs. So cord entanglement becomes the least likely condition. Okay, and हाँ तो growth restriction ये आ गया ना बच्चे, fetal growth restriction IUGR. ठीक है? All right. Now, next question. And I think this is the last question which I have received. 28-year-old man, अब ये गायनी में क्यों डाला? I mean, man has been taking exogenous testosterone for whatever purposes, bodybuilding purposes. I don't know if was there a question like this? What changes are expected in the serum gonadotropin levels? Dharmesh, many left. How many are left? I've got 11 questions for gynae. Are there any more questions? Please write it on the chat box so that we can discuss them here. No question like this? Not this question exactly. GnRH was also given in the options. So basically, whenever a person is taking exogenous steroid hormones from outside, right? So it could be a woman taking exogenous testosterone for her, right? Or a woman taking oral contraceptive pills, right? Whenever you take exogenous hormones from outside, they cause suppression of the HPO axis. No, they cause suppression of the hypothalamus and pituitary. So basically, LH, FSH, and GnRH also, they are going to be low because the HPO axis is suppressed. HPO axis suppression is there. Okay, right. Now what else? What else? Congenital adrenal hyperplasia. Congenital adrenal hyperplasia, in which context was asked? Was it asked in from pediatrics? I think your pediatrics faculty will discuss that congenital adrenal hyperplasia wala question. That is in the context of a child that was asked. So I don't have that question with me. Your peds faculty will have it. Ma'am will have it. Lupus antibody causing congenital heart block. Okay, so one question was SLE. In pregnancy and congenital heart block. Congenital heart block. This is unique to those, when you have these anti-Rho and anti-La antibodies. Anti-Rho and anti-La antibodies. When these antibodies are present, then there is risk of, there is increased risk of congenital heart block in the fetus. Okay, so this was question. Okay. Now, any other question? MRKH came. वो हो गया ना, MRKH was one of the options in the androgen insensitivity syndrome वाला question. Anshu Shukla, वहाँ पे MRKH was not the answer. Serum testosterone levels elevated भी थे उसमें. I think that is the question that you're talking about. You are talking about possibly this question where MRKH was one of the options. वो नहीं answer है because in this question serum testosterone levels were given elevated. MRKH, Mullerian agenesis, serum testosterone levels are in the normal female range. Okay. Now Hagar's आ गया first वाला probable sign में, यहाँ पे था Hagar's वाला probable sign वाला question. Maybe you joined late, I think, right? One multiple choice came to match disease with their causes. And you're not able to correct, something was there. So maybe somebody else will recall, right? Braxton Hicks wala ho gaya, probable signs wala ho gaya. I think we've done all the questions because no new questions you are telling me. Okay, so these are the 11 questions. Yes, OBG was less this time. OBG was also easy this time, right? So I think much of your bulk of difficult questions came from surgery, probably is what I'm getting the feedback of. And Pearls index आपका उधर हो गया ना discuss PSM में. PSM faculty covered your Pearls index वाला question. Vaginal hematoma has been discussed. Now let's not waste further time and let's move on with your next faculty for your recall further. Okay. Pearls index wala question PSM faculty has covered, and I don't think any more new questions are coming. Rectocele wala question, bachche, okay. Dr. Medico's rectocele question has been covered by Dr. Pritesh Singh because difficography is something that we don't do in gynae. It is done for complex anorectal disorders, and Dr. Pritesh sir has covered it there. Okay, वो rectocele surgical context से पूछा गया था. That is what they have discussed. Okay, sparse hair in androgen insensitivity. Yes, of course, na, in androgen insensitivity. So pubic hair are either absent or they're scanty. Scanty मतलब बिल्कुल कम है. बिल्कुल कम है is not normal. Scanty is something which is closer to being absent rather than being normal. Scant को normal कैसे count कर लोगे? Right, you people scant, you say कि you will say scant है तो मतलब है तो सही नहीं. It is not like that. Either they're normal, either they're scant or less. Scanty means less pubic hair, absent pubic hair. So androgen insensitivity syndrome, because androgens are not acting. So maybe some androgens are acting and some receptors are there. So some pubic hair development took place, but at least it's not normal pubic hair development. So scanty will be taken as absent, as evidence of absent. Moreover, serum testosterone levels were elevated, right? So that is your answer. Okay. Chalo. So we're going to end the discussion for now, and we're going to move ahead with the next set of recall with the next faculty. Thank you so much.
हाँ जी, बॉयज एंड गर्ल्स, एम आई ऑडिबल एंड विजिबल टू ऑल ऑफ यू? एक बार कंफर्म करेंगे. यस, ऑलराइट बॉयज एंड गर्ल्स, कंफर्म मी वंस, ऑडियो वीडियो ऑल क्लियर. आई नो ऑफ्थैल का पेपर देख के लग रहा होगा सर विजन हमारी क्लियर थी लेकिन फ्यूचर हमारा ब्लर हो गया. ऐसा कुछ भी नहीं हुआ. यू आर विद PrepLadder, यू आर इन सेफ हैंड्स, डोंट वरी फॉर दैट. कैन वी स्टार्ट विद अ क्विक डिस्कशन? देयर वर 7 क्वेश्चंस ऑल इन ऑल. दे वर प्रिटी आउट ऑफ द बॉक्स, राइट? हमने सोचा हम एक तोहफा खोलेंगे और बीच में से निकलेगा एक सुनहरा सा गिफ्ट, सुनहरा सा कोई ऑर्नामेंट, सोना चांदी, लेकिन निकल गया बीच में से सांप, है ना? बट कोई बात नहीं, हमें वो भी टैकल करना आता है. सो लेट्स स्टार्ट विद द वेरी फर्स्ट क्वेश्चन एंड दैट इज व्हाट इज द एम्पलीट्यूड ऑफ एकोमोडेशन इन अ 7-year-old चाइल्ड? अरे सर हमें क्या पता, वो 7 साल के बच्चे से पूछो ना सर, कहाँ से क्वेश्चन दे देते हो सर. सुनो, सिंपल सा फॉर्मूला है, दैट इज 18.5. मैं यहाँ पे लिख रहा हूं. आई नो दैट दिस क्वेश्चन वाज एब्सोल्युटली आउट ऑफ द बॉक्स, बट एम्स हैव पास्ट के वो कुछ क्वेश्चंस ऐसे जरूर डालते हैं, स्पेशली ऑफ्थेल्मोलॉजी में. पता नहीं उनका क्या प्यार है जिसको जग जाहिर करना चाहते हो. कुछ क्वेश्चंस ऐसे जरूर डालते हैं जिसमें स्टूडेंट को लगे अरे मेरी सुबह तक तो विजुअल एक्टिविटी 6/6 थी, अब मुझे ऐसा क्यों लग रहा है जैसे ऑप्टिक ए ट्रॉफी हो रही है. तो देखो एक सिंपल सा फॉर्मूला है, दैट इज 18.5 माइनस 0.3 इंटू एज. अगर इसको सिंपली हम अप्लाई करेंगे तो यहाँ पे एज कितनी दी है बॉयज एंड गर्ल्स? दैट इज योर 7 years. इफ यू मल्टीप्लाई 7 years विद 0.3 तो मैथमेटिक्स क्या बोलेगा? मैथमेटिक्स बोलेगा ये आएगा 2.1. तो 18.5 माइनस 2.1 comes down to near about 16.4, है ना? यही हुई ना बात. लेकिन एक डॉन्डर्स टेबल होता है जो कि एक तरीके से रफ एस्टीमेट है. तो आइडली इस सवाल का आंसर आपका होना चाहिए जो मैक्सिमम यहाँ पे दिया हुआ है अमंगस्ट द गिवन ऑप्शन. जो ऑप्शन हम रिकॉल कर पाए वो था 7, 12, 14 और लास्ट में डी लिखा हुआ था. अब ये डी नहीं पता, ये डी का मतलब 0D था, 1D था. वी ट्राई टू कनेक्ट विद अ लॉट ऑफ स्टूडेंट्स बट we could not get the right, the fourth option. So most of the students told that it was only written D. Baki aap zyada jante hain, but anyway we are more concerned about the one answer that was there in the options. And now so 18.5 minus 3 into age करके हमारा आ रहा है 16.4. so out of the given options it is 14. अगर 14 की जगह 15 था, अगर 14 की जगह 15 था तो 15 होगा. जो 16.4 के नियर बाय ऑप्शन है हम वो मार्क करेंगे. अब मुझे बताइए कितने स्टूडेंट्स का ये ठीक हुआ? एक छोटी सी चीज है. अच्छा मुझे एक बात बताओ, जल्दी से बता दो, ये एम्पलीट्यूड ऑफ एकोमोडेशन का क्या मतलब है? देखिए जैसी बेबी का बर्थ होता है तो सिलरी मसल्स होती हैं. सिलरी मसल्स की स्ट्रेंथ हाईएस्ट होती है एट बर्थ. तो जैसे जैसे हम एज करते हैं हमारी सिलरी मसल्स की स्ट्रेंथ जो है वो कम होती चली जाती है, और जितनी कम होती चली जाएगी उतना हमारा एम्पलीट्यूड ऑफ एकोमोडेशन कम होता चला जाएगा. तो इसका मतलब ये स्टार्टिंग फ्रॉम 1 year ऑफ एज टिल लास्ट, है ना? तो एम्पलीट्यूड ऑफ एकोमोडेशन कम 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 मतलब कमती होता चला जाएगा. आई होप इट इज वेरी अंडरस्टैंडेबल नाउ, है ना? एंड यस, मेनी स्टूडेंट्स हैव कंफर्म्ड दैट द डी ऑप्शन वाज डी ओनली. ओके, ऑलराइट, डी ही लिखा था. ओके, ऑलराइट. So that's okay. All right. So the answer as per the options will be 14. But as I told you, जो maximum होगा वो आप मार्क करेंगे near about 16.4. चलें आगे. All right. चलो. आजकल there is a slow paradigm shift that they are moving more towards the clinical concept to इंटीग्रेटेड क्लिनिकल कॉन्सेप्ट. तो यहाँ पे देखिए, यहाँ पे सिंपल सा एक सिंगल लाइनर क्वेश्चन था. हाइपर पोलराइजेशन इंड्यूस्ड ट्रांजैक्शन is seen in which sensory pathway? So it is more like physiology question, but I am taking it in ophthalmology. तो hyperpolarization, what do you understand by hyperpolarization? अच्छा मुझे ये तो बताओ, है ना? ऐसा नहीं लगना चाहिए कि सर फंडस देखने आए थे, खुद का फंडस हिल गया. ऐसा नहीं होना चाहिए, है ना? तो मुझे जल्दी से बताओ ये हाइपरपोलराइजेशन का क्या मतलब है? What do you understand by hyper? I know the answer. I'm going to tell you the answer, but let's simply do a little bit of touch and go. लगना चाहिए ना कुछ सीख के गए हैं, आंसर बताने फिर तो हम एक पीडीएफ फाइल में आंसर मार्क करके आपको दे देंगे. But we at PrepLadder are highly motivated to at least touch the nearby points so that NEET PG अभी is in the corner of the room. कब आपको पकड़ ले वो पता नहीं है ना. 30th अगस्त, मार्क योर डेट्स, 30th अगस्त, तो ध्यान रखना है. तो उस कारण हम यहाँ पे थोड़ा सा टच एंड गो करेंगे. मुझे बताइए, व्हाट डू यू अंडरस्टैंड बाय हाइपरपोलराइजेशन? हाइपरपोलराइजेशन मींस व्हेन इट बिकम्स फ्रॉम नेगेटिव टू मोर नेगेटिव. ये देखो यहाँ पे क्या हो रहा है, हाइपरपोलराइजेशन हो रहा है. -40 से और नीचे चला गया तो हाइपरपोलराइजेशन पहली चीज है ना. नाउ रोडोप्सिन मींस रेटिनल प्लस ऑप्सिन इज द विजुअल पिगमेंट ऑफ रॉड्स. ये भी हमें पता है. इसके रिगार्डिंग भी एक क्वेश्चन है, वो मैंने अभी आगे लिया हुआ है, अभी आपको मैं बताऊंगा. उसके बाद व्हेन रोडोप्सिन absorbs the light, so there is an initiation of signal transduction pathway, okay, and the receptor potential goes into hyperpolarization. तो हम किसकी बात करें भाई? रोडोप्सिन कहाँ पे है, रेटिनल कहाँ पे है, ऑप्सिन कहाँ पे है? तो विजुअल पाथवे में है सर. तो आंसर क्या होना चाहिए सर? आंसर होना चाहिए हमारा विजुअल. ओके, अंडरस्टूड, समझ में आया? वेरी गुड डॉक्टर लोकेश. यस, यही चाहिए, यही चाहिए. जरूरी नहीं है कि इस क्वेश्चन का आंसर आपको पता होना चाहिए अभी, जरूरी है कि उससे रिलेटेड चीजें आपको अभी पता होनी चाहिए. सो समटाइम्स देयर मे बी अ लिटिल बिट ऑफ ओवरलैप ऑफ द टॉपिक्स बिटवीन INI-CET, NEET PG एंड आल्सो FMG. तो इस चीज का ध्यान रखेंगे. सो 2 क्वेश्चंस आर डाउन. नाउ कमिंग ऑन टू थर्ड. ये क्वेश्चन देख के तो लगा होगा, हे बाबा रे बचा लिया तूने बाबा रे. बिल्कुल सही बात. ये क्वेश्चन थोड़ा सा जिसको हम बोलेंगे ठीक ठाक है, जिसने थोड़ा बहुत हमें कॉन्फिडेंस दिया कि ऑफ्थैल अच्छी नहीं है बट ओके, इतनी बुरी भी नहीं है ना. चलो, अ मिडल एज्ड फीमेल पेशेंट प्रेजेंट्स विद पेन ऑन आई मूवमेंट. कई बार मैंने बोला पेन ऑन आई मूवमेंट एंड देयर इज RAPD. RAPD मींस रिलेटिव एफरेंट प्यूपिलरी डिफेक्ट एंड अ नॉर्मल ऑप्टिक डिस्क. तो एक चीज जो मैं हमेशा अपनी क्लास में बोलता हूं, कोई भी पेशेंट जिसको रेट्रोबल्बर न्यूराइटिस है, देखो एक होता है ऑप्टिक न्यूराइटिस. ऑप्टिक न्यूराइटिस को हम 3 में डिवाइड कर लेते हैं. एक होता है रेट्रोबल्बर न्यूराइटिस, another is your papillitis. Papillitis means if there is inflammation of the intraocular portion of the optic nerve. Retrobulbar is the part which is behind the eyeball, and neuroretinitis, boys and girls, is the inflammation of just the neuroretinal rim. तो पेशेंट आएगा रेट्रोबल्बर न्यूराइटिस का, डॉक्टर साहब मुझे कुछ भी नहीं दिख रहा. तो आप बैठे हो अपनी क्लिनिक में, आप बोलोगे अच्छा जी आप बैठिए आराम से, लेट मी एग्जामिन यू. तो आप पेशेंट को जब एग्जामिन करोगे, स्लिट लैंप एग्जामिनेशन करोगे, पेशेंट का फंडस देखोगे जिसमें आप ऑप्टिक नर्वेट देखोगे, तो आप बोलोगे पेशेंट बोलेगा हाँ जी मुझे भी कुछ नहीं दिख रहा. तो व्हाट डू यू मीन बाय यू सेइंग मुझे भी कुछ नहीं दिख रहा? यू आर नॉट सीइंग एनीथिंग abnormal on doing the fundus examination. That means optic nerve head is absolutely normal. Optic nerve head, boys and girls, I'm not saying optic nerve, because retrobulbar neuritis is there is inflammation of the retrobulbar portion of the optic nerve which you cannot examine on fundus examination while the patient is sitting on slit lamp with the chin on his chin rest. Is it understandable? So typical. But RAPD, relative afferent pupillary defect, if there is any defect in the conduction of optic nerve, there will definitely be RAPD. Now let's eliminate the options. So first I have told you the answer, but we should know to eliminate the options. अच्छा, तो पहले CRAO में क्या होगा जल्दी बताओ? There will be pale एंड मिल्की वाइट फंडस, ये तो हमें पता है. एंड सबसे इंपॉर्टेंट थिंग, कौन सा स्पॉट होगा वो भी मुझे बताओ, जल्दी बताओ कौन सा स्पॉट होगा, कौन सा स्पॉट होगा? देयर विल बी चेरी रेड स्पॉट. यस, होगा कि नहीं होगा? होगा, क्यों नहीं होगा? चेरी रेड स्पॉट. डायग्राम नहीं था, आई नो. डायग्राम अभी मैंने आपको समझाने के लिए रखा है. डायग्राम आई नो नहीं था, डायग्राम वाला एक क्वेश्चन था, उसमें उसने सारे क्वेश्चंस के डायग्राम डाल दिए. मींस देयर वर 3 इमेजेस इन दैट वन क्वेश्चन, है ना. दिस इज जस्ट फॉर योर अंडरस्टैंडिंग बॉयज एंड गर्ल्स, है ना. तो पेल मिल्की वाइट फंडस, चेरी रेड स्पॉट, कैटल ट्रैकिंग, वो सब होगा. बट RAPD विल बी देयर. RAPD होगा, बट देयर विल नॉट बी, I repeat, there will not be pain on eye movement. CRAO, sudden, painless, loss of vision is the keyword here, है ना. तो let's eliminate D option. चलो मारो काटा. अब आ जाओ पेपिलिडीमा पे. What is पेपिलिडीमा? अच्छा मुझे जल्दी से बताओ, पेपिलिडीमा is a disease of the optic nerve or something else? Jaldi batao, jaldi. Yes, I want all of you to participate, boys and girls. I want all of you to participate. Yes, it is bilateral disc edema due to raised intracranial pressure. It is not the primary disease of the optic nerve. There is exoplasmic outflow, stasis. There is exoplasm stasis in the optic nerve. So there is no dyschromatopsia. There is no loss of vision. There is no disc. There is no, yes, quickly, yes, optic disc, what? Optic disc, you have not written, the full sentence anyway. So there is no dyschromatopsia. Dyschromatopsia means red green color deficiency. There is no RAPD, but here there is RAPD. So let's eliminate this option as well. What about AION, anterior ischemic optic neuropathy? The disc will be, so anterior ischemic optic neuropathy can be arthritic anterior ischemic optic neuropathy. In arthritic anterior ischemic optic neuropathy, the disc will be pale. In non-arthritic anterior ischemic optic neuropathy, the disc will be hyperemic, है ना? And RAPD may be present, but there are more chances of RAPD to be present in arthritic. But overall, all in all, it will be present in AION and AAION. Okay, but यहाँ पे typically mention pain on eye movement. Okay, in arthritic anterior ischemic optic neuropathy, there can be scalp tenderness. Okay, but no pain on eye movement. So that is one negative point. Another is they have specifically mentioned middle-aged female, but AION mostly happens to be 60 to 70 years of age, also eliminated. So we are left with the one option which is retrobulbar neuritis. अब यहाँ पे थोड़ा सा फोकस कर लेते हैं, जल्दी जल्दी आपको बता दूंगा, है ना? तो ये देखो ऑप्टिक नर्व हेड नॉर्मल लग रहा है, तभी तो डॉक्टर ने बोला पेशेंट आई ऑल्सो कैन नॉट सी एनीथिंग, है ना? सो दिस इज बॉयज एंड गर्ल्स योर रेट्रोबल्बर न्यूराइटिस. यहाँ पे देखो डिस्क मार्जिन ब्लर दिख रही है, यस और नो? से यस, क्योंकि दिख रही है. तो ये क्या है? ये है हमारा पेपिलाइटिस. एंड लास्ट वन पॉइंट, यहाँ पे देखो डिस्क मार्जिन ब्लर्ड हुई, न्यूरोरेटिनाइटिस में डिस्क मार्जिन ब्लर्ड होगी, बट यहाँ पे देखो क्या दिख रहा है? ये मैक्युलर स्टार. और ये कौन सी डिजीज में दिखेगा, जल्दी बताओ? न्यूरोरेटिनाइटिस इज सीन इन cat scratch disease. Can you name the one causative organism that causes cat scratch disease? And that is your बाटोनेला हेंसली. नाम हेंसली है, लेकिन जिनको नहीं आता वो बेचारे उदास हो जाते हैं, बिकॉज दिस इज अ वेरी ट्रिकी क्वेश्चन येट अगेन, बॉयज एंड गर्ल्स. ओके, ऑल राइट. Now, okay. Next is, what are the components of the trabecular outflow pathway? In simple terms, if you want to know about the exit of the aqueous humor from the anterior chamber to the canalostem, so there are two pathways. One is trabecular meshwork pathway, another is uveoscleral pathway. Okay, and you already know that trabecular meshwork, it is 90% and uveoscleral is just 10%. If you don't know anything, just on the basis of this, you know that uveoscleral pathway is entirely an independent pathway, boys and girls. So here uveoscleral pathway is the incorrect, so right answer will be 1, 3 and 4. So it is C. But just to give you a quick touch and go, so here you can see this is your trabecular meshwork. So there are three components. One is your uveal, another is corneoscleral, and third is your juxtacanalicular, okay, which were there in the options. And last is your uveoscleral. It is entirely different. देखो uveoscleral यहाँ से जा रहे हैं ना, while trabecular meshwork तो बिल्कुल अलग हो गया. So इसका आंसर pretty straightforward है. It is C, which is 1, 3 and 4. Is it understandable? So Dr. Maharshi saying Schlem's canal was in the option. Schlem's canal given. So 2, 3 students. So okay, if there was no uveoscleral, so we can go on with Schlem's canal. Schlem's canal lies on the outer side of trabecular meshwork mechanism, है ना? So trabecular meshwork is there, so it is coming from the anterior chamber, trabecular meshwork, Schlem's canal, episcleral venous plexus, then going into superior and inferior ophthalmic vein, ultimately going into cavernous sinus. Okay, so इसको लिख लेते हैं, कोई बात नहीं. Schlem's canal, it is Schlem's canal. Schlem's canal. Okay, taken. Okay, Dr. Vicky Kumar Thakur. Okay, all right. Answer क्या? Retrobulbar. Yes, answer will be retrobulbar. यहाँ लिखवा दिया आपको. I hope it is clear. Yes, I am taking few more questions अगर यहाँ है तो. Okay, Okay, all right. Now moving on to the next question. A patient presents with characteristics findings shown in the images below. What is the most likely diagnosis? Chalo, ye 3 images were actually there in your real exam. So these are iris leash nodules, right? Iris leash nodules. Okay, here you can see some tumor, so eyelid tumors may be present in that one disease, and these are cafe olate spots. Okay, if you will connect the dots, so the answer will be neurofibromatosis type 1. Acha, how will you rule out the other options? How will you see? It is very important to rule out the other options as well. So it is my responsibility to tell you a little bit about the other options as well. So Stooge-Weber syndrome mein what typical feature you are going to see? Port wine stain. That is one very important feature, port wine stain, and there will be also glaucoma due to raised episcleral venous pressure. What about tuberous sclerosis? There will be retinal astrocytic hematomas, and in von Hippel-Lindau disease there will be retinal capillary hemangioblastoma. So these are all the diagnostic features. If they appear, you have to mark respectively. Done? Okay, can we move ahead? चलें आगे. Wasn't eyelid tumor, eyeball tumor lag raha tha, like optic nerve glioma. So my dear Dr. Sumit, see, if there is, अब मुझे नहीं पता कि किस सेंस में आप मतलब what was the actual image, but this is the image which has been shared with us by most of the students. If there is optic nerve glioma, there should be some axial proptosis, है ना? Optic nerve glioma, because it lies just at the posterior pole where the optic nerve is actually entering the eyeball, so there should be some proptosis. So इस view से मुझे proptosis नहीं लग रहा. अगर थोड़ा proptosis होगा, there should be upper eyelid retraction, maybe because of forward coming of the eyeball. So I'm not pretty sure whether this is optic nerve glioma, because if there is optic nerve glioma, there shouldn't be any swelling over this region. So this is what I believe. है ना? Okay. All right. चलिए. So one RDR Medico's ear was raised with proptosis. Okay. Sudden diminution of vision. कोई age वगैरह दी थी? Was there any mention of age? Because optic nerve glioma is more common in less than 10 years. It is more common in females. कुछ ऐसा दिया हुआ था कि female है, less than 10 years of age है, something like this करके. And do you know which is the most common optic nerve glioma? Juvenile pilocytic astrocytoma. कुछ ऐसा था? नहीं, कुछ ऐसा नहीं था. Okay. All right, little ball bulge tha, it was 10 to 15 year male, in so 10 year was there, है ना? So normally 10 year के आसपास optic nerve glioma is pretty common. Okay, no sir, just the images. Okay, thank you Dr. Smith for letting me know. Okay, so based on the images which are provided and connecting the dots, it is leading us to neurofibromatosis type 1, है ना? Anything else you guys would want to add? So Dr. Chujitha, so why not AION? My dear friend, AION will have RAPD, but there will be scalp tenderness in arthritic anterior ischemic optic neuropathy, है ना? लेकिन अगर आप देखेंगे एक सेकेंड, लेकिन अगर आप देखेंगे तो wait, let me switch over to that slide. आपको मैं बताता हूँ एक बार, just a moment. Let me take a moment to show you. हाँ, तो अगर आप देखेंगे RAPD AION में होगा, ठीक है? पेन ऑन आई मूवमेंट नहीं होगी AION में, ओके? एंड नॉर्मल ऑप्टिक डिस्क भी नहीं होगी AION में, या तो वो पेल होगी या वो हाइपरईमिक होगी, ठीक है? आई होप इट इज क्लियर. समझ में आ गया? आई होप इट इज क्लियर. चलो ठीक है जी. ओके, लेट्स गेट बैक. स्फिनॉइड विंग डिस्प्लेजिया के कारण लिटिल वॉल बल्ज था. स्फिनॉइड, yes, there can be sphenoid wing dysplasia, हो सकता है, बिल्कुल हो सकता है. eyelid tumors भी हो सकते हैं, but हाँ, there can be, you know, either sphenoid dysplasia or there can also be sphenoid dysplasia along with the eyelid tumors. Optic neuritis was in the option, not retrobulbar. And Dr. Vishnu, most of the students told that there was optic neuritis. Okay, even if there was optic neuritis, retrobulbar neuritis is placed under optic neuritis. So optic neuritis, there can be intraocular portion papillitis, then there is retrobulbar neuritis, then there is neuroretinitis. Okay, चलिए next question कर लें एक बार. Yes, all of you are comfortable अभी तक comfortable हैं आप? Yes, please एक बार confirm करेंगे. retrobulbar was definitely there. हाँ, मतलब this is what we got to know कि retrobulbar was there. Anyway, so we know the answer. हमें answer पता है. चलते हैं ना आगे. Okay. All right. So which of the following are the correct magnification correction factors for the given lenses? So guys, this question was also out of the box. It is a PG level question. Okay, so these lenses Vogue 60, Vogue 78, Vogue 90. If you have attended my lectures that I took recently on PrepLadder app, so you would see that I am examining a patient on a slit lamp with the help of Vogue 90D lens. I have shown you that lens and I have shown you the real patient video of me examining the patient. तो मैंने वहाँ एक चीज बोली थी, जितनी हाई पावर होगी लेंस की उतनी मैग्निफिकेशन करेक्शन ना कम होगी, जितनी लो पावर होगी उतनी मैग्निफिकेशन हाई होगी. तो यहाँ पे देखिए 60 मैग्निफिकेशन हाई. अब यहाँ पे some students are saying there was Vogue 70, some are saying 68. So ideally Vogue एक कंपनी का नाम है, तो Vogue के जो मेजर जो मोस्ट कॉमन लेंसेज आते हैं ना, तो ये मैंने कंपनी से ही ये फोटोग्राफ ली है, 78D, 60D and 90D. So these three are the common lenses that are manufactured by this company. And you can see 60D image magnification 1.15x, 78D minus 0.93x and 90D there is minus 0.76x. है ना, ठीक है, समझ गए ना. So this is a you know kind of a flyer by the company itself. All right, so the best answer will be, as you can see that the powers are increasing 60, 78, 90. So magnification should decrease. So it should be the very first option. And Goldman 3 mirror lens, so it is 1.27. Okay, that's okay. It is 1.27 because its power is relatively less. So of course the magnification correction will be on the higher side. Yes, Dr. Lokesh, I know most of the students told that it was 0.8 to 0.1 है ना. Okay, and 1.27 other, no less than one option was there. So 1.27 is there. I have written probably this was 0.8 to 1 है ना, Vogue 90D, but I just showed you that it is actually 0.76. So it's okay है ना, we know the answer. So the funda was pretty simple. More is the power, less will be the magnification. ठीक है जी, done है. Use my mind and found an ascending order in option and marked it. Very good, Dr. Vicky. You are genius, man. Very good. The option with 0.8 was actually an equation which I had not seen before. Okay, so Dr. Jan has mentioned 1.1. Okay, I'm writing it here. 1.1, 0.8, 1.27 and 1.3. So what I believe is they have given some approximate magnification correction factors है ना, but the concept remains the simple. Less is the power of the lens, more will be the magnification factor. समझ आ गया ना जी, done है. Okay, no, Dr. Neerav, not at all. You are going to shine in the coming exams. Don't worry, never lose hope. Hope नहीं lose करनी है. Okay, okay, all right. चलो आगे चलते हैं. So yes. So now our next question is, a person is kept in dark room for long time. Which of the following changes is not observed? So guys देखो, जब मैं अभी recently आपको visual cycle पढ़ा रहा था तो मैंने एक चीज mention करी थी. क्या थी वो चीज? That in November 2022 they had asked that lumirodopsin gets converted into which molecule. So one option was metarodopsin, another was bathorodopsin, other was all trans retinol. Or I had told you that this is your visual cycle. If they can give this, they can give a question which is related to this as well. Remember, I always say you guys to not to, you know, kind of cram PYQs. PYTs are also very important. चलो अब इस visual cycle को एक बार जल्दी से देख लेते हैं and then let's end the session with a bang. Okay, all right. अब देखिए, so पहला था पहले हम one by one option को eliminate करते हैं. So पहला था pupil will dilate. Of course, when you are going from a bright lit room to a dim lit room, so pupil are going to dilate. तो ये तो सही हो गया. So guys, always try to eliminate the options one by one. Even if you don't know anything, even if you are able to eliminate this option, uske baad agar aap guess karte ho, to still you have got 33% chance of getting this correct. So it is all the game of mathematics, hai na? Okay, I become more sensitive to light. Of course. Why? Because you are in dark. There is something known as dark adaptation time. Dark adaptation time is the time which is taken by the eyes to be able to see clearly in dark. So they become more and more sensitive. What is the normal value of dark adaptation time? It is approximately 20 minutes, hai na? Okay, so this is also correct. Next is retinal opsin changes to photopigment. So ये देखो, retinal combines with opsin changes to photopigment, which is rhodopsin. So it is also correct. But retinal pigment changes to vitamin A. अरे भाई कहाँ पे है vitamin A? Vitamin A पूरे cycle में आपको दिख रहा है. You cannot see vitamin A. So boys and girls, this is your incorrect option. समझ पा रहे हो? Pupil diameter will increase. B option was like that. It's okay. Pupil will dilate or pupil will increase, है ना? So we know that this is the correct. So my dear Dr. Reddy, most of the students told us that it was accept or not observed. So that means we have to mark the incorrect option. समझ में आया? We have to mark incorrect option. So Dr. Sumit is saying which of the following is correct was asked, and it was multiple correct. Anyway, अच्छा Dr. Sumit एक बार बताएंगे, options यही थी हमारे पास. अभी इसको sort out कर लेते हैं. Options यही थी, बताइए एक बार. बताइए. Last question है ये डॉक्टर नव्या. 7 questions were there. 7 questions were there. 7 questions were there. ओके, मल्टीपल करेक्ट ऑप्शंस की अगर हम बात करें तो ऑप्शंस यही थी. एक बार मुझे बताइए. यस, डॉक्टर सुनीति सिंह. तो बेस्ड ऑन दीज ऑप्शंस आई हैव टोल्ड यू व्हिच इज इनकरेक्ट. सो यू वुड एक्चुअली नो कि आपका ये ठीक है कि नहीं है ना? ठीक है जी, समझ में आ गया? इज इट अंडरस्टैंडेबल? बताइए. इज इट ऑल गुड? इज इट ऑल गुड? यस, यस, ओके, okay, chalo. So that's all from my side. Thank you very much for your time. It was my pleasure. And at PrepLadder, we are always motivate you, to guide you, to do a little bit of hand holding, and आपको इस पार से उस पार ले जाने की जिम्मेदारी हमारी है. With this, I'll take your leave and I'll give the podium to our next esteemed faculty. Thank you very much, boys and girls. I hope to see you soon. और जब results आएंगे, do let us know क्या रहा आपका result, and we'll be happy to share your happiness. And yes, best wishes. Bye bye.
Hi everyone, very good evening guys. I hope I'm audible and visible to all of you. I would need a quick confirmation in the chat box, and if all's well then we'll get going right away. So let me know. And before we start with any of the so-called recall session, this is not going to be in any form for any subject. I can, vouch for that. It's not going to be 100% accurate because this is a recall based on whatever little inputs we've got over the past few hours from students. So you need to take it in the same manner that some wordings will be off. There will be some questions which will not get a closure. Then why exactly is a recall session being conducted? So for two set of students. First, for students who were only and only targeting INI-CET, when you come from an exam, you need a closure. Only then you can have a good night's sleep or you can have a good week ahead. So one reason for this recall session is getting a closure. The second, of course, is for students who have given this exam as a midpoint towards their final destination, which is NEET PG. So for you all now, what is going to happen is that you will know where you made mistakes, how you performed under pressure, what should you be doing now for NEET PG, which we will talk in a separate session. I don't think this is the right moment to do that. But yeah, now you know that exactly, okay, these are the topics where I could have done better, or maybe now you know, right, that this is what I knew, but despite knowing I did not mark it correct, or there were questions which were totally, went over everyone's head. So then I will get such questions in NEET PG also. How am I supposed to rule out? What am I supposed to leave? What am I supposed to attempt? A lot of things you learned from this thing that you will now be able to apply on to NEET PG. So either which way, as I was telling you before also, it is a win-win situation. If you get a seat right now, congratulations to you. And God forbid if you don't, then you learn so much from it that you will be able to get one in the upcoming NEET PG. So take this as a very important learning lesson in this entire journey that you have. I've got questions of path and micro. I'm not going into the details of theory. I think we've read that enough. Going to be very quick, very to the point. I want inputs from all of you. I've got some from Telegram, whatever you want to add on. We'll keep it, let's keep both the subjects together and let's keep a target of 20-25 minutes and wrap up all the questions. But I will keep adding on to this over the next few days, and I will give you a final PDF and a final video on the app and a final PDF on Telegram so that you can refer to that for if you're targeting NEET or the next INI or whatever is your final goal. So let's start with this. I believe everyone marked this. This was to do with liver cirrhosis, and they asked you that what would you do for collagen or fibrous band, whatever was the terminology. It is Mason trichrome. Mason trichrome, you know that the muscle comes out to be red and collagen comes out to be blue, and that is how you will see the fibrosis. So I think option A, nothing, no confusion here. I've kept the simplest first. Let's move on to question 2. Is this? This was about amyloidosis, as we always used to say that one question on amyloidosis for INI-CET, because you must have seen a lot of, maybe not a lot of path per se, but path came integrated with a lot of subjects. Micro came a lot, biochem came a lot, and some was good, some was bad, because we were prepared somewhere that pre and paraclinical subjects will be more. So at least that weightage has been kept intact. But yes, there are some questions which were too much over the board. But again, I somewhere expected that. So did you, because you were not going for a regular exam. You were going for INI, right? Okay, when I say chronic inflammation, that to secondary amyloidosis, I hope you marked AA amyloid. That is what you marked. This, I think, did not have any kind of confusion. This is AL for multiple myeloma, A beta for Alzheimer's disease, ATTR for old age, nothing of that sorts mentioned. Can you give me a confirmation कि chronic inflammation ही था, secondary amyloidosis था, तो AA is what you marked as the answer. Perfect. Transthyretin, ATTR, maybe this was mentioned, but then for chronic inflammation, I will be going in more for AA type of amyloid. Okay, so this is sorted. Let's move on to the next. Something regarding the mechanism of UV light, whether UV light, what damage does it cause, or whether how does it cause cancers. Something to do with UV light and its impact on the DNA was asked. This goes back to your rapid revision videos again, where I have told you that thymidine, or if they had instead of thymidine written it as pyrimidine dimers, they are going to form, and that's the mechanism of action of UV light. And who corrects this? If you remember, this is corrected by nucleotide excision repair. I don't think this was asked. NER was not asked. They asked you a simple mechanism. I'm just giving you more words over here, not to teach you, but to basically ring a bell that maybe something was asked. You can add on to my knowledge. But overall, I just feel that this is what was asked. So yeah, this is also settled. Option has pyrimidine dimers. Okay, whatever you'll keep telling me, I'll keep adding it so that I can put it up in the final PDF and the recall. Okay, let's move on to the next question. Now, this is where I've kept a few question marks because a lot of different inputs were coming. Number one, starting from the geographical doubt. Some people said patient was from Africa, some said patient was from Assam. Let's keep that aside for the moment. If I look at the overall pulmonary symptomatology mentioned, lungs, cavitatory lesion, and something in the liver, I think this much you will agree. Also, this was a question of granulomas with Langerhans giant cell, and all of us thought it was TB. But then I know for a fact, ab mujhe pata lag gaya, TB was not there in the options, is what now students on Telegram have been telling me, that TB tha hi nahi. See, if TB would have been there, why would I not mark it? I would, but a lot of people said TB tha hi nahi. So now I'll tell you, answer can be these two. What would I select where? Because Langerhans giant cells, yes, are seen in TB, but can also be seen in sarcoid, can also be seen in histoplasma. So you had to first see, kya necrosis mentioned tha? Because if caseous necrosis is mentioned, then I told you, right, that histoplasma is everything like TB. The giant cells, the necrosis, the clinical symptomatology. And if caseous necrosis was not mentioned, then I would have gone best in favor of sarcoidosis. So this is not a decision that I can make. This only you can make. And I'm getting so many inputs on this, so I've not been able to narrow it down to one answer. I leave it to you. If you think caseous necrosis was there, answer is histo. If caseous necrosis is not mentioned, it's only granuloma, Langerhans, lung and liver, then you will be marking sarcoidosis. GPA was not there over here. Dr. Prem, GPA wala, I think वो vasculitis का एक अलग question है. I could be wrong, but correct me on that, is what I've understood from the students, that GPA Wegener's was a different. Caseating was given. If caseating was given, guys, then the answer becomes histoplasmosis. But again, this is something that you will decide. I've given you both possibilities, either which way. This is what most of you are saying. That's amazing. Let's move on to exactly what you were asking me, Dr. Prem. All are medium vessel vasculitis. Firstly, can you tell me, यहाँ पे except पूछा था, were these similar to the options that you got? Because I know medium vessel vasculitis is pan khata bachcha. When I say pan khata bacha, so I know for a fact that these two are going to be medium vessel vasculitis. Now, when they say except, then GPA also comes over here. And what is this leukocytoclastic vasculitis? Go back to your rapid revision videos. It is microscopic polyangiitis. So, ma'am, both of these happen to be small vessel vasculitis. So, ab kya mark kare isme se? So, this is exactly why it's INI-CET and it is not any other exam of the country, because they will easily make you rule out two options and then they will get you stuck very badly in two options. So over here, remember, Wegener's or GPA, whatever you want to call it, is primarily small vessel, but it can also affect the medium vessel vasculitis. Then what is the one that only affects small vessels? That is leukocytoclastic vasculitis, which is the other name of microscopic polyangiitis, wo ANCA wali story, which was set up. Okay, some of you are saying except was not there. तो फिर क्या question कैसे बना? Was it like multiple options that you had to select? कुछ तो form होगा. They can't say all are examples of medium vessel vasculitis. That can't be the question, right? It has to be something they will have to ask you. Either they say 1, 2, 3 are correct, 2, 3, 4 are correct. Except has to be there. Otherwise, question कैसे बनेगा ना? They have to ask you something. That's how they will. If it was multiple options, then which of these are medium vessel vasculitis? 1 and 2 are definitely. Wegener's can be medium vessel vasculitis also. But most of you are saying except, so we keep it to that. Still, I believe, and I've told you, there will always be inputs even after this session. And no one is running away. I just want you to get a tentative closure to this exam, have a good night's sleep, and then over the next 2-3 days, we'll keep gathering inputs, because now we also have to get going to our NEET PG journey, right? So a lot of things will, like a hangover, will keep coming back to you. Tomorrow morning, you will wake up and remember that acha ek aur question tha which we did not tell. So that will keep on happening. Okay, moving on to the next. I think there was another vasculitis. This is a PYQ. I do not think there was any twist over here. All are seen in Kawasaki except purulent conjunctivitis, because I think we know the cream criteria as per which there is non-purulent conjunctivitis. So I believe this is okay and I can move forward. There was a question on a typical INI-CET Gleason grading. You are very lucky that you were not given those images. And if you've gone through the rapid revision videos, I have told you in the genital tract that Gleason grading is an INI topic. Please padh ke jana. But problem is that by the time we reach male genital system, we have not, we don't have the capacity. Either which way, you read it in path or you read it in surgery, which way, either ways. For prostatic adenocarcinoma, they gave you the scoring directly. So you were lucky you didn't have to, kind of calculate it from images. If you've got a 4+4 given, that gives you a final score of 8, and a final score of 8 becomes grade 4. So if the grade was asked, then grade 4 is the answer. Again, Thankfully, a very straightforward thing and nothing much to worry about. Let's move on to the next. Was it truly as straightforward as what I can see over here, or is there something that I am missing out? Because this doesn't seem to be a very INI-CET kind of a question. I mean, they will give ultra easy questions. Was this one of it also? That the hemoglobin is low and it is a microcytic anemia. Obviously, in our country, the first thing that I will think of is iron deficiency. Chalo, ek to I believe was a question which was kind of given. What did they also mention about the iron levels, like the ferritin levels being low? Was that there, or was it just a microcytic anemia and then going by the most common nutritional deficiency? So everyone was shocked, so was I. I thought you guys told me half the question, but it's okay. We are not complaining. We are very happy. And I did tell you that while there will be extremely difficult questions, there will be extremely easy ones also. This is where you didn't have to overthink and didn't have to do mistakes. I think ferritin low bhi tha, easy. Not spending more time on this. Coming to the next, incorrectly matched, consider it path or micro, whichever which way. Incorrectly matches the first one. Nasopharyngeal carcinoma is more associated with, it can be seen with Epstein-Barr virus, it can be seen with HPV, either which way CMV ke saath nahi dikhta. HHV8 and Kaposi sarcoma, yes. African child, Burkitt's lymphoma, EBV, correct. HTLV causes ATLL, adult T cell, all correct. Isme ek hi answer tha. Incorrectly matched, so answer mil gaya. Do I have to spend more time on this? No. This is a question I have a question mark on. क्या ये था नहीं था? Some students told me it was there, some were a little doubtful, so I leave it to the house to decide. An old man, postmortem हो रहा है brain का, autopsy में you are seeing something like this, which looks to me, if this picture came, इमेज तो अलग होगा ही ऑब्वियसली. सो हिरानो बॉडी टाइप फोटो कुछ था, मतलब इट मस्ट हैव बीन अ डिफरेंट पिक्चर, बट वाज इट लुकिंग समथिंग लाइक अ पिंक कलर क्रिस्टल? वाज इट लुकिंग समथिंग लाइक अ बॉडी? तो हिरानो बॉडी था, हीरो को एक्टिंग, एंड दैट एल्जाइमर्स डिजीज इज व्हाट आई वुड मार्क. इफ बाय चांस दे गिव यू दैट पिगमेंटेड सेल में ल्यूई बॉडी, देन आई वुड हैव गॉन फॉर पार्किंसन. अभी के लिए ऑल ऑफ यू आर सेइंग हिरानो बॉडी था, so then we take this as the answer. We take it as Alzheimer's. Images were not too good. In fact, prior to this, I was seeing the Ophthal recall. उसमें वो neurofibromatosis वाला case आया, उसका leash nodules you could not see. Are we shocked? Is this the first time that they've done this in an exam where they've uploaded poor quality, horrible quality pictures, despite taking so much money from us? They have not given us the best output. Is this for the first time? Are you shocked? I don't think so. I am not. Neither are you. So that's okay. I mean, क्या कर सकते हैं अब? They've not learned from their mistakes, right? It is extremely heartbreaking, I agree, but they just don't listen. Everyone has written to them. They just don't listen. And you're saying amyloid was written. That goes more in favor of Alzheimer's only. वो भी Alzheimer's, A beta amyloid, right? A beta 40, 42. Plaques were written again in favor of Alzheimer's. Either which way answer Alzheimer's ही बन रहा है. Whatever may be the theory given, answer is written for us. Okay, this is a question many of you were saying, ऐसी कोई photo थी in which you could see some cells on a blood smear and then maybe इतना सब नहीं लिखा था. I agree, so much of information was not given to you. But did you see some blue color dots? So many of you came back to me saying, ma'am, एक बहुत weird stain था. How was this weird? I'm not understanding. If I'm getting it right, and if this is a reticulocyte on a peripheral smear, what else were you thinking this to be? I mean, और क्या सोच रहे थे? Why did you get confused? Because so many people were very, very worried and tensed about this particular question. But और क्या सोच रहे थे? Blood smear पे से क्या बनाना चाह रहे थे? What were you wanting to make it? Yes, okay. So, okay, some of you are saying Jimsa nahi tha, Leishman stain tha. Either which way, ye Jimsa, Leishman, what is Jimsa, Leishman and all these stains? Aren't they Romanovsky stain? Romanovsky stain mein, how do the red blood cells look like? वो तो red color का दिखता था. This is not red color, guys. These are reticulocyte. Supravital stain कौन सा? The best one, new methylene blue. Or if brilliant crescile blue, ऐसा कुछ blue वाला stuff was written. That is why the reticulocyte looks blue in color. What is reticulocyte made up of? It is made up of RNA. This is I think it's the second slide or probably the first 5 minutes of the hematology lecture. Even if you've read it from rapid revision, first 5 minutes of that lecture is about reticulocyte and emphasized so many times that reticulocyte का stain new methylene blue है. Okay, right? चलो पास भी ऑप्शंस में था, ठीक है, I'll write that, but आंसर चेंज नहीं होगा. आंसर is still new methylene blue. Okay, coming to the next question over here. This is where I think you've done this in biochem recall. I'll tell you. अब यहाँ पे क्या हुआ for students who read that dosa, roti, pizza, mnemonic, जिन्होंने वहाँ apply कर दिया and then didn't think any further. They said proteins and Western blot and They said, okay, done. But then you had to read further. I agree. If I would have been in a hurry, I would have marked this, but that is wrong over here. Reason being that they have said that you are using paraffin embedded, and also I believe something to do with formalin was mentioned. Formalin and paraffin was mentioned over here. So now tell me that if you are testing Western blotting, what are you wanting to test? Proteins. You just need protein. You don't need the entire tissue. You don't need the entire paraffin block and the formalin fixation. That is not required. When formalin and paraffin, ये वाले words आने लग जाते हैं, this means you are dealing with a tissue. Now tell me which of these techniques are applied on a tissue. Is ELISA done on a tissue? No. Is flow cytometry done on a tissue? नहीं ma'am, ये तो वो CD markers and all के लिए होता था in hematology, blood. This was not done on a tissue. Which of these is done on a tissue? Immunohistochemistry. So now, can immunohistochemistry test proteins? Of course. इतने immunohistochemistry पढ़े like cytokeratin, vimentin and etc that we kept on studying. तो वो किस पे करा था? Formalin and paraffin tissue पे करा था. Okay, some of you are saying ELISA नहीं था, in situ hybridization था. या तो in situ hybridization होगा या fluorescent in situ hybridization होगा. That will also not change my answer because this is done for all the chromosomal disorders, for DNAs etc. It is not done for proteins. Protein के लिए, if only protein would have been there, answer would have been Western blot. When they say protein along with formalin fixed and paraffin embedded tissue, answer is going to be immunohistochemistry. ELISA नहीं था options में, final recall में हटा देंगे. Options can be anything. Answer is definitely immunohistochemistry. On this, I think you've done this in biochem also. Coming to another question on MI. MI में they asked you about autopsy finding. The features given were coagulative necrosis and neutrophilic infiltration. The best answers in this situation, let's assume आप पूरा भूल चुके थे. You had no idea about MI. You had forgotten that table which any human being would forget. But then you remember your basic concept कि starting में तो acute inflammation होता है and acute inflammation is going to be neutrophils, right? Okay, image was also given. Then I'll have to work on this. I'll add this for my homework and I will find out whichever image was there, whether it was from Robbins or not. But image के साथ, did they mention neutrophils or was it like for you to become pathologists? Like इस बार इन्होंने वो esophagus के Barrett's वाले question में they made you a pathologist and given you an image के खुद देखो खुद बताओ, which was not expected at all. Okay, either which ways, अगर neutrophil का image था and mention था तो image तो redundant हो गया ना, just to confuse me. I have to look at neutrophils. Neutrophils में acute inflammation. Acute inflammation कब आएगा? The best acute inflammation, forget MI. Any disease acute inflammation is between 1 to 3 days. After 3 days तो वो chronic inflammation हो जाता. It would have been macrophages and then granulation tissue. That is how it goes, like neutrophils, then macrophages, then for recovery there is granulation tissue. Finally तो recovery complete हो जाएगा and there will be scar formation. They asked me neutrophils. I marked 1 to 3 hours. Okay, for those who are saying image Robbins wala tha, I will look into it. I will add it, but that will not change the answer again. Let's move on to the next question over here. Again, was this there? Very tuta-futa options I have got from students. Very bizarre options. I've tried to put in one question, but I have my doubts on this. What is seen in beta thalassemia major or any beta thalassemia? We know what kind of a hemolysis, whether they say thalassemia major or alpha thalassemia or sickle cell anemia, ये जितने भी hemoglobinopathies होते हैं, what kind of hemolysis are they? They are extravascular hemolysis. तो I don't think intravascular hemolysis होगा. That is definitely ruled out. अच्छा, iron overload. अब ये कैसा question था? 1, 2, 3, 4 correct. All are correct except that wording is what I'm actually getting stuck at. What I've not got as a complete recall. Hepcidin levels decreased लिखा था, ठीक है. Ineffective erythropoiesis तो होगा ही. Anything where see hemoglobin is not forming na. Hemoglobin is supposed to be alpha 2 beta 2. I am saying beta thalassemia hai, beta chains are to not forming. So the alpha chains are making alpha 4 tetramers or making other hemoglobins which are not right hemoglobins, which are not appropriate hemoglobins. So the RBCs are going to break. That is what I call as ineffective erythropoiesis. Do thalassemia major people have iron overload? That is also correct. Either they are getting too many blood transfusions, that is why they have iron overload. And iron overload hoga to hepcidin में भी changes आएंगे because hepcidin is a negative regulator of iron. So multiple correct में I think फिर मुझे सिर्फ intravascular hemolysis correct नहीं लग रहा, because this is a clear cut case of extravascular hemolysis. So then in that situation I would have gone for these three कि हाँ iron overload होता है, अगर iron बढ़ेगा घटेगा hepcidin will automatically change with it. So these two definitely are correct, and this is ineffective erythropoiesis. ठीक है. If the question was which of the following is not seen in beta thalassemia major, then my answer would have been intravascular hemolysis. Point is कि आपको concept और question समझ आ गया. Wording would change the way you would attempt the question, but we've got whatever had to be marked over here. ठीक है. Can we move on to the next question over here? This is again something which I've not got. Image ही मुझे correct नहीं मिला है, but overall I have understood that this was a pediatric case and something to do with a classical nephritic syndrome because of hematuria, hypertension and subepithelial humps. Instead of writing post-streptococcal glomerulonephritis, they just changed it a little and they said post-infectious glomerulonephritis. Not a big enough change to cause so much of confusion in your life. Means the same over here. Question में subepithelium hump नहीं था. Okay, still in that situation, some of you have added oliguria. Let's assume that they did not give me this terminology, but they did give you a classical nephritic. They did give you a classical pediatric case, which is the most common nephritic in pediatrics. सिर्फ इतना basic पे भी attempt करते तो PSGN ही mark करके आते. This is not a minimal change disease, वो तो nephrotic होता है. MGN नहीं हो सकता. Again, that is nephrotic. That happens in old elderly people. Not good pasture syndrome again, because good pasture में तो वो Cricentric, RPGN, so much of information should have been there. Answer will be PIGN or PSGN, whatever you may want to call it. Immunofluorescence में अगर starry sky appearance दिख रहा था, very good. Most students can't identify in the exam, let's be honest. So I'm wanting you to derive it from the theory given itself. Some of you say subepithelial humps was there. Iska hona na hona is immaterial right now for me, because even with it or without it, I have still marked it as PSGN. And starry sky image, so that was there. Perfect. Now this is a question which no one will ever be able to get a correct image of, because I tried going on in my Google search till as many images possible, spoke to a lot of students. They did not say a yes to any, at least 30-40 images that I shared, they didn't say a yes to any. So either this has been shared by someone from, all of us as pathologists, we have our own personal set of images that we click on a day-to-day basis when we see good cases. Either someone's personal collection has been put up as a question, I don't know. But is this a question that should have been given to any undergrad student? No, because we are not doing MD pathology out here. I'm not wanting you to give the diagnosis. अब ये पक्का है that something was the answer, either Barrett's था या adenocarcinoma था. Squamous cell cancer नहीं था, because many of you are saying कि Barrett's की history थी, Barrett's का कुछ तो correlation था. तो Barrett's के बाद squamous cell तो नहीं होता. Not even low grade dysplasia. So if they gave you a classical squamous epithelium changing into those goblet cells and all, तो I would have marked Barrett's. But if they give me more of glands, more of gland wala architecture diya tha, then my answer, this will be like a cross connection here, then my answer would be adenocarcinoma. I am not the best person to give a judgment on this, because मैंने photo ही नहीं देखा. I'm giving you assumptions out here that if you had squamous and then you had the change metaplasia, then Barrett's mark करो. अगर glands दिखा था तो फिर adenocarcinoma mark करो. No history. Okay, on the left you could see squamous. Then I'm not saying this was the picture, but ऐसा कुछ रहा होगा that maybe on the left you could see a squamous epithelium and that was changing into a goblet cell wala columnar epithelium. Then the answer goes more in favor of the Barrett's esophagus for sure, if this is what we are going in for. Most of you have agreed on that. Perfect. Then we had a question. This is not a path question, but most of you put it on my Telegram. I've got it over here. They had an arrow which was pointing towards Reed-Sternberg cells. You thought that they wanted you to identify X in Hodgkin's lymphoma. You kept searching X likha kahan hai, but they were not asking you about anything of this image. They were asking you about the Ann Arbor staging. And in medicine and in radiology, when we study Ann Arbor staging for Hodgkin's lymphoma, X refers to bulky disease. X refers to bulky disease. So this X was nothing to do with pathology. But वो starting path से हुआ, but it took a reroute होते it came to another subject. So I think bulky disease is what you had to mark and nothing more. Paths related इसमें कुछ था नहीं. Moving on to the next question. This was all about reading fancy English correctly and putting your common sense and coming to your answer. Which of the following is true? Angiogenesis happens in the proliferative phase. अब new blood vessel formation अगर करना है तो obviously there will have to be proliferation. So this statement by simple English and common sense sounds well. Coming to the next, type 1 collagen is present in early stages of wound healing. नहीं, type 1 तो end में आता है. This is wrong. Type 3 collagen replaces 1. Isn't it the other way around? That type 1 replaces type 3. So this is also wrong. Inflammatory phase is followed by the exudative phase. Now this is again not making sense. Exudate क्या होता है? Exudate is a lot of inflammation, right? So inflammation and exudative is pretty much the same thing. What happens after the inflammatory phase is the proliferative phase. तो ये भी बिल्कुल गलत English. The only correct statement over here that I have is option A, which is, I hope these were the 4 statements. If you feel there was something else, you can let me know. But abhi tak I've got these 4 statements. Out of these, the first one makes the most sense. As I said, this was not only about, going ahead with the knowledge. This was also about, reading well, knowing your English well. Same statements. Okay. Now there are 2-3 questions that I have over here. Number one, इससे related कुछ था, incomplete penetrance. This was not there in your rapid revision videos. If you have seen the main videos, the first page of genetics, I have taught you this. I have taught you 2 things called incomplete penetrance and variable expressibility. But iska correct, I'll tell you the concept in one line. And now, because I've not got all 4 options over here, I know you've solved this in biochemistry also. Incomplete penetrance basically means that there is a defective gene which we have got from our parents or grandparents or someone. The gene I have got, but I am not showing the expression. I'm not showing the disease. I'm not showing the signs and symptoms. Something similar like कि हमने पढ़ा तो है. So we've got the knowledge in our brain, but we are not applying that knowledge onto a question. That is incomplete penetrance, that the knowledge is there in my brain, but if I can't apply it at the right time in the right place, then that knowledge is not going to express itself. That is incomplete penetrance. So if you had something like, one of the generation is affected, other generation is not affected, aisa kuch tha, so then that would have been the answer. But yes, this is a question mark homework for me because I want all 4 options before I can narrow it down to one. So skipping that you're saying some wording like that must have been there, that the one of the generation has the disease, the other generation does not have the disease, then that would be the answer. There was another question on oncogene addiction. Oncogene addiction again from main videos. By the way, kahan padha hai humne? CML में पढ़ा है, where you get to see translocation 922, where there is BCR-ABL fusion. Addiction means that this oncogene, this cancer can only happen till this is there. Till the time BCR-ABL is there, till the time tyrosine kinase will be increasing, only till then CML will happen. The day I stop this tyrosine kinase, the day CML will get cured. Matlab I give imatinib. That is what they said, that the cancer is dependent on that single pathway. And if you give targeted therapy, then the cancer will be cured. Exactly what we study for oncogene. वो पूरा CML वाला जो concept होता है, that is only known as, and again over here if let's assume it's INI and you didn't know this, just an assumption, तो फिर यहाँ पर you are aggressive in attempting questions in INI. You should have taken a good guess on this by your common sense कि addiction का मतलब will always be dependency, right? So over here the cancer is dependent on that one pathway, and if I take that pathway away, the cancer is going to be cured. So this was more of aata hai to very good, nahi aata to if you are good at taking intelligent guesses, you should have got this right. This question I'm not discussing because I believe you have already discussed it in Ophthal. Cafe ole spots dikh rahe hai with neurofibromas, with the leash nodule, a classical neurofibromatosis type 1. So I'm not going to waste time on this. Let's move on to the next. I think till now I've got 20 questions of path. That is what I've got till now. I'm sure we are adding one more, which I'll take up similarly 20 or so questions of micro also, whatever I've received till now. We'll start with the easiest. Starting में everyone confusion बहुत चला था. I think it got settled. Finally you guys told me कि नहीं मैम whiff test negative था, साथ में वो पूरा AMSEL's criteria and all basically negative था. Then they had that greenish discharge and finally it was settled that it is a case of Trichomonas vaginalis. Now you know what is Trichomonas vaginalis. Remember Dadaji's fancy girlfriend? So the pear-shaped flagellated trophozoid and motile twitching motility of Trichomonas, that is making sense. So negative ही था ये, I don't know, this confusion went on for a very long time, that starting में green था but whiff test was positive, what should we have marked? Then students came up and they said कि नहीं, negative था, this was clear cut trichomonas. So I finished that confusion in the very first question. The next question over here, we are back to the time where one anda has to come in every paper. So thankfully it has come, and I hope you didn't make any error. I'm not sure if something like IDA was clearly mentioned or it was indirectly mentioned that patient is complaining of fatigue or something to do on that IDA wala plan. Because here you can see the ankylostoma or the hookworm eggs. If you didn't pick it up from fatigue, you should have seen jo OO wala segmented wala egg likh raha hai. And then segmented wala egg, what are the 3 organisms that come through the skin? If you remember this, number 1, S schistosoma comes through the skin, then strongyloids comes through the skin. Now, schistosoma and strongyloids. What else comes through the skin? Ankylostoma, which is hookworm, and that is what you had to mark over here. Infection occurs by penetration of the larva through the skin is what you will be marking over here. This is not because of cyst. This is not that D-shaped egg of Enterobius. This is not roundworm wala round egg at all. This is classical hookworm. Hookworm comes through the skin, that is ankylostoma. This is done. Okay. I hope this is fine. Perfect. Moving on to the next question. Was this a pretty straightforward thing? Classical neck stiffness wala meningitis story. CSF में either they wrote India ink or I think they wrote nigrosin, which is basically a negative stain, and that further was written as yeast cells, matlab fungus. I think we are dealing with cryptococcal meningitis. Till now they have been pretty with cryptococcus they give integrated questions like treatment batao, pharma ka batao, but this time they said let's keep it very simple. Let's give them the name of the stain. Let's make them identify what negative stain are they knowing, and then we are done. Okay. Not going any more in detail. You got this right. I have my fingers crossed. The next question out here is again 1 question mark over here क्योंकि मुझे अभी थोड़ा the wording, I am still figuring it out as to what was asked. Was it asked as 1 cause or multiple causes were asked? 32-year-old splenectomy, emergency department. They are basically organisms, splenectomy hua hai. So either they would ask you कि vaccination कौन सा देना चाहिए था, or what are the organisms she's at a risk of after splenectomy. So they have to be the capsulated organism. Out of these options which are currently in front of me, I would mark Streptococcus pneumoniae. 1 cause was asked. So then this is a question which I think I can remove the question mark. So terminology can only change like what will you give for prevention as a prophylactic vaccination before splenectomy, or if splenectomy has been done, what is she at a risk of? The concept is she's at a risk of capsulated infections. Pneumonia likha tha, pneumococcus likha tha. Now that means the same. That is not something as a matter of concern for us. Both of them mean the same. Okay, so you are saying 1 option was also Clostridium difficile. Doesn't change my answer either ways. Answer still remains Streptococcus pneumoniae. Okay, so the confusion is settled. Let's move on to the next one. This was regarding TB ka sputum sample. Again, going back to the rapid revision videos. When you see this, कि जब भी TB का sputum sample आया, there was a story. Even in the main videos I've taught you, you will ask for sputum sample, patient will give you sputum and spit out a little bit of saliva also in it, because patients don't take instructions very quickly, right? So then how do you concentrate a sputum sample? And we have studied something called the Petrov's method. Now, this is what people wrote on my Telegram group. I don't think you've recalled it correctly. Ideally, जो होना चाहिए was this in the options is what I want to ask you. ये तो जो options मुझे मिले, I don't agree with any of them. The ideal answer should be this. NaOH and N-acetyl L-cysteine. ये था option में. Okay, many of you are saying this there. Perfect. So this should have been perfect, guys. So then I think it's a wrong recall on Telegram that I got from students. Now this becomes, I was worried about this question, that what went wrong here. Now we've got the right answer. It's NaOH and NaLC. NaLC is N-acetyl L-cysteine. That is how you concentrate and make the sputum sample so dense that you can identify TB in it. मिल गया आंसर. दिस इज अनदर वन वेयर आई गॉट 5-6 स्टेटमेंट्स. अब आप मुझे बताओ क्या क्या दिया था. बट ओवरऑल दे डिडंट गिव यू द यूजुअल ऑटोक्लेव. आई मीन दे यूजुअली दिस इज व्हाट वी स्टडी ना, वो लॉन्ग वाला ऐसा वर्टिकल ऑटोक्लेव. आई थिंक व्हाट दे गेव यू वाज मोर ऑफ horizontal autoclave this time. Either which ways, मान लो कि आपको नहीं समझ में आया all of a sudden that what is this big drum that is kept over here. When you started reading the options, it would have given you a hint that they've given me a photo of an autoclave. And then they now tell me क्या पूछा था. We can't have like 7 or 5 options over here. But मुझे जो समझ आ रहा है, number 1, Is it a moist heat sterilization? Yes. Above 100 degree pe moist heat agar ye dikha tha, this is true. Is it performed under pressure? It is like a pressure cooker. It is performed under pressure. Can you sterilize culture media? All except LJ and LSS. Yes, I can sterilize. Is the control Bacillus stereothermophilus? That is also correct. अब ये कुछ लोगों ने मुझे लिखा कि ऐसा कुछ funny सा लिखा था मैम which we had not studied. It's okay. You don't have to study everything which is at an MD level. You have to study something which is at an undergrad level. तो मान लो आपको ये नहीं पता था. The air removal is done through this test. But then you had something like this. Prions are completely destroyed. Are prions so easy that any regular temperature of any regular machine can destroy them? No. Prions are not destroyed at the usual 121 degree for 15 minutes. तो अगर single incorrect statement पूछा था तो I've anyway got my answer. Which means that the last option, if given, is correct. Basically, you are dealing with pressure cooker. Na? So what they do, first they remove all the air. Then they start the machine so that the air does not interfere with it. So that is done through this test. Testing is done. Not important even now for you to know for NEET PG. Exam mein aa gaya doesn't mean I have to sit and start mugging it up. I have to be selective. I've got my answer. That's why it's INI-CET. कि दो options में फंसोगे, but then you'll work your way out. Okay? Perfect. I think instruments after checking for Creutzfeldt-Jakob disease. So basically they were giving you some history of prion diseases. CJD bhi to wahi hai, prion disease hi hai. So maybe they mentioned a disease of prions rather than writing prions directly. Either which way, by heating at 121 degree for 15 minutes, prion nahi kill hote. Prion kill karne ke liye I need a higher temperature of 134 degree, a greater time of 1.5 hour. Any prion disease like Scrappy disease, Creutzfeldt-Jakob disease, not at all easy to kill prions on a regular temperature. तो अगर मल्टीपल करेक्ट था तो मल्टीपल करेक्ट, अगर रॉन्ग ढूंढना था तो रॉन्ग वाला ऑल्सो आई हैव मेंशन्ड हियर. Moving on to the next question, which was on super antigen, I think to do with toxic shock syndrome wala toxin. I don't know if they gave you the typical history of retained tampons and toxic shock syndrome, but agar direct likha tha, very good. Agar retained tampons tha, either which way aapne identify kar liya. You all know that this is what kind of an antigen. If you look at the last video of rapid revision, antigens में 2-3 ही antigen हमने पढ़े थे. Regular antigen, heterophile antigen and super antigen. And the same picture is there in your notes as well. In your super antigen, I've always told you regular antigen comes and sits in the center of the T cell and APC. But the super antigen takes a VIP entry from the side and sits on the variable part of the beta chain. And that is, I am assuming that this was there somewhere in the options. Okay, some of you are saying instead of B cell receptor, polyclonal B cell activation was there. That is okay, but toxic shock syndrome, क्यों होता है? It is because of activation of the T cells. T cells start releasing a lot of cytokines. That is how the patient ends up in toxic shock syndrome. It is not a polyclonal B cell activation, right? Okay, so this answer is also done for us. Now coming to the next one, iska bhi image, I'm figuring it out. Kaun sa image aaya? I've got 3-4 photos for you from the internet, also in the phase of discussing it with students. The confusion in this question is predominantly between these two that I've highlighted. Ki kya wo brush border wala cryptosporidium was there, ya fir RBC engulfment wala erythrophagocytosis wala entamoeba histolytica. This confusion, till the time I don't know the image, I will never be able to solve this for you guys. So I will have to say sorry on this, because abhi also, see, if this photo was there, this is a previous year question from AIMS, this is cryptosporidium. If this photo is there along the brush border, this is also cryptosporidium. Agar kuch aisa photo tha jisme red color ka RBC it has eaten up, erythrophagocytosis wala photo tha, then I would think of entamoeba histolytica. So most of you are saying, acha, someone is saying, ma'am, kasam se entamoeba histolytica tha. So only for your kasam I will consider it, but I will still give you an answer to this in another day's time when I know exactly what photo was given to you. Till then, I think it will be wrong on my part to say one answer. But yeah, if you know that exactly mujhe yaad hai kaun sa photo tha and you're very confident कि RBC wala photo tha, then entamoeba histolytica is going to be the answer over here. Erythrophagocytosis tha, theek hai. Don't cry, guys. Why are some of you crying? Exam se pehle also you were crying. Exam ke baad also you are crying. No, so today is the day to smile and just smile and go to bed and sleep, thinking at least kal to nahi pad rahe na. I hope you're not starting with your NEET PG preparation from tomorrow. So today is the golden day to catch up on sleep. If you had anything pending, like maybe a Netflix series, or you wanted to go outside, you wanted to do something, tomorrow is the day तो आज तो नहीं रोना, टुडे तो यू हैव टू एंजॉय, टुमारो यू हैव टू एंजॉय, मंडे से सोचेंगे, एवरी न्यू स्केड्यूल स्टार्ट्स फ्रॉम मंडे ना, तो हम मंडे से सोचेंगे हमें क्या करना है, बट आज क्यों रो रहे हो, मंडे से तो रोना है, टुडे एटलीस्ट यू शुड बी हैप्पी, वेरी फ्यू मोमेंट्स एंड डेज इन लाइफ यू विल गेट एज अ मेडिकल स्टूडेंट टू बी हैप्पी, एटलीस्ट इन दोज डेज डोंट क्राई, राइट? ओके, आगे चलो, अभी के लिए इट इज एंटमीवा हिस्टोलिटिका. देन यू हैड अ क्वेश्चन where there were painful genital lesions and they were vesicles. Are we confirmed on this to be HSV2? Hoping that इसमें कोई confusion नहीं है. पेनफुल में हो सकता है ड्यूक क्राई, बट देन वेसाइकल्स पढ़ा तो HSV2. I think I can move forward. I don't want to waste more time on this. Moving on to the next question. Yeah, this was a bachcha, I think, 6 week. If I'm correctly, if I've got the correct information, 6 week का था, infant था, seizures था, CSF analysis में bacterial meningitis पता लगा. Now again, single best था, multiple options था, that is something to be discussed. अगर single best most likely organism in this situation, so now I know for a fact that listeria can also cause बच्चों में problem. E. coli, if it was there in the options, that can also cause बच्चों में meningitis. Streptococcus can also cause, but that is Streptococcus agalacti that can cause. Gala time in camp wala, not Streptococcus pneumoniae when it comes to a 6-week-old infant. So multiple tha, ma'am. Okay, then in that situation, ideally, if you ask me, ये सभी कराते हैं. You know for a fact, influenza, pneumonia, agalacti, staph, strepto, listeria, and E. coli. All of them are causes of meningitis. So now I will also have to see that when you are talking about an infant, we will definitely think of that group B, beta hemolytic streptococcus. Agalacti options में था तो for yes. E. coli बच्चों में yes. Listeria बच्चों में yes. For sure, these are going to be there. एंड एक था ऑल ऑफ द अबव और कैन. अच्छा, फिर ये टर्मिनोलॉजी चेंज हो जाएगा ना बिल्कुल. विच ऑफ द फॉलोइंग कैन कॉज, तो कैन तो ऑल ऑफ द अबव है यार. कैन में तो ऑल्दो सम कॉजेज आर रेयर इन चिल्ड्रन, बट कैन पूछा तो फिर देन दे कैन कॉज फॉर श्योर. Maybe what could have changed the answer is, अगर तो ABCD ऐसा दिया था, then can पूछा तो answer is ABCD. Maybe they did something like A, B and D, which would have been a little more appropriate, but all of the above था. Was it there in the options? That's what I'm saying, because Staph aureus, I am again and again saying very very rare. I would not pick that as my answer, but you guys are saying कि मैम एक ऐसा option था which said that what of the following can cause this and all of the above was there, तो फिर then मुझे वो mark करना पड़ा. But otherwise I would not consider ever Staph aureus. And हाँ, if they change it, which is going to be the most likely, and उसमें भी multiple है, तब also I will not mark Staph aureus. Most likely पूछा तो Staph aureus top of the list, top 3 में नहीं आता, but can cause वाला एक vague gray zone terminology बोल दिया, wording ऐसा है can में, तो then I will have to mark can में ना. You've understood why I marked all of the above. Otherwise I am also totally in your, I am in your team. I don't want to mark Staph aureus. मेरा भी मन नहीं कर रहा है. I don't think it is a valid thing to mark. But when the question wording changes, I will have to adapt and I will have to change my answer. ठीक है? और क्या क्या ऑप्शंस थे, मे बी वी कैन ऑल्सो गैदर दोज. यू विल हैव टू टेल मी A, B, D था, B, C, D था. दिस इज व्हाट इज दिस क्वेश्चन इज, सबको पता था व्हाट ऑल कॉजेज नियोनेटल. वी नो दैट द मेन 3 नियोनेटल वी हैव डिस्कस्ड ओवर हियर, वो हमें पता है. यू नो इट, आई नो इट, एवरीवन नोज इट. द क्वेश्चन वाज नॉट ओनली अबाउट नॉलेज, इट वाज अबाउट हाउ द वर्डिंग ऑफ द क्वेश्चन वाज, हाउ द ऑप्शंस ऑफ द क्वेश्चंस वर फ्रेम्ड. देन वी विल डिसाइड ऑन द आंसर. ठीक है, तो एक काम कर लेते हैं, लेट्स पुट अ क्वेश्चन मार्क टू दिस रादर देन फाइटिंग ओवर हियर. हमें नॉलेज वाइज पता है कि आंसर क्या होना चाहिए, हमें सिर्फ क्या लड़ाई करनी है कि वर्डिंग क्या था क्वेश्चन का. दैट इज हाउ विल डिसाइड ऑन द फाइनल आंसर. तो लेट्स कीप अ होल्ड ऑन दैट. वी कैन फाइट ओवर इट ऑन टेलीग्राम ओवर द नेक्स्ट 1 day, एंड वंस वी कम टू अ फाइनल कंक्लूजन, तो देन वी विल मार्क एन आंसर टू इट. बट नॉलेज वाइज हमें पता है कि अच्छा, लिस्टीरिया, E. coli एंड एगेलेक्टी, दीज आर द 3 मोस्ट कॉमन थिंग्स विच आई वुड वांट टू मार्क फॉर दिस एज एट विच दिस meningitis is given. ठीक है, तो अभी के लिए लेट्स टेक अ पॉज ऑन दिस. वाज दिस क्वेश्चन द नेक्स्ट वन इजी? डिप्थीरिया टॉक्सिन, डिक्रीजिंग प्रोटीन सिंथेसिस एंड ADP राइबोसिलेशन ऑफ EF2, ऐसा कुछ था ऑप्शंस में. यू मार्क्ड इट स्ट्रेट फॉरवर्ड, नॉट स्पेंडिंग एनी मोर टाइम ऑन इट. अदर ऑप्शंस आर नॉट मेकिंग सेंस, सो आई थिंक दिस इज क्लियर कट. Yes, diphtheria later on can cause diphtherial myocarditis. It can in rare cases go to the nervous system. Okay, this was a question which comes next. not expected. इस बार Vibrio के questions were the most टेढ़ा मेढ़ा. They did not give you the simple Codzort which they have been giving over the years. This time what they decided was that Codzort तो इन्हें आता है, so let us ask them something random. One question I think they've asked you in Physiology and in Pharmacology regarding the channel for treatment, right? And which of the following channel is used during the treatment of diarrhea and Vibrio cholera? एक तो वो physio वाला question है. One question came that which is the bacteria. Usually when they ask me double stranded, single stranded DNA, virology में जाते हैं. This time with all of this, they came down to all bacterias. And which is the one that can have 2 circular chromosomes or DNA? That is Vibrio. And for your future exams, you should know even Brucella can have it. So this happens to be one added question for us. Because if it is INI-CET, कुछ तो हमें वो सिखा के जाएंगे. Everything we will not be knowing. So this is what they've added to our knowledge. कि although this is a very, very not important question, not at all to be studied, but since they've put it in our list, now this becomes our PYQ for the future. Vibrio can have 2 DNA molecules. Shall we move forward? Another amazing question. This is where again you will help me. I'll tell you the answer, but you will tell me के wordings क्या थे. Bacillus anthracis पे आया, and Bacillus anthracis में you have always taught us, ma'am, that the capsule is poly D glutamate. मतलब कोई तो polypeptide वाला situation होना चाहिए. This was very certain that the capsule has to be polypeptide. तो polysaccharide तो पहले हमने easy ना, INI rule out 2 options, वो तो clear है. अब क्या बचा? poly D glutamate capsule के साथ. What did you mark? I will tell you the theory. This question they have brought out from your second prof exam, जो बिल्कुल expected नहीं होता that they will bring such a Rattafication question at an INI-CET level, which is not even required for NEET PG Ratta, but they've got it over here. When I talk about Bacillus anthracis, 2 चीजें होती हैं. Sorry, there are 2 things. One of them is, just a second, till I think the screen is not responding, but yeah, now it's fine. There are 2 things. One is Bacillus ka capsule, and the other, which I've already told you, polypeptide, and the other one is going to be toxin. So now over here, I think capsule में ये 2 option है, B and D में से what did you mark? B and D में से what did you mark? So please note, ये जो लिखा है ना PXO1 and PXO2, these are actually plasmids. Whether it is the capsule or it is the toxin, it is plasmid coded. This I'm teaching you now for NEET PG because it has become a previous year question. For FMG students, next month you have an exam, this becomes a question for you also. Plasmid 2 type के, PXO1, PXO2. PXO1 is going to code for the toxin, anthrax का toxin. PXO2 is going to code for the capsule. इस basis पे तो ma'am, they should have said poly D glutamate and PXO2, but मेरे हिसाब से answer is option B. Why? Because the question says, what is the virulence of Bacillus anthracis due to? This is like a multi-layer question. Virulence of Bacillus anthracis. So ma'am, number 1 Bacillus anthracis is virulent because of its polypeptide capsule. And number 2, it is virulent because of its toxin. Who makes the toxin? PXO1. Please note, PXO1 plasmid is not making the capsule. PXO1 toxin or plasmid is making the toxin. And the capsule is made by PX or coded by PXO2. So now they didn't ask me capsule का मुझे plasmid बताओ. They said overall सारे virulence factors बताओ. सारे virulence factors में toxin आता है, that is why I marked PXO1. Then virulence factor में capsule आता है, that is why I marked the poly D glutamate. So as I said that agar by chance, that's why I said dependent on you. If they would have said which of the following is a feature of the capsule of Bacillus anthracis, ye agar question hai, then for the capsule of Bacillus anthracis my answer will change to option D, because for capsule I have PXO2. So ये कभी this was not given कि आप ये ठीक कर दो, because someone who studied this way, I teach this to the prof students so that they can increase the number of pages in their exam. Not something I would want to teach to any entrance exam student because it's pure ratification. No clinical significance as such in questions. तो अगर अच्छा, many of you are saying कि मैम सिर्फ पूछा था कैप्सूल का बताओ, तो अगर कैप्सूल का पूछा था तो ऑप्शन डी I'll write as the answer. अगर virulence overall पूछा था तो ऑप्शन B is the answer, which I think is settled. और तो कुछ नहीं बचा. If something is left, you can let me know. Apoptosis, okay, this I've not received as any answer. Papain and pepsin wala tha. What about papain and pepsin? Were they, this is again, if you go through your main videos, immunology section of micro, it is there. Papain and pepsin basically break our immunoglobulin, they're chemicals. And I don't know if 2-mercaptoethanol was also mentioned, तो वो भी break करता है हमारा. All three were given. What did you have to do? Match the following. Okay, just hang on. I think is this, मतलब ये फोटो तो नहीं होगा, but ऐसा कुछ similar होगा. तो this is what papain, pepsin and 2-mercaptoethanol does to our antibody. These are tests that you can do. You identify these are antibodies. Was it like 3 photos were given and then you had to just match which one is papain? Okay, then in that situation, so papain, if you go through the main videos, jo I'm not even like judging you for it agar if you didn't know, because who remembers so much from the main videos? It is not something as an easy task. But papain always breaks above the bond, which means it will break it into 2 FAB segments and 1 FC segments. So above the disulfide bond it will break. When I talk about pepsin, अगर papain above the bond break करता था तो pepsin below the bond break करेगा. Pepsin will break below the bond. So below the bond, can you see the entire FAB goes away as one. अलग अलग नहीं हुआ. The entire FAB has gone away as one fragment and FC comes out as one fragment. Above में क्या हुआ था? Papain में FAB अलग अलग and FC अलग. 3 अलग अलग टुकड़ास. FAB and FC. Below the bond, that is by pepsin, the FAB as one separate segment goes away joint and FC comes across as a second segment. Then what happens in 2-mercaptoethanol? Chains divide ho jati hain. You can see how the light chains have gone though separate, how the heavy chains will then go though separate. So it will break the entire antibody into 4 parts, 2 light chains, 2 heavy chains, number of segments that were formed. Only the first photo was there. So if only the first photo was there, then this was papain. If now you will let me know, you are saying ma'am ye wala photo tha, to answer then becomes papain. If they would write it as if they want to write it as theoretical, they will say how many FAB segments are there? There are 2 FAB segments and there is 1 FC segment. ऐसे भी लिख के दे सकते हैं. Component लिखा था, ठीक है. तो papain का let you know there are 2 FAB अलग अलग segment, 1 FAB and then 1 FC segment. ठीक है. Versus pepsin, which you're saying जो आया नहीं था, तो सिर्फ papain आया था, तो papain का आंसर I've told you. तो ऐसा ही कुछ लिखा था. So this is the answer. 2 FAB and 1 FC. You can see over here 2 FAB and 1 FC. 1 photo and 3 enzymes. तीनों था. Either which way guys, अब आंसर तो हमें समझ आ गया ना. The wording of it, how it's placed, वो हम अभी figure out कर लेंगे. What is this? I have, okay, तुक्का ठीक हो गया. Excellent. Anything else? Papain, pepsin तो done. चलो, this I will add in my list. One thing I've got from biochemistry के कुछ CRISPR-Cas9 का spotter आया था. This is also what I have, since you've done it in biochem, I didn't repeat it. That is something I will add in the PDF. What else? Mucor questions. No one told me about those. 2 mucor questions is further, I hope, good questions. I hope not bad questions. But एक तो वो pharma वाला mucor question है, which is to do with a drug, which I think Ankit sir will revise with you. Anything else? और कोई मुझे mucor नहीं मिला. Micro related आया, pharma related आया. Was it integrated? Diabetic patient था. Okay. So let's see. Let's wait for more input on these. Diabetic with black fungus, pretty easy. If अगर सिर्फ diagnosis था तो mucor या rhizopus family, whatever was written, zygomycetes, ऐसा कोई भी word लिखा हो family का, it means the same. Black nasal mucosa, okay. Then one more question added in our pool, black fungus वाला mucor का. तो mucor का एक diagnosis वाला question था, one treatment वाला question था. ठीक है. Asherman syndrome and all जो students are mentioning, वो अभी वो तो गायनी हो गया ना. So that I'm sure it's a lag होके अभी आया है. I think done. So let's not, as I said, let's not break our head more over it. Abhi tak to 20 questions of each subject we have got, which is a huge number. But I'm not shocked because with INI-CET, wo to abhi tak hai and counting. Because over the next 1 or 2 days, maybe 5 or 7 more I will add on to this. And yeah, that is a good chunk of questions for INI. I'm not shocked because pre-paraclinical subjects में से questions नहीं आएंगे तो फिर किस में आएंगे? This is very obvious. And Gleason scoring of prostate I have already done. Egg questions also I've done. For those of you who are joining right now, a lot of these questions we have discussed. If you want to go through the entire session, your wish. If you don't, you will get the PDF in a day or 2 and then you can just scan through it. Grade 4 we have done. Pacinian corpuses. Okay, I will add that also. This is also not a new question. ये histology anatomy से आता है, but this is also a PYQ when it comes to your INI-CET for anatomy. अभी तक 40 and counting है, but I'm sure we'll have a better count once. Let's give it 48 hours. Let you get over this entire trauma. Let more questions come back to your memory, and then we'll be able to have a better PDF and recall for all of you. Right. Thank you so much. And I think Ankit Goyal sir has joined us. He will be taking the psychiatry recall for all of you. I'm sure it went well. So mixed emotions overall, but I'm sure now you just need to see this recall and kind of get over it. But I don't think I'm going to go into that mentorship zone right now because we have Ankit sir with us and he'll do that best for all of you. So apart from teaching, that's entirely what he takes care of the best. So I'll leave that for the best person to do for you, and I'll meet you in the future days. But for now, take a deep breath, relax, and yes, I think in a minute sir will be joining and we'll take the recall for you.
So very good evening, everyone. I hope the exam went well. And quickly let me know in the chat box but if I'm audible and visible, and we'll quickly discuss the psychiatry questions. I'm sure this must have been a tiring day, but we'll quickly recall the question. And if there is any correction, you can put it in the chat box. And later on also you can come back in this video and you can just type down any correction, and we'll later on put all the question in the app. And what we could gather, we got around 8 MCQs from psychiatry. And what I've heard from the previous discussion that the paper, other subjects were, I would say, a moderate to a bit harder side, but I'm sure psychiatry questions would have brought a sigh of relief. There were more of doable questions in psychiatry. So let's quickly discuss the MCQs and let's quickly solve these questions so that we have a closure that yes, we have done well, at least in psychiatry. So a drug user presents to the psychiatry department with an unconscious state, pinpoint pupil respiratory depression. So can you appreciate, we have been discussing this even in the LRR session also, we've talked about this. So this is opioid intoxication. So the patient has presented to us with opioid intoxication, or you can say opioid overdose. So what is the right answer, beta? What is the right answer? So we know the drug of choice is option B, that is naloxone. So I'm sure all of us would have got this question correct, right? So let's discuss the next question. Again, a question, INI-CET has been very famous for asking about drugs, and this is one drug. I'm sure even seeing the option also you would have got it, but you would see majority of the questions we have discussed in the RR videos as well. So please see which of the following is a novel antidepressant. But whenever we talk about SSRIs, we talk about this drug that is vilazodone, and we discuss this is a SPARI drug. What is SPARI? That is a serotonin partial agonist and reuptake inhibitor. So I'm sure all of us were able to get this answer correctly. Okay, so there are some corrections. Cis laxative abuse. Okay, so here the answer is very good. The answer is vilazodone. Okay, I hope all of you were able to get this answer correct, right? So let's move on to the next question. Again, this is one of the typical question of the INI-CET, one of the favorite topics of INI-CET. See this question: a 2-year-old female child presents with regression of acquired milestones. There are breath holding spells. Please see hand wringing movements, microcephaly. What is this all pointing towards? So again, one of the favorite topics, we have even discussed this in the LRR session as well. So this is classically what is Rett syndrome. So I hope all of you got this answer also correct, beta. This is Rett syndrome. Okay, I hope this is correct. See, in childhood disintegrative disorder, we discussed that the child is usually normal till 2 years. So they're giving you this history. Even in childhood disintegrative disorder or Heller syndrome also, there is regression, but we know that it is normal till around the initial years. While here they're telling you this history. So this is again classical, typical of Rett syndrome. Very good. Let's see this next question. Again, a typical question, a typical topic. See, alcohol is one of their favorite topics. And again, you can see this question. In fact, I'm sure this question has been also asked previously as well. So it's a PYQ. Which of the following statement, you have to tell me true statement about Korsakoff syndrome? What is the right answer? But Asperger, if you are asking about Asperger, in Asperger again, you will see this history. It is also included. We have discussed. It is also included in the autism spectrum disorder. And you will see in Asperger syndrome, when they are trying to ask you, they will give you a history that the language development is usually normal. Okay. Now see this question. Here the answer is, I'm sure all of us are able to answer this question, but again, we have discussed about alcohol-induced neurocognitive disorder. So whenever we discuss with a Korsakoff syndrome, even in the LRR session, we have discussed the amnesia occur, and we have known that it is anterograde amnesia, which is more common than the retrograde amnesia. So here the answer is option A, that is anterograde amnesia with loss of recent memory. So I hope all of you were able to get this answer correctly, beta. Now let's see the next question. Now this I would say, this would be, a typical of a INI-CET wala question when they would want to ask a slightly difficult question. But still, let's try to figure out the options. And two options, you would see from a lecture, you would definitely would have ruled out two options. So which of the following statement, but if you tell me is true regarding nicotine replacement therapy? See the question and tell me about the options. Are the options correct? See, when we see option number D, nicotine delivery is preferred through the GI route. In fact, this question we have discussed in the LRR discussion of INI-CET psychiatry. We discussed in nicotine dependence. In fact, we talked about nicotine gums, the method used is chew and park method. We're trying to increase the oral absorption. In fact, we also talked about some of these nicotine replacement therapies, that is gums, lozenges. There are patches. There are other ways also, like nasal spray, inhalers. But we are trying to give nicotine through other routes. Why? Because nicotine undergoes first pass metabolism. So we're trying to give nicotine through other routes. So this is an incorrect statement. But also we've discussed about varenicline. First of all, I'm sure you could have ruled out this option because varenicline is not a nicotine replacement therapy. It's a non-nicotine treatment. And we've also discussed that it in some patients it increases the risk, especially those patients in which there is already a cardiovascular risk. In those patients, it increases the risk of cardiovascular disease. So it is again not a black box warning for varenicline. Now let's see the remaining options. The patients are instructed not, to avoid. So patients are instructed to avoid coffee, acidic beverage 15 minutes before or after using nicotine. But this is in fact a correct statement, because these acidic beverages such as coffee, cola, sodas, they decrease the nicotine absorption. So this is incorrect. Now please see, even if you didn't know this, again, I would say yes, this was a slightly tricky question. You might have got confused between A and B. Option A is also incorrect. Nicotine gums are superior to lozenges and increase 20 to 30% plasma concentration as compared to lozenges. No, in fact, it is other way around. Lozenges, they increase the concentration 25% more as compared to the gums. So this is also incorrect statement. So I hope all of you are able to see this question. Yes. So the correct answer is better. Yes, patients are instructed to avoid such acidic beverages, when they are using nicotine gums. Is it clear to everyone? Right. Let's see the next question. Again, a question, if you would see, the question is giving you a lot of important hints. A 45-50-year-old recently divorced male with depression with increased alcohol use says there is no point in living. He's reporting of suicidal thought. What is the next best step in the management? But again, can you appreciate, we have discussed this again in the version 11 rapid revision videos. We've talked about so many of these risk factors for suicide. Can you appreciate they've given in the question the male patient age, they're given 45 above, he's having depression, he's consuming substance, also he's recently divorced. So a lot of risk factors they have mentioned. So there is a high risk of suicide. And when we're talking about the management, we have discussed, see in the MCQs, one of the preferred treatment, patient with depression, with suicide, again, one of the preferred treatment we've discussed ECT, because we know drugs such as SSRIs, we would start, but they would take time. Even therapy such as CBT would take time. This is, you can say, it's an emergency. So patient safety is very, very important. So the right answer here is option C, that is hospitalization and safety measures. Sometimes, when you see such questions, you're able to get to the right answer, by seeing the options. I hope this was clear to everyone. Very good. So yes, psychiatric question, I'm sure, would have brought some sigh of relief. Now this question I would say was not in the RR videos, but yes, you would see this in the main videos when we've discussed in psychology. What is the definition of classical conditioning? So we have discussed this, and I'm sure, we would know this even in our basic, years. We have learned about this famous classical conditioning, that Pavlov experiment. So we know that when he, brought food in front of the dog, so food is an unconditioned stimulus. Dekho, unconditioned matlab it's a natural stimulus. There is no conditioning required. So when the dog was presented with food, what would happen? He would salivate. So that was a natural response. So that produces unconditioned response. So what he did was he also added a neutral stimulus. So he also started ringing bell. So what he did was he paired these two together, and after some time, now when he just rang the bell, the dog also started salivating, which otherwise he would not. So can I say now this bell has become a conditioned stimulus? There is conditioning being done. And now this response is known as conditioned response. But sometimes we get confused between unconditioned, conditioned. But if you know the basics well, now you can answer this question. So now can you appreciate, what is the right answer here? What is the right answer here, The right answer here is a conditioned stimulus produces a conditioned response after learning. Yes, this is the definition of classical conditioning. Even if there were some changes in the options, but see this, the concept should be very clear to us. We have discussed some of the latest antidepressant, right? Like we have discussed about Gepirone also. We've talked about so many drugs, even in the LRR session also we've discussed. We've talked about drugs such as brexanolone, zuranolone also. We've talked about ketamine, S-ketamine. So sometimes they ask questions on novel drugs, right? Let's discuss the last question. Let's discuss the last question, beta. Again, this is a question I'm sure you must have read even in pathology also, but again, we have discussed this in psychiatry as well. So elderly patient, he died on autopsy, neuritic plaques. So we have discussed this in the management. Whenever we talk about the management, we always try to correlate with the etiology, right? So we know these neuritic plaques, these A beta deposits. So these are seen in which conditions? So these are seen in Alzheimer's disease. Again, dementia is a topic you will see in so many other exams. And of course, many of us would be also giving the NEET PG exam. So you should be very handy with these topics. So these were some of the questions, beta, which we have discussed. Now, a very simple message from my side would be, beta, doesn't matter how the exam went. Now, many of us, most of us would also be giving the NEET PG exam. Please take this exam as a feedback, not just about the MCQs beta, but also take it as a feedback of the entire exam giving process. And from the morning till evening, you've gone through a real exam. So take it as a feedback, try to improve upon certain areas which you find could have been improved. And also, of course, identify your weak areas from these MCQs and improve upon them. Okay, with this, I would stop now. And I would like next faculty, Dr. Akhilesh, would now join in. And any changes, any options you feel were different, just let me know. You can always message in the Telegram groups, or even under this video, you can just write down those questions and we will subsequently edit that, and then we will put the final video in the app. So with this, we'll stop now. Thank you again. May God bless you, beta. Keep smiling, keep moving forward.
So hello friends. So the forensic INI-CET में कैसा था? It was easy, moderate. It was easy to moderate. Okay. है ना, कैसा था? बहुत क्वेश्चन आए थे. There were almost 12 questions. Okay. Am I audible and visible to everyone? चलो आगे. और जो फोरेंसिक के क्वेश्चन थे, yes. Okay. Forensic question were from LRR, RR and regular classes, है ना? From all these. Okay. चलिए स्टार्ट करें. चलो. The first question was very simple. Direct question from. Yes. Yes. Burn injury on the face, chest due to blast or which type of injury? I discussed this in LRR also. This was a quaternary blast injury. The primary blast is because of air compression. Secondary blast is a Marshall triad. Yes. Okay. The tertiary blast is because of fall and collision or building collapse. And quaternary blast is because of burn, flame and fume. ये सबका सही हुआ था? ये बच्चा सबका सही हुआ? बहुत इजी क्वेश्चन था. LRR में डिस्कस किया था, है ना? पक्का? चलो आगे. चलो. Match the following. बहुत easy question. Carbon monoxide, cherry red staining, cyanide has a bitter almond smell, phosphorus has a garlicky smell, and organophosphate has pinpoint pupil with increased secretion. ये सबका सही हुआ. ठीक है. आपको जो भी ऑप्शन मिले, whatever mark, X, carbon monoxide, cherry red staining, cyanide, bitter almond smell, phosphorus, garlicky smell, yes, and FMT was easy, but I did silly mistakes. Okay, chalo. बहुत easy question. Very easy question. Which of the layer is involved in this tattoo image? Everyone knows. I discussed in this LRR also. Like the tattoo mark or the dye goes to the regional lymph node. So it is a regional lymph node biopsy is done. So it goes in the dermis level. That was a very easy question, but it was a common sense question. Okay, chalo. Which of the following injury is shown in this image? It is the injury. Yes, it is the injury which is showing. If you can see, this is the shape which is having maximum depth. Yes, maximum depth in a wound that is a stab wound. It would be a stab wound. Okay, it is a single edge weapon with clean cut margin. Without any doubt, it would be a stab wound. It would be a stab wound. Very simple question. According to me, incise was not the option. What was the option in place of incise? What was the option? Anyone? Yes. Sriraja Shai, what was the option in place of incise? Oh yeah, idea? Any idea? I'll place that option. Okay. Firearm. Okay, that I'll add. मैं इसको ना अपनी जो final PPT होगा उसमें add कर लूँगा. ठीक है? Okay, laceration is given, contusion is given. So, but anyways, it is a straightforward question. By the image, you can see the maximum part is depth. It is a stab wound. Now it was another question which was a pinpoint pupil, bradycardia and respiratory depression, excessive salivation. All are the cholinergic effects, sir. And the treatment of choice by this we can say it's a organophosphate. What is the treatment of choice for organophosphate? Okay, वो lacerated लग रहा था, but lacerated clean cut margin नहीं होगा. Laceration that would be a irregular margin. It was showing a clean cut margin. Okay, there may be a two-step wound. But if the depth is maximum, that would be C. Now tell me, organophosphate. Yes. What is the treatment? Organophosphate. Yes, it is atropine, not prelidoxine. The best antidote would be, the treatment of choice would be, है ना? इसमें treatment of choice atropine होगा बेटा. ऐसे कैसे oxime कर रहे हो? Sir, it is incomplete question. हाँ, इसका मेरे को ना few student were saying कि इसमें कुछ और part भी add था. Pesticide was given. I'll come to that point. Okay. हाँ, yes, I am coming to that part also. सर उसमें रीएक्टिवेशन ऑफ एस्ट्रेज. हाँ कोई बात नहीं. आई एम कमिंग टू दैट पार्ट ऑल्सो. ओके डोंट वरी. रीएक्टिवेशन ऑफ एस्ट्रेज अगर पूछा है, दैट आई एडेड इन द नेक्स्ट क्वेश्चन. आई टेल यू इफ द रीएक्टिवेशन ऑफ एस्ट्रेज वाज आस्क्ड, द आंसर विल बी प्रेलिडॉक्सिन. अगर reactivation of esterase was asked, the answer was yes, pyridoxine. Okay. If it is cholinesterase activation, the answer would be pyridoxine. And if this question is asked, I'll come to that question also. Okay. Okay. Reactivation, the answer will be pyridoxine. Okay. चलो पक्का? हाँ जो भी होगा मैं उसको correct कर लूँगा. ठीक है. A male with Afghanistan came to the India, died in the hotel room. Autopsy showed these filled substance, है ना? And a packet of substance थे stomach में. This is known as body packer. Actually, body packer is used for drug smuggling, especially for international carrier for large amount, है ना? बड़ी amount है ना? Huge amount. If you are carrying from one country to another country for drug smuggling, it will be a body packer. But if you are a consumer, है ना? अब अगर आप consumer हो and you take a small amount and you suddenly swallow, that would be a body stuffer. But here, it's a large amount, large packet was given. Yes, it was a body packer, है ना? Done, sir. हाँ, best antidote वाला एक question आएगा. I'll let you know कि best antidote वाला आएगा, उसको भी complete करेंगे. ठीक है? No problem. कोई issue नहीं. चलो. In which condition the sparrow foot mark or injuries are seen? ये question पक्का था. So sir, sparrow foot mark are actually the glass or windshield injury, है ना? हम क्या होते हैं? We are sitting on the front seat. Suddenly our face strike the glass or windshield, है ना? So that is a motor vehicle accident. That is a sparrow feet mark, है ना? There are punctate laceration on the face. ये भी पढ़ाया हुआ, सब कुछ पढ़ाया हुआ. It is a motor vehicle accident. Okay? चलो. Next question. Image of the bullet injury and abrasion and grease color was present and the question was mentioning tattooing was absent. है ना? अब ये क्या मेंशन कर रहा है? Abrasion और grease color is present. Abrasion and grease color is present in all type of entry. So it is not going to give, ये है ना, कोई भी idea नहीं देता whether it's a close shot, contact shot, है ना, किसी के बारे में idea नहीं देता because it is present in all type of entry shot. Okay, but tattooing is absent. Tattooing is absent means all other findings are also absent, है ना? There is no singeing, no blackening, there is no singeing, no blackening, no tattooing. It will be a distant shot. This I discussed in LRR also, है ना? हाँ, exit wound वाली option में होगा, but it would be a entry wound, है ना? Because abrasion and grease color is present. That is seen in entry wound only. Okay. Okay. चलो. सब क्वेश्चन बहुत इजी है. दैट वाज ये थोड़ा कैची क्वेश्चन था. A 16-year-old girl was sexually assaulted and raped by 22-year-old neighbor. Okay, she now comes with the hospital in 16 weeks of pregnancy. All of the following are medico-legally significant except, है ना? Okay, कोई बात नहीं बेटा. अगर abrasion और grease color is mentioned, that would be entry wound. एक बात ध्यान रखना, abrasion और grease color mention है तो that would be entry wound, and tattooing, singeing and blackening all are absent. That would be a distant shot. Okay. If it is everted, if it was everted, if it is mentioned that it was everted, then it would be a exit wound. Okay. अगर ऐसा mention हुआ है कि everted था, अगर ऐसा था, okay, so उसमें कोई नहीं, अपना crystal clear concept होना चाहिए. If it is mentioned, then it. Okay. देखो, 16 week of pregnancy and 16-year-old girl. Okay. So 16 week of pregnancy, yes, this is the right answer. Here they asked the accept. ध्यान रखना, यहाँ accept पूछा था. ठीक है? Image is showing everted. Okay. अगर image everted showing था, that would be exit wound. Okay. Don't worry. But abrasion or grease color is present. That is the entry wound. Abrasion or grease color is present. That is the entry wound. Okay. For 16 week, 12 to 20 week, we require one doctor. This is the right answer. This is the right option. Medical legal examination after parents' consent. My dear friend, for general physical examination, हमें generally general physical examination के लिए you can give consent after 12 years. So she is 16 years. So this is the wrong answer. Inform the police. It is a rape case. It is a statutory rape. So you need to inform the police. And preservation of fetal tissue for DNA for paternity and maternity confirmation. That is very important. That is because like if DNA is there, that is any kind of paternity dispute is there. So if we are filing a case against the accused, so that is a preservation of it. So this is the right answer. This is the right answer. Only option B is incorrect. Yes. Parents consent 18 years is given. Beta, मेरी बात ध्यान से सुनो. It's very simple. After 12 years, you can give the consent for any physical examination. So here the girl is 16-year-old. So here the option B is incorrect. Option B is incorrect. Okay. दो doctor opinion था for MTP. अगर दो doctor था तो that was the wrong answer. Okay. Yes. No, it is not a superficial examination. It's a general physical examination. You can give consent after 12 years. So it is a wrong option. Okay? Yes. You can give consent for your general physical examination after 12 years. One doctor only, that is right. अब देखो ये बेटा, a child present with hypotension, respiratory depression and pinpoint pupil, this is a clear-cut case of opioid. The answer is naloxone. Antidote is naloxone. I'll discuss it again, don't worry. Okay, I'll discuss. But the maximum people are saying it's a one doctor. So here answer is B, that medical legal consent after medical legal examination after parent consent. So this is A, naloxone. Very simple question. हाँ ये देखो बेटा, infant with pesticide injection came to the hospital, which will reverse acetylcholinesterase block. That here answer will be prelidoxine. Here answer will be prelidoxine. Okay, यहाँ ध्यान रखना. Is it clear? If she was 22 week pregnant, but maximum students are saying it's a 16 week pregnant. Okay. चलो जो भी हो इसको फाइनल तो मैं बना के भेज दूंगा आपको, टेंशन मत लो, ठीक है. सो दिस इज द क्वेश्चन वेयर यू विल रिवर्स द एसिटाइलकोलिनेस्टरेज ब्लॉक, दैट वुड बी प्रेलिडॉक्सिन. यस यस सर, ये क्वेश्चन मेरे को बता दो, व्हाट वर द ऑप्शन इन दैट क्वेश्चन? एनीवन टेल मी. रेस्पिरेटरी डिप्रेशन इज नॉट सीन इन विच ऑफ द फॉलोइंग पॉइजनिंग? कैन यू टेल मी व्हाट वर द ऑप्शन? रेस्पिरेटरी डिप्रेशन इज नॉट सीन इन द पॉइजनिंग. ऑप्शन क्या क्या थे? कैन यू टेल मी? यस 16 वीक था तो कोई दिक्कत नहीं, मेरे वाला राइट आंसर होगा. Can you tell me? Respiratory depression is not seen in which of the poisoning? What were the option? क्योंकि इसमें बहुत लोग अलग अलग ऑप्शन बताए. चलो, Datura was not there. Okay, Datura was not there. C or D was पक्का. Yes, barbiturates was there and opium were there. Yes. अगर ये ऑप्शन थे, A, C, D were there. Option are the exact. Datura was there. Was Datura was there? Anyone? Yes. Gelsemium, opium. Okay. No Datura. Chalo, I'll eliminate Datura. If I eliminate Datura, then respiratory depression are seen in all poisoning beta. Respiratory depression are seen in all poisoning. Okay, so अगर Datura नहीं था तो respiratory depression is seen in opium, barbiturate, even strychnine causes respiratory muscle spasm, convulsion. That is also causing, and that gelsemium, both are spinal cord poison. है ना? तो both are causing this. If Datura was not there, all are causing respiratory depression. है ना? इनमें से अगर आपको एक पिक करना होगा तो INI-CET will decide which has to be picked. Okay, they are central respiratory depression. If they are central respiratory depression, then answer you can pick strychnine, but I don't think like that was the question. Respiratory muscle paralysis was the option. Okay, great beta. Chalo, let me decide and let INI-CET decide like what was the option. But if these are the option, opium, barbiturate, strychnine, gelsemium, all causes respiratory depression. All causes respiratory depression. Now you are asking about the CNS depression. Okay, chalo, let me come to all the question again. That was a very simple first question. The burn injury is seen in the quaternary blast injury. Okay, this is the carbon monoxide, cherry red staining, cyanide, bitter almond, phosphorus, garlicky smell, and organophosphate pinpoint with increased secretion. Okay, done. The tattoo mark on the lymph node, yes, LRR से आया हुआ, directly LRR से आया हुआ. This is dermis. Yes, ठीक है, अभी देख लेते हैं. This is the maximum dimension is depth, clean cut margin, that would be a stab wound. इसमें भी कोई भी दिक्कत नहीं होनी चाहिए. Okay, ठीक है. The burn and flame are quaternary injury beta because these are caused by the last injury. That's a quaternary. Okay. This was a question of organophosphate. If only this was a question, atropine was there. But if reverse acetylcholinesterase, the answer will be prelidoxine. Okay, prelidoxine. Okay, beta. This is a body packer syndrome by carrier, international carrier for drug smuggling, and suddenly you swallow or consume it, that's a body stuffer syndrome. This is glass windshield injury, sparrow foot mark, motor vehicle accident. If there is a inverted margin, abrasion and grease color are present, no tattooing, no singeing, no blackening, it's a distant shot. But if inverted margin and abrasion and grease color are not mentioned, then it would be exit wound. But most of the students are saying it is no tattooing with abrasion and grease color, it is a distant shot. Okay. This is very simple question. For 16-week pregnancy, one doctor. After 12 years, you can give consent for physical examination. Inform the police is the right one. Preservation of fetal tissue for paternity confirmation. So here accept is option B. Okay. Okay, this is hypotension, respiratory depression in pinpoint pupil. It is an opioid intoxication. Naloxone is an antidote. This was a question you are saying that reversing the acetylcholinesterase, it is pralidoxime. And if this is a respiratory depression, is not seen in which of the poisoning? It is seen in opium, it is seen in barbiturate, it is seen in strychnine, it is also seen in gelsemium. If you want to pick one answer, yes, if you want to pick one answer, you can pick any of these because all are causing respiratory depression. अगर CNS depression था, CNS depression था तो strychnine and gelsemium are the spinal cord poison बच्चा. तो ये दो ऑप्शन हो गए. Okay, central nystagmus भी एक क्वेश्चन था. चलो, anyways. So these were 12 questions. I'll go for the respiratory depression and CNS depression question again. Don't worry. तब तक आप आराम से रिलैक्स रहो, थोड़ा सा मस्त हो जाओ और नीट पीजी की तैयारी में लग जाओ. अच्छा, रेस्पिरेटरी मसल पैरालिसिस था, कोई बात नहीं. I'll pick the exact word which was asked by some other student. But anyways, आप आराम से नीट पीजी की तैयारी करो, रिलैक्स हो जाओ, थोड़ा एक दो दिन मौज मस्ती करो, get relaxed, get proper sleep and okay. They ask something else, whatever the language comes, I'll let you know. Don't worry. Okay. Chalo, thank you very much. God bless you all. मस्त रहो, खुश रहो, हमेशा मुस्कुराते रहो. God bless you. Bye. Take care.
A very good evening, all of you. So, welcome to the Pediatrics recall session for this INI-CET exam May 2026. So, it is almost the fag end of the day. All of you must be really tired. I hope you were able to give the best of whatever you could in this INI-CET exam. The paper, I believe, was moderate to tough, but nevertheless, the pediatrics questions were easy, as said by most of you. Right. So we will start with a disclaimer that these are recall based questions which I've obtained from the students. So this may or may not, exactly match with the question that was asked. So I would need your help here. So if you feel that there was any change in the question or some other options were there, please contribute so that we can come up with the most accurate version of the recalled questions and we can help discuss better and learn how to approach these questions. So this will be a very, very brief session and we'll be focusing here mainly on seeing what the questions were as per the recall and what were the correct answers. Yes. So let's start. Yes. Can someone please confirm if I am audible and if my screen is visible so that we are good to go? Yes. Okay. Thanks, Lokesh. So the first question which I have got here, which of the following is not a criterion for Kawasaki disease? A pretty straightforward question. So this we have discussed in our LRR session also for INI-CET. So the options were that purulent conjunctivitis, cervical lymphadenopathy, periangular desquamation, polymorphic rash. So we know this is straight from our LRR for INI-CET. So we discussed that Kawasaki disease is the diagnosis here we know. So fever for more than 5 days with any 4 out of the 5 cream features. And in the cream features, C for conjunctivitis, and we clearly mentioned it is non-purulent conjunctivitis. It is not purulent conjunctivitis, and you can see this polymorphous rash on trunk, edema and erythema and desquamation of extremities is there, cervical lymphadenopathy is there, strawberry tongue is there. So our best answer here, undoubtedly, which of the following is not a criterion for Kawasaki disease? So purulent conjunctivitis is the answer here, right? Okay. So moving ahead, so we have the next question here. Yes, this is pediatrics. So a 3-hour old newborn. So we have a 3-hour old newborn, right? Has blood glucose of 38 milligram per dl. That means this is hypoglycemia. We know neonatal blood glucose less than 40 milligram per dl or plasma glucose less than 45 milligram per dl is hypoglycemia in a neonate. Now, what is mentioned here is that it is asymptomatic hypoglycemia. That means the baby has been found to have low blood glucose, but the baby is not having any symptoms because of it. So this is again, this we have discussed directly in our LRR for INI-CET. So let us see what we discussed and then we come back to answer our question. So we discussed already that if it is symptomatic hypoglycemia, so if it is symptomatic hypoglycemia, so let me enlarge my screen a bit if that helps. So if this is symptomatic hypoglycemia, what we do is we will give IV 10% dextrose 2 ml per kg and start continuous IV fluids and monitoring. But if it is asymptomatic, we will see how much is the blood glucose, right? So if the blood glucose is less than 20, then you straight away start IV fluids. But if it is between 20 to 40 milligram per dl, as in the given question, what are we supposed to do? So we'll offer a feed to the baby and recheck blood glucose in 30 to 60 minutes. And then we will continue frequent feeding and monitoring. So in the given question, you can see that the blood glucose is between 20 to 40 milligram per dl. So what are we supposed to do in this asymptomatic baby? Yes. So we will, of course, continue breastfeeding and reassess blood glucose. Okay, so we will not initiate dextrose infusion. We cannot leave it as such and reassure because, of course, it is neonatal hypoglycemia. Right? And giving a bolus and reassessing is not required. Right? Okay. So moving ahead to the next question that we have here. So there is this 18-month-old child. So 18-month-old child who can walk, scribble, can walk, scribble and obey one-step commands but speaks only monosyllables. What is the next best step in management? Right? So 18-month-old child. So this is the 18-month-old child. So we know walking. Walking comes around 12 months of age. So this child is able to walk. Scribbling comes around 15 months of age. This child is able to scribble. That's fine. And obey one-step commands comes between 12 to 18 months of age. That also this child is able to do. So till now, the developmental milestones appear okay, but the child is able to speak only monosyllables. Okay. So, Lokesh is telling the child is able to Speak one meaningful word, he's telling. Okay, speak only one word. Only one word, right? What is the next best step in management? So, we already discussed that there are some red flag signs, upper limits. So this again is from straight from our LRR for INI-CET. So we discussed that there are some upper limits or red flag signs for each milestone. So, for 1 to 2 words with meaning, it is a red flag if the child is not able to do that by 15 months age. So, beyond 15 months, if the child is not able to speak 1 to 2 words with meaning, then it is a red flag. So, here what is happening is the child is 18 months old and the child is able to speak only one word with meaning. So, yes, we have to think that there could be some underlying language issue. And whenever we think of a language or speech problem, we first do the hearing assessment. Okay. Oh, so Manideep is telling normal hearing was given. Okay, hearing is normal was given in the question. Okay, hearing is normal was given in the question. What were the options? Can someone help? Can someone help? Were these the options? So see, if these were the options, start anti-epileptics will definitely not be the answer. This is not a seizure. Okay, there's no indication to tell us that it is a seizure. Assess hearing and language development appears to be the most plausible answer out of the given options. Reassure and reassess at 5 years? No, it would be too late. If at all there is some language delay, we have to start early stimulation. We have to start speech therapy after confirming that the hearing is okay. So reassure and reassess at 5 years will be too late. Immediately diagnose autism spectrum disorder? No. We can screen for autism spectrum disorder though. So we can use tools like MChat and we can screen for autism spectrum disorder in such a child. So if these were the options which I have got from the recall, out of these, the best answer would be B, assess hearing and language development. Okay, so Asparagus is telling speech therapy was one option. So if speech therapy was an option, then I would go with speech therapy as a better answer. Because you're saying hearing is normal is given in the question. So if hearing is normal and is given in the question, then I would go with speech therapy as the answer. Okay. So speech therapy as the answer if hearing is normal. Yes, Dr. Alu. So if hearing is normal was given, then of course assess hearing would not be in the option. है ना? So it could be assess language development हो सकता है. It could be speech therapy. So if someone can tell me, so some people are telling that speech therapy was an option. Travel Life is telling speech therapy was not an option. So what were the exact options? Can someone come up with what were the exact options? Then we can come back and discuss this question again. Okay. But start anti-epileptics to nahi hoga answer. Reassure, reassess at 5 years. We cannot sit and wait till 5 years if there is a delay. Again, that should not be the answer. Immediately diagnose autism spectrum disorder bhi nahi hoga. You can screen for autism spectrum disorder if that was one of the options. Fourth option kya tha? Somebody can tell me, then we can discuss about that. Okay. So moving to the next question. Again, this is a cliche question. We had discussed again in our INI-CET LRR. So this is a 5-year-old child. I don't know whether a boy child or girl child was given or not. Okay. So boy child or girl child was given or not. But it is brought with, the child is brought with progressive loss of eye contact, repeated hand clapping movements. So agar repetitive या stereotypic hand wringing movements हमें मिल रहे हैं. Repeated, what is coming here? So repeated hand tapping movement. Just give me a moment. There is this thing that is coming in the video. Let me just talk to the tech team. Okay, girl child was given. Girl child was given, you're telling, right? So let me check if the video is fixed now. Just give me an option. Give me a second. Give me a second, please. Some problem with the video. The tech team needs to chip in. Yes. The question was a 5-year-old child is brought with progressive loss of eye contact, repetitive hand clapping movements. Girl child was mentioned, that makes our job much easier. Slowing of head growth. So remember we talk about this deceleration of head growth. So and developmental regression is noted after a period of apparent normal early development. So this is the typical case scenario where we suspect and diagnose Rett syndrome. So again, this is straight from our LRR for INI-CET. So where we discuss Rett syndrome, we know it is X-linked dominant inheritance. So that is why it is more common in girls. And MECP2 gene, head circumference is normal at birth, but there is a deceleration of head growth leading to acquired microcephaly. So this microcephaly is acquired, there is developmental delay, and these stereotypic hand-wringing movements are there, right? Okay. So Rett syndrome is definitely the answer here, not Asperger syndrome. Asperger syndrome is no longer considered a separate disorder. It is in the autism spectrum disorder only. Fragile X syndrome, more common in males. You will get elongated face and you will get macroorchidism. You will get large jaw, large ears and all that. And of course, intellectual disability would be there. Down syndrome, you have the typical facial features and the associated abnormalities. And there is no sex predilection and you do not have these stereotypic hand clapping or hand wringing movements, right? Okay. The next question that we have here, so a neonate presented with differential cyanosis. So differential cyanosis means that there is no cyanosis in the upper limbs, but there is cyanosis only in the lower limbs, characterized by pink upper extremities and cyanosed lower extremities. Which congenital heart disease is most likely responsible? So out of the given options, large PDA, yes, in PDA with reversal of shunt. So large PDA would eventually lead to Eisenmenger syndrome. So if it is PDA with Eisenmenger syndrome or PDA with reversal of shunt, okay, Eisenmenger syndrome or PDA with reversal of shunt, there we will get differential cyanosis. Okay. So what was written in the options? Can someone tell me whether only large PDA was there, or you had PDA with Eisenmenger syndrome, or you had PDA with reversal of shunt? अगर PDA with Eisenmenger or reversal of shunt नहीं भी था, large PDA would eventually lead to pulmonary hypertension and irreversible pulmonary vascular changes and reversal of shunt. So I would still go with it. Atrioventricular septal defect में you do not get differential cyanosis. And remember, this is the most common congenital heart disease in Down syndrome. Severe mitral stenosis again नहीं. Peripheral vascular disease में cyanosis can be there in all the extremities. But ऐसे कोई predilection for upper limb or lower limb will not be there. Okay. So, okay, somebody is telling PAPVC was option. PAPVC, pulmonary AV fistula. Pulmonary AV fistula. Osler-Weber-Rendau syndrome. So these are the options that people are telling, and large PDA was also there. Large PDA was also there. So, फिर again, अगर these options से भी, I would as of now go with large PDA, but yes, let more refinement come in the options and the questions, we can discuss it further. Large PDA में क्यों होता है? We'll take a quick look. So if there is PDA with reversal of shunt, so PDA with reversal, so somebody is telling two different questions were there. Two different questions were there. क्या questions थे, if you can clarify? So PDA with reversal of shunt में क्या होगा? So normally PDA में left to right shunt होता है, right? That means blood goes from the aorta to the pulmonary artery. But अगर PDA with reversal of shunt है, तो क्या होगा? There'll be right to left shunt. So blood will go from the pulmonary artery. So blood will go from the pulmonary artery to the aorta. And pulmonary artery में हमें पता है कौन सा blood होता है? It is deoxygenated blood. So from the pulmonary artery, this deoxygenated blood will go and descending aorta will get this mixed blood, deoxygenated blood. But the branches of ascending aorta and arch of aorta, they are getting oxygenated blood. So you see no cyanosis in upper limbs, but there is cyanosis in lower limbs, right? PDA with reversal of shunt or large PDA. Okay. So separate question asking for cause of cyanosis tha, and one was on differential cyanosis. So please contribute the exact questions with options. We will be happy to discuss it again. So which of the following organisms is a common cause of meningitis in infants younger than 6 weeks of age? So essentially it is talking about neonatal meningitis. So neonates में if there is meningitis, the organisms implicated would be group B streptococcus, E. coli, and listeria, because these are the common organisms colonizing the maternal genitourinary tract. So इनमें से ही होगा. So we will not think of Streptococcus pneumoniae or Staph aureus or H. influenzae. Out of the given options, Listeria monocytogenes would be the best answer. Okay. So children का पूछा था. So somebody is telling children का पूछा था. So was it for children? Was it for infants? So you'll have to confirm whether it was for children, whether it was for infants. So please confirm what was the exact question and the options, right? But there was for sure a question on meningitis in children. It could be infants or children. Exactly kya tha, we'll have to see. Okay. So a child presented with, again, it is a cliche question, a child presented with prolonged jaundice, umbilical hernia, hypotonia, developmental delay. I'm sure all of you have answered this correctly. And again, in our LRR for INI-CET, we did discuss it again. So puffy looking face, abdominal distension, umbilical hernia, constipation, prolonged neonatal jaundice, hypotonia. So of course, our diagnosis is congenital hypothyroidism. So this is a pretty straightforward question. Okay, so somebody selling jaundice, constipation bhi tha. Okay, so constipation was also there. Macroglossia was also there. Okay, constipation was also there. Macroglossia was also there. Right? So most likely diagnosis, of course, is congenital hypothyroidism. Galactosemia we'll not think of, because galactosemia may we will. So galactosemia, you do not get this umbilical hernia nahi milta. We do not get hypotonia. We will get cataracts, and we can get jaundice, of course. And these symptoms will come after the baby has been started on feeds. So at birth, they will not be there. They will eventually come. Down syndrome, you have the typical dysmorphism. You have mongoloid slant of eyes, depressed bridge of nose, low set ears are there, flat occiput is there, epicanthic folds are there, simian breeze, sandal gap. So nothing of that sort is there. Down syndrome we'll not think about. Again, cerebral palsy is a condition where we will have history of some perinatal asphyxia and all can be there. Tone abnormalities would be there. But prolonged jaundice is usually not a feature. Okay. So congenital hypothyroidism is the best answer out of the given questions. Out of the given options. So Sanjay is telling PDA is a acyanotic heart disease. Yes, Sanjay, PDA is normally a acyanotic heart disease, but in a large PDA, if there is Eisenmenger syndrome development, so if there is PDA with reversal of shunt, there will be differential cyanosis. Okay. The next question, again, a pretty straightforward one. You have a 6-year-old child with oliguria, hematuria, hypertension. Oliguria, hematuria, hypertension makes it what? Nephritic syndrome. Nephritic syndrome. And the most common cause of nephritic syndrome in children we know is PSGN. And here pe jo typical case scenario, you have renal biopsy showing coarse granular C3 deposits and subepithelial hump-shaped deposits. So this is a cross-cutting question of pathology and pediatrics. So of course, our most likely diagnosis is PSGN here, right? So membranous nephropathy, no. Membranous nephropathy will not give this picture on renal biopsy. Minimal change disease, again, you will get normal light microscopy, and even on this immunofluorescence also, you will not see much of any deposits. Goodpasture syndrome, again, is a separate entity. We know linear deposits are there and involvement of lungs are also there. Okay. So the next question, a neonate born to a mother with anti-Rho SSA and anti-La SSB antibodies is a risk of developing which cardiac anomaly? So was this a question? So this is a case of maternal lupus. So the mother here has got SLE, and if the mother has any of these antibodies, then the baby develops complete heart block. Baby is at a risk of developing complete heart block. Okay. So Sanchita is telling anti-Rho was not there in the options. So only anti-La was there. Sanchita was only anti-La in the options. What was the exact question? Okay, so Shaswat is telling it was the other way around. They were asking the antibody for complete heart block. Okay. So the question was which antibody is associated with complete heart block in the neonate? So probably this was the question, but in essence, it was trying to ask the same thing. So which antibody is associated with congenital heart block in a neonate? So what was that the question? With congenital heart block in a neonate. Yes? Was this the question? The answer will be anti-Rho. Anti-Rho antibody would be the best answer, right? Okay, so 3rd degree heart block was mentioned. 3rd degree heart block. Okay, right. Then you had this, again, a pretty straightforward question. A child presents with skin lesions as shown. So what you see here are caffeole spots. So caffeole spots are there. Along with axillary freckling is there, Lisch nodules are there on eye examination. We all know our diagnosis would be neurofibromatosis type 1, right? Tuberous sclerosis, you have got other skin lesions like shagreen patches, adenoma, sebaceous, ash leaf macules, or hypopigmented macules. Sturge-Weber syndrome, you have port wine stain of one half of the face, the area supplied by some of the branches of trigeminal nerve. There is a risk of seizures, glaucoma, tram tract calcification is there, leptomeningeal enhancement is there. Ataxia telangiectasia, there'll be ataxia, there'll be dilatation of blood vessels of the eye or the skin, so telangiectasia, and immunodeficiency, so recurrent infections. So we all know the diagnostic criteria for NF1. We need any 2 out of the following criteria. So what are the criteria? Just a quick recap. So you have cafe-au-lait macules. So you need 6 or more. And if it is a prepubertal age group, 5 millimeter size minimum. Post-pubertal, 15 millimeter. Freckling, neurofibromas, eye abnormality, Lisch nodule or choroidal abnormalities, optic glioma, bone lesions, family history of a first degree relative affected, and genetic testing. So any 2 out of these will be there. So Vibes Tune is telling key 3 images were there. Iris pic, cafe-au-lait, tumor in retroorbital area. That makes our diagnosis even easier. So 3 images were there, you are telling. 3 images. One was cafe-au-lait spot. Another was iris Lisch nodule. And a third was a tumor in retroorbital area. Okay. Right? So that makes our job much more easier. Okay. Then there was this question again, which electrolyte abnormality is the hallmark of refeeding syndrome in a severely malnourished child started on nutritional rehabilitation? Was this the question? Yes. So this again straight from my LRR for INI-CET. So we discussed this refeeding syndrome or nutritional recovery syndrome. We said there is a increased blood glucose. Suddenly when you give excess of feed to a malnourished baby, sudden increase of insulin, increased regeneration of tissue. So phosphate is required. For ATP generation, lot of phosphate is used up. So hypophosphatemia, abrupt decrease in serum phosphate is important. And apart from that, of course, thiamine levels are low, potassium levels are low, magnesium levels are low, and the child gets the worsening of condition, edema, tachypnea, tachycardia, and all that. So out of the given options, we will go with hypophosphatemia, even though hypomagnesemia is also there. But the most salient finding, if you ask, it is sudden increase in insulin and hypophosphatemia, because a lot of ATP is generated. Suddenly the body switches from catabolic to anabolic state. Okay. So hyperkalemia, hyponatremia are not the answers. Hypomagnesemia is there, but the best answer would be hypophosphatemia. Okay. So I believe that is all that I've got from the recall. So if you have any other questions that you remember from pediatrics, please feel free to share. Were there any questions on immunization? Any questions from growth? Okay, any other questions from neonatology? Any questions from pediatric respiratory system? Yes? Or any other systemic pediatrics questions? So, can someone please confirm if there were any other questions? So cyanosis question, again, I will have to see what were the exact options. Okay, PA-PVC may we will not get differential cyanosis. Partial anomalous pulmonary venous connection may there will be mixing of blood of both the sides. But the entire body will get that mixed blood only. So उसमें नहीं होगा. AV fistula, yes, it can lead to, but differential probably no. Cyanosis could be there, but differential तो नहीं होगा. So please think about it, discuss with your friends, and try to come up with the exact framing of the question and the options. Feel free to message me in my Telegram group or my Instagram handle or in the PrepLadder group anywhere or in the comments here. So please reach out with the exact question and the options. We'll be happy to discuss and discuss about what should be the best answer. Right, foreign body question tha. What was the foreign body question? So immunization से इस बार कोई question नहीं था. That is pretty surprising for me. Foreign body aspiration से क्या question था? So right versus left bronchus. So right bronchus हमें पता है straighter होता है. So more chances usually in the right bronchus. Osler, Weber, Endau, I'll have to check once and get back. Okay, I'll check and get back. CAH question क्या था? Okay, next step after dexamethasone test. So CAH question was there. Can someone help with the exact question and the answers? So exact question and answers if someone options if someone can help. Exact question kya tha on CAH and what were the options? Any other topic that was asked? Any other topic that was asked from pediatrics? Any other neonatology question? Or any other question from growth, development, genetics? We've already discussed. Inborn error of metabolism. Say if there was any other question. So 17 hydroxylase deficiency ke baare mein probably there was a question. 17 hydroxylase deficiency. So it was asking what will happen to cortisol, pregnenolone and testosterone. So 17 alpha hydroxylase deficiency, we all know usme kya hoga, there will be excess of mineralocorticoids. So hypertension will be there, but cortisol or sex steroids will not be there. So testosterone is going to be low, but aldosterone will be high. Hai na? Right? So neonatal hypoglycemia we've already discussed. So I think that's all for now. So please feel free to reach out with any other questions that you feel were there from pediatrics with the correct options, and I'll be happy to answer. So for now, that is all from my side. Thank you so much for joining in. And it really shows your dedication that even after your exam, you're sitting till so long and you're really wanting to know your mistakes and wanting to know what you did right or wrong. And trust me, the first 24 hours, the questions are so fresh in your mind. No, so once let us just discuss and get over with it and achieve a closure for this. And then you can take a break for a couple of days. But yes, NEET PG is coming up. So those of you who feel that your exam was not up to the mark, of course, NEET PG is still there. So don't get disheartened. All the very best. God bless you. Hoping for the best of your results and waiting to hear from you about your brilliant results. All the very best. God bless you. Thank you so much.
I hope I am audible to everyone. Yeah. So I hope you have given your best. Rest is up to fate. So I'll not take much of your time. I know you are tired enough. So I could have recalled around 22 questions of pharmacology, and let's discuss them very rapidly. And the first question, which I gathered with the help of you lovely student, is patient is having infection of beta hemolytic gram positive cocaine clusters, which is catalase positive. This is Staph aureus, and it is sensitive to oxacillin. So what is the drug of choice for the treatment? I hope I am on the right track. The question is fine. Something is written oxacillin, and this features of a bacteria were given. So now remember, oxacillin, I have told you it is a penicillinase resistant penicillin. So this Staph aureus must be producing some penicillinase enzyme, which is degrading penicillin. So penicillin cannot be an option. So what are the brothers of oxacillin? So we have discussed a mnemonic condom. So these four penicillins can be given in this type of a bacteria, where C stands for cloxacillin, oxacillin, neficillin, dicloxacillin, and methicillin. They are the options which can be given in this type of Staphylococcus bacteria, because they all are penicillinase resistant penicillin. So yes, the answer of this question is cloxacillin. Okay, straight from RR. Next question is, which of the following statement regarding ticagrelor is correct? I hope the question is fine. Options are fine. So we know any drug which ends with the word grel or grelor is an antiplatelet drug. And I have told you clopidogrel, ticagrelor. If grel word is coming, it is a prodrug. And if ticagrelor word is coming, it itself is an active drug. And both these drugs, grel and grelor, they block ADP receptor on platelet, which is also known as P2 Y12 receptor. So first statement is a true statement. So do you think ticagrelor require metabolic activation? The answer is no. Ticagrelor does not require metabolic activation. Only prodrugs need to require metabolic activation inside the body. So here, ticagrelor does not require metabolic activation. So yes, the false statement is B. It is a reversible inhibitor. Yes, any drug which ends with the word grelor is a reversible inhibitor, and any drug which ends with the word only grel is an irreversible inhibitor of ADP receptor. So third statement is also true, and obviously any drug which is a reversible inhibitor will be a safer drug as compared to irreversible inhibitor, because even if you stop that drug, the action of reversible inhibitor will be lost very rapidly. So yes, the last statement is also true. So the incorrect answer of this question is option number B. So overall answer is option number B. It does not require metabolic inactivation. Clopidogrel require metabolic inactivation. I hope it's fine to you. Next question. Which of the following drugs shows concentration dependent killing? I told you 4 drugs which show concentration dependent killing, and the mnemonic was Mars. Can you recall? Okay, so among them, Dr. Lokesh, the only false statement is B is the only false statement among them. Even if it is a multiple choice question, multiple answers can be correct. Even at that scenario, B is the only false statement. Okay. Yes, we will come to fenfluramine. I have gathered that question. So which drug shows CDK? Remember CDK, concentration dependent killing? I told you 4 drug Mars. The first was metronidazole. It's a straight question from your RR. Then I told you aminoglycosides like streptomycin, gentamicin, and any drug which shows CDK requires once a day dose, not multiple dose. That is why streptomycin, rifampicin, they are given once a day for the treatment of TB. And lastly was streptogrammin. So what is the answer of this question? Yes, the very simple answer. It's a repetitive question. The answer is aminoglycoside. But if you will recall, I told you that vancomycin shows both concentration as well as time-dependent killing. Penicillin only shows time-dependent killing, and linezolid also shows time-dependent killing. So the only drug which shows CDK, that is concentration-dependent killing, we had a beautiful chart in our RR table where aminoglycoside was. Yes, instead of penicillin, beta-lactam diet, then it is also the same thing. Vibe tunes, so penicillin and beta-lactam is same thing, okay? So again, the answer is that one. Next question. So beautifully, I don't know this question, why they have made. Just I want a little bit help from your student. I know that what the question is that we know, but what is the language? Lamotrigine is the drug of choice for which type of scissor? I think there is some sort of language discrepancy. Some sort of language discrepancy among them. Is the language of the question same? Is it correct? Something is written first line or drug of choice. I think the language is same. Now the question is a controversial question. Remember, lamotrigine is the first line drug for all type of scissor. Remember, if we see this table of Harrison, lamotrigine is the first line drug for all type of scissor. Now, if the word written first line drug, then the answer is it is of all type of scissor. Then the answer would have been all 4. It is the first line drug for all type of scissor if it is a multiple choice question. Now, let's solve this controversy. If you have to choose the only one drug, the better option or the drug of choice, we can see lamotrigine is written as a first option only in cases of GTCS, that is tonic-clonic scissor and focal scissor. While in absent scissor, lamotrigine is given as a third number, although it is a first line drug, but it is chosen as a third option. Similarly, here it is chosen as a second option in atypical absence, myoclonic and atonic scissor. So to solve this question, I would say the answer is either tonic-clonic scissor or focal scissors we should go with. So yes, the answer, if it is a single best answer, then the answer would be tonic-clonic scissor. If it's a multiple answer, we can have a multiple option, then you should have chosen all 4 as a correct answer. Okay? Yes, for all type of scissor, even for atonic, myoclonic absence scissor, atypical absence, single option best is tonic-clonic scissor or focal scissor, and I hope focal scissor was not in the option. Otherwise, we could not have chosen the best one. So go with the first one, that is tonic clonic scissor or focal scissors. Although it is a first line drug for other scissors also, but the most preferred here. I hope it is now the controversy is perfectly clear. Okay. Controversy is perfectly clear. Okay. Now, next question. All are the novel antidepressants except. No, AIMS people, they are not happy with your selection. They are happy with your expulsion only. So don't worry. They will not give you marks. They have plenty of students who are applying. So they already are in a problem of plenty. Okay. So all are novel antidepressant except. So one student is saying except was not given. So then the option is we have to choose multiple options. You have to choose multiple options. Because beta etizolam, which is a benzodiazepine, is an antidepressant drug. Vilazodone is also an antidepressant drug. Trazodone is also an antidepressant drug. Blonanserine is the only drug which is an antipsychotic drug. It is the only antipsychotic drug we have. Now the point is, if somebody is asking novel drug, I would say etizolam is a benzodiazepine, and benzodiazepine is a very old drug, some 70, 80 years old drug. Similarly, trazodone, trazidine drug, it is also a very old drug. The recently approved drug around 4 or 5 years back, which we have discussed in our resolve classes as well, everywhere we have discussed, it's a novel drug. It's a new drug, recently got approved. So it is just like SSRI, we call this drug as SPARI, serotonin partial agonist and reversible inhibitor. And similar to vilazodone, there was another drug which I have told you, viloxazone. Okay, there was another drug I have told you similar to vilazodone. So if there is a one option you have to choose, which is the novel drug, then the answer is vilazodone. So let me correct it. Novel drug is vilazodone. But if the question is asking except which of the following is not an antidepressant, if the question is saying antidepressant इनमें से कौन सा नहीं है, then your answer will be blonanserine. Then your answer will be blonanserine. If except is written, then blonanserine, because it is not an antidepressant drug, it is an antipsychotic drug. I don't know why they have asked. This drug is not approved in India. It is only approved in Europe and Japan. So I think that probably after clearing your exam, you might be visiting Japan and Europe. So they ask you this question beforehand. So let's move ahead. Next question. A patient with, easy question, a patient with respiratory depression with pinpoint pupil. So yes, it's an opioid poisoning. I hope it's perfectly easy and fine. Opioid poisoning. And we know the antidote, the simple one. Antidote of opioid poisoning was naloxone. So there is no much time we can. Yes, Lokesh. Now next question. A patient presented, now another poisoning, a patient presented with excessive sweating. Secretion is more, respiratory secretions is increased. So in any secretion, if secretions of the body is increased, which poisoning comes into your mind? Yes. So organophosphate or carbamate poisoning. Another poisoning which is asked, and we discussed it regularly in all our session. Okay. Yes. Now, which drug is given for the treatment? I told you for the treatment we give atropine. Atropine is given for symptomatic treatment. And these drugs, they inhibit cholinesterase enzyme. We add a drug, pralidoxime. And why we give pralidoxime? Because it reactivates the enzyme which is inhibited by organophosphate. So it reactivates acetylcholinesterase enzyme. So it was a simple question, old question. I hope this question you student have not marked wrong. Okay? ये question आपने गलत नहीं किया होगा. Because here the question is asking which drug reactivates cholinesterase enzyme. We have discussed it many times. For symptomatic treatment, we give atropine. But to reactivate enzyme, we add pralidoxime in cases of OP poisoning. Okay? Yes. So we discussed the reason also. The B, the seventh is the answer. So another new question which I have given a lot of stress. It is the only drug ever approved for fatty liver. Fatty liver is also known as MASH, है ना? Metabolic dysfunction associated steatohepatitis or fatty liver. So we discussed in LRR, so that is why I put one image also. है ना, पढ़ा था resmetirom. It act on some thyroid hormone receptor beta agonist. So yes, the simple one, option A is the correct answer. Option A is the correct answer. ठीक है? Okay. So any option which is a wrong option? It inhibit hepatic lipogenesis, cholesterol synthesis. Chalo, good. I hope you got something good. So hope is a very good thing. After 2 wrong, if you are getting 3 right, again you become happy. Okay, that's great. Chalo, आगे चलते हैं. Clinidipine does not cause reflex tachycardia. Why? Remember, any drug which ends with the word dipine is a calcium channel blocker. Which type? DHP type. And any calcium channel blocker normally block which type of channel? L type of calcium channel. Because they block L type of calcium channel on blood vessel, they produce vasodilation. And because of sudden vasodilation, the side effect of all dipine is, all calcium channel blocker is reflex tachycardia. Now the question is asking that why clinidipine does not cause reflex tachycardia? Because clinidipine also block N type of calcium channel. N type of calcium channel, remember, it is present on sympathetic nerves. It is present on sympathetic nerves, N for nerves, and it inhibits the release of norepinephrine, epinephrine, and that is why the heart rate will fall. So it is a new drug. It is not given in your Goodman-Gilman. It is not given in KD Tripathi. It is not given in any book right now. But this drug is a very commonly used drug in India. And we have discussed about this drug also. If you will see RR, we had discussed, because in India, we are giving this drug very commonly for the treatment of hypertension, because all other dipines, they cause reflex tachycardia, which can precipitate angina or MI. Okay, understood this part? So that is why they are the institute of national importance. That is why they are one step ahead. Okay. Next question. No, beta, a new question is this. This is a new question they have asked. So which of the following drug should not be given in a patient of mucormycosis? So we discussed voriconazole is not effective in treatment of mucormycosis. Voriconazole is only given in the treatment of aspergillosis. This we have discussed. Okay. Okay. Voriconazole. R type of calcium channel भी option में था. Okay. Remember beta, there is no R type of R type. R type तो कोई होता ही नहीं है. ठीक है? R type का तो कोई होता ही नहीं है. So clinidipine has 2 action. Remember, clinidipine itself is an L type and it also has N type of calcium channel. N means neuron. Because it blocks neurons also, reflex tachycardia does not happen. Vasodilation happens because of L type of calcium channel blockage, and it inhibits tachycardia by blocking N type of calcium channel, which is present on neurons. No beta, R type तो कुछ होता ही नहीं है. Probably Ritesh, R for Ritesh, R, remember. Okay. So we have discussed this question in our main classes. We have discussed this question in our main classes, but for INI-CET, it's a new question. Okay. In our main lectures, we have discussed it, that clinidipine blocks N type of calcium channel. But sometimes INI-CET is notorious that they ask, beta, these questions can be repeated in FMGE. So you must take a channel. R type, even if it is given R type, nothing. R type का ऐसा कुछ नहीं होता. We have mainly these 3 type of calcium channel हमें याद रखने हैं cardiovascular system में. T type in absence is there. Now, which of the following drugs should not be given in mucormycosis? That is voriconazole is not effective. Simple and repetitive question. ठीक है? Which of the following pharmacokinetic process is shown below? Tell me. There is an exponential decrease in plasma concentration. Tell me in first order kinetic or 0 order kinetic. Remember, in 0 order kinetic, there is linear decrease in plasma concentration. While in first order kinetic, 100 ka 50, 50 ka 25, 25 ka 12.5. This is how the drug decreases. So there is an exponential decrease in plasma concentration. So the answer is simple question, first order kinetic. Now, which of the following receptor is coupled to GS protein? That is beta receptor. Okay. So we discussed all odd number M1, M3 and M5. They are GQ type. All even number M2 and M4 muscarinic receptor. They are inhibitory receptor. Alpha 1 होते हैं, alpha 2 होते हैं, alpha 1 is GQ, alpha 2 is GI. All beta receptor, beta 1, beta 2 and beta 3, they are GS type. The answer is there is GS type. Okay? Okay. Semi log भी दिया हुआ था, कोई प्रॉब्लम नहीं है, तब भी यही आंसर है. ठीक है? Next question. A patient with Dravet syndrome started on fenfluramine. Which of the following statement is correct? Now, this is an old question. Remember, fenfluramine, it was first approved as an anti-obesity drug. It was first approved as an anti-obesity drug. But as an anti-obesity drug, it got banned because it causes cardiac wall damage. It causes cardiac wall damage. It causes cardiac wall damage. So what you have to monitor for? You have to monitor for cardiovascular disease. Okay? So it got banned in the market, but later on, this drug was found to be effective in seizure. So it was later on approved for Dravet syndrome. Later on, it was approved for Dravet syndrome later on. Okay? Okay? Stiripentol was given in the option. No. So here the answer is option number. Beta T-type is not the correct answer. T-type causes absence seizure. Here the question in clinidipine, it was asking what is the cause of prevention of reflex tachycardia, that is N-type for sure. Okay? N-type ही है. Don't worry. I'm not telling you the wrong one. I'm absolutely telling you the correct answer. Don't worry about that. ठीक है बेटा? I hope it's fine. Next बात करते हैं. A stimulant purgative. I think this question was given. Stimulant purgative. Straight question from RR. Stimulant purgatives क्या होते थे? Like bisacodyl, senna, which stimulate and contract intestinal muscle. They contract colonic muscle. Now tell me, if they contract colonic muscle, we have discussed they are contraindicated in spastic paralysis. And which drug I have told you was contraindicated in paralytic ileus? In paralytic ileus, bulk laxatives were contraindicated. Stimulant purgatives are contraindicated in spastic paralysis because they contract muscle. Bulk laxative, they stretch muscle. So they were contraindicated in megacolon or paralytic ileus. So we discussed this part, okay? Yes. So answer is A. Answer is A. Straight question from RR, okay? Next question. I think some lesion was given. I think it's an overlap question with your derma. So I think some tinea capitis was given. And a tinea capitis. So even in beta post-operative period, remember in post-operative period, the patient suffers from paralytic ileus only. In post-operative period, the patient suffers from paralytic ileus. So third option is also correct. Okay? Okay? Okay. Beta, I don't know if it is tinea. Just ask derma faculty. I feel it was tinea. If it is tinea capitis, obviously you will give antifungal. Okay? But if some student is saying, okay, fourth option was opioid-induced constipation. Opioid-induced constipation. Remember, in opioid-induced constipation, we can give stimulant laxative because opioid-induced constipation में भी क्या होता है? Nerves, they are blocked by opioid. तो paralytic ileus जैसी condition होती है. But remember, here the question is asking contraindicated. Don't get confused. Contraindicated है तो spastic colon because they themselves can cause spasm of muscle. Okay? Spasm of muscle. Yes, yes. Okay. Easy था बेटा, इस पे confuse मत होना बिल्कुल भी. बाकियों में तो दे सकते हो. So अगर ये tinea था, then go with the tinea capitis, I believe. है ना? Don't worry, I am here. After exam, remember, post-exam period में ऐसा ही होता है, हर कोई confused होता है. What is the mechanism of action of pretomanid? है ना? Pretomanid, very important question. B-PAL regimen for MDR TB, RR TB. So I told you pretomanid, MA word is coming. MA का मतलब क्या था? It inhibit mycolic acid. It inhibit mycolic acid synthesis, है ना? It inhibit mycolic acid synthesis. Yes, simple and easy. It was easy. Okay. Arabinogalactan वाला कौन सा था? Ethambutol. Fourth option क्या था? Bidacoline inhibit ATP synthase, बेड पे हो तो ATP खर्च नहीं होगा, है ना, बेड पे सो रहे हो. And what is the option D? Anyone? Just to finish the question, because that will help us to formulate a complete, है ना, बेड पे अकेले हो ATP. Fourth option, if anyone remembers, let me just write it here. Anyone who remembers fourth option? RNA polymerase, ठीक है. चलो, thank you for letting me finish this question. RNA polymerase rifampicin, okay, rifampicin. So TB से तो सवाल आता ही है, ठीक है. Next question. I think this image something was given straight from LRR. Same question. I think even the options are also same from LRR. A new drug available. Therapeutic index को close करना था, है ना? है ना? I think options were also same. Therapeutic index. LD50 upon ED50. Okay. Let me finish it very fast. I think, है ना? तो ED50 was 100. LD50 बेटा 400 था, है ना? Straight image, we discussed same exact question in LRR. So yes, the answer was also 4, which we have discussed, है ना? है ना? I think this question was there. Just give me a thumbs up or write yes if this question was there, so that I can move to the next one. It was there. नहीं बेटा, मैंने set नहीं किया. Otherwise, I would have been the richest person on this planet if I would have set this paper. But still I'm teaching you at 10:30 p.m. So obviously I have not set. And it is not a NEET UG paper, it is a NEET PG paper, okay? So there is a lot of difference at stake. So which of the following statement is true regarding nicotine replacement therapy? Nicotine, okay, options were different, na? That's fine. Now nicotine replacement therapy और nicotine gums are superior to lozenges. क्या मैंने आपको ऐसी कोई बात बताई है? नहीं बताई ना? So it's a false statement. ऐसा कुछ होता ही नहीं है. Patients are instructed to consume liquid tea, coffee. Obviously, this statement, let's see. Let's come to this statement. Varenicline causes a black box warning of CVS side effect. It causes a black box warning of CNS and CVS. Mainly CNS का करता है, पर CVS की भी करता है. Okay? है ना? है ना? Varenicline. Depression हो जाता था, suicide हो जाता था. Nicotine is primarily absorbed from GIT route. GIT से तो हर कोई एब्जॉर्ब होता है ना, तभी तो आदमी गुटखा तंबाकू खाता है ना, है ना, है ना. So but the point is, when it is absorbed, remember this is a true statement, this seems out to be true statement, this seems out to be true statement. So I think the only statement which is false is A. I think the only statement which is false is A. True पूछा है कि false पूछा है? This is a false statement. This is a false statement. Okay? The only statement which is false. Next question. Just tell me, true tha. So I'll just get back to this question and I will post in the group, PrepLadder group. Okay. So there was a multiple choice question. If you want to go with the true one. So, acha, true pucha. Let me discuss this question again now. Now we have to find the best true statement if somebody is asking true. So let's discuss. Nicotine are superior to lozenges. False. Nicotine is absorbed from gastrointestinal system. False, because it has a first pass metabolism in liver. अगर आपको true ढूंढना है तो best true का आंसर ढूंढते हैं. Patients are black box warning of CVS side effect. Again false. इसका main side effect होता है CNS, not CVS. CNS main क्या होता है? Suicide and depression. इसका मेन साइड इफेक्ट क्या होता है? सुसाइड एंड डिप्रेशन. अगर हमें बेस्ट ट्रू स्टेटमेंट ढूंढनी है, देन द बेस्ट ट्रू स्टेटमेंट विल बी बी ऑप्शन. सो आई एम टेलिंग यू, इफ दे आर आस्किंग द ट्रू बेस्ट स्टेटमेंट, then go with the B option. If they are asking with a false statement, then go with the A answer. I don't remember whether it is a right question or a wrong question, but I have told you the both possibility. If they are asking the best statement, go with B. If they are asking which of the following is a false statement, then make everything true. That depends upon the question. Then the option will be A. ठीक है? Then the option will be A. ठीक है? Next question. So in this case, go with the B answer. In this case, go with the B answer. ठीक है? B is the correct answer. Done. Next question. ESBL producing bacteria, false statement is, so what is ESBL? That is extended. There are a lot of questions in pharma. Spectrum beta lactamase. So these drugs, they degrade beta-lactam group of antibiotic. Which beta-lactam group of antibiotic they degrade? The first is penicillins. All penicillins are degraded. Second, they degrade cephalosporins, and they sometimes degrade monobactam. The only drug which is not degraded is carbapenems. So carbapenem is not degraded. So first is a true statement. Now, because penicillin like piperacillin is degraded, we combine with beta-lactamase inhibitor, tazobactam. So tazobactam protect this penicillins. It will protect this penicillin. It's a beta-lactamase inhibitor. And it is transmitted by plasmid. Yes, correlate with microbiology. But I have also told you in main notes, yes, it is transmitted by plasmid. There is a classification as also I have told you. Now, the false statement is this one. The false statement is this one. D. Okay? D. Okay? Yes, you are absolutely right. You are absolutely right. First we give piperacillin, tazobactam, then we give carbapenems. Okay? Okay, next question. So if you have any problem with options, you can tell me, because other faculties are also waiting now. It's already getting past 11. So match the following scenarios with their treatment. Delirium tremens, alcohol, we give benzodiazepine. Yes, smoking cessation, varenicline. I think some question was like this. Options were wrong. Okay, nicotine has, okay, let me come back to the question then, if you are telling me. So just let's frame this question again properly. So what was the question? If I was wrong, just tell me again. Okay, instead of varenicline, what is written? nicotine replacement therapy, NRT लिखा था. ठीक है. सीवियस साइड इफेक्ट बिल्कुल ट्रू है बेटा, ये भी ट्रू है, ये भी ट्रू है. ठीक है. But I think the best treatment will be this one. Still the answer will be A. अच्छा, कई बच्चे कह रहे हैं सर वही था, so I'll not go into the controversy. We will have plenty of time tomorrow to solve controversy. Opioid overdose, naloxone, alcohol de-addiction, acamprosate. Okay, some question was this. Okay, ESBL के ऑप्शन थे. अगर ESBL के ऑप्शंस थे, then this question is of microbiology, not a question of pharma. So I can skip this question. Just ignore this question अगर ESBL enzyme पे question थे. ठीक है? Okay. Next question, I think this is A, the simple one. I will not go into the detail of this question. ठीक है? ठीक है बेटा? So A is the correct answer. Next question, match the following drugs to their molecular target. Molecular target. I think this question was there. Just give me a thumbs up. It was there or not? It was there or not? Matching was not there. Okay. Something was there. Okay. But statement was there. Trastuzumab was there. HER2 new positive breast cancer. Trust her. She will break your trust. Something was there. Stick. Jeftinib, EGFR inhibitor, non-small cell lung cancer. Nilotinib, BCR-ABL inhibitor given for CML. Sunitinib is given as CKIT. Sunitinib is given as a CKIT. Okay. No, beta, sunitinib is basically your VEGFR, although it is a multiple type of tyrosine kinase inhibitor. PDGFR, something written up. इनमें से था कोई ऑप्शन? VEGFR, PDGFR, something was written. चलो, let's ignore CKIT. अच्छा, ये भी ऑप्शन में नहीं था. HER1 के दो ऑप्शन थे. HER1, which is also EGFR. It is another name of EGFR. HER1 के दो ऑप्शन थे. Okay. Okay, but you were able to solve. Okay, इसको HER1 कर देना. Although it is not a good HER1. Okay, EGFR1 को भी हम HER1 बोलते हैं. Remember, we have discussed. EGFR को भी हम HER1 बोलते हैं. Okay, ये match the following नहीं था. तो इसमें trastuzumab ऑप्शन में था. Absolutely right. Jeftinib ऑप्शन में था. बिल्कुल ठीक है. Jeftinib was there. ठीक है. Okay. Sunitinib was given. Sunitinib was given. Nilotinib नहीं था. Nilotinib नहीं था ना? Okay. Okay. These two options were given, which you have marked. Okay. Yes, we have discussed EGFR is known as HER1. ठीक है. I think then these two options were not given. So 3 and 4 were not there. Okay. 3 and 4 were not there. So I think I have made a different question for that. Was that. Okay. Even BCR-ABL was given. So I think sunitinib was not in the option. So let me remove sunitinib. Rest 3 were simple. We have discussed in LRR also. We have discussed it many times. Straight question from LRR. Okay. Don't worry. ठीक है. These 3 were simple. ठीक है. These 3 were simple. These were straight from the question. Sunitinib was there. Okay. Chalo bhai, this controversy I think will take ages to finish because sunitinib was there. Nilotinib tha beta? Nilotinib tha? Okay, sunitinib was there. ठीक है तो मैच करेंगे then A is the correct answer. ठीक है, CKIT, VEGFR, इसको HER1 भी लिख सकते हो, which is also known as, it is a multiple type of tyrosine kinase inhibitor. Sunitinib inhibits all type of tyrosine kinase enzyme. Now let's come to the last question. Yes, ठीक है, done हो गया. I think we all are in agreement. Let's come to the last question. कुछ ऐसा आया anti-aging drug or the drug name. Let's say if anti-aging word is not written, please remove it. Okay. ठीक है. So rapamycin anti-aging drug है ना? Okay. Anti-aging नहीं था, ठीक है. Anti-aging word हटा दिया. ठीक है. अच्छा, I think Sirtuin's word is given. एक ड्रग होता है रेस्वेराट्रोल जो रेड वाइन में मिलता है. रेड वाइन पीते हैं तो कई बार एज बढ़ जाती है. दैट इज व्हाई रेड वाइन वाज गिवन. सो समथिंग रिटन देयर, मैकेनिज्म ऑफ एक्शन. ये टायरोसिन काइनेज इनहिबिटर तो सारे हैं सुनिटिनिब. रेस्वेराट्रोल होता है, ठीक है. ऐसा कुछ था रेस्वेराट्रोल. वाज देयर एनी रेस्वेराट्रोल? रिमेंबर दीस आर द 4 एंटी एजिंग ड्रग. रैपामाइसिन inhibits mTOR enzyme, mammalian target of rapamycin. मेटफॉर्मिन डायबिटीज वाला ड्रग AMPK एंजाइम, AMPK को स्टिमुलेट करता है. रेस्वेराट्रोल स्टिमुलेट सर्ट एंजाइम, साइटोइन भी बोलते हैं इसे. एंटी एजिंग ड्रग है, खाओगे तो ज्यादा जियोगे. रेस्वेराट्रोल इज फाइंड इन रेड वाइन ऑल्सो. ठीक है. स्पर्मिडीन दिया हुआ था कुछ. स्पर्मिडीन इट एक्टिवेट सम एसिटाइल ट्रांसफरेज एंजाइम, कुछ ऐसा था. So these are the all anti-aging drug. So again, it's a new question. Yes, autophagy. It inhibits, it increases autophagy of damaged genes. Yes, autophagy का भी यही काम करता है. Autophagy भी यही करता है. Yes, if something. Yes. Spermidine, autophagy. Yes, absolutely right. Autophagy. ऑटोफेजी रिलेटेड है ना. ऑटोफेजी इंक्रीज करता है. ओके. सो आई थिंक डन. एनी अदर क्वेश्चन? सो वी हैव डिस्कस्ड 22 क्वेश्चन इन फार्मा. इज देयर? आई जस्ट आस्क यू फॉर 30 सेकेंड्स. ठीक है ना. स्पर्मिडीन मेटफॉर्मिन से सही हो गया था. ठीक है, दैट्स ग्रेट. आई थिंक सी ऑल आंसर्स नो स्टूडेंट कैन रिमेंबर. इफ यू रिमेंबर 1 or 2 फ्रॉम द नोट्स, यू कैन मार्क द करेक्ट आंसर. ओके. नॉन एनी क्वेश्चन? Apoptosis is not the part of pharma. ठीक है. नॉन लाइगेंड गेटेड रिसेप्टर क्या क्वेश्चन है बेटा? फटाफट बता दो 30 सेकेंड्स में. हेलोथेन पे क्या क्वेश्चन है? वो तो एनेस्थीसिया वाले भी डिस्कस कर देंगे. कौन सा चैनल छूट गया? अच्छा, VEGF was there in place of VEGF. ओके, सोनिटिनिब के साथ VEGF लिख देना. ठीक है बेटा, बिकॉज सम स्टूडेंट आर सेइंग अदरवाइज. ठीक है. ओके, नॉन लाइगेंड गेटेड आयन चैनल. अच्छा, और क्या ऑप्शन में थे बेटा? रेस्वेराट्रोल नहीं था तो साइटोइंस था ना, वो हो जाएगा उससे. ठीक. ऑप्शंस बताओ नॉन लाइगेंड गेटेड आयन चैनल के बेटा, सो दैट वी कैन कंप्लीट ऑल द क्वेश्चन. हेलोथेन कार्डियक आउटपुट डिक्रीज करता है बिकॉज इट रिलैक्सेस ऑल मसल्स, है ना, इट डिक्रीजेस कार्डियक आउटपुट. ओके, not a ligand gated ion channel. Okay, not a ligand gated. GABA is a ligand gated ion channel. Yes. Serotonin is also a ligand. 5-HT3, I told you, inotropic receptor. So the answer was inotropic receptor. It is the only receptor of serotonin which is not a ligand gated. It's straight from MCQ. Okay. Yes, NMDA is also a ligand gated ion channel of glutamate. Fourth option bhi bata do fatafat. H2 receptor is also ligand gated. So the answer of this question was yes, 5-HT3. It was the only exception among serotonin. Okay. Okay. Yes, yes. So the answer of this 23rd question is your 5-HT3. Any other question? Third question. Any other question? Any other question? ठीक है, ligand gated हो गया. Next पे आओ बेटा. नेक्स्ट पे आ जाओ फटाफट. जस्ट कम फास्ट. नेक्स्ट. ठीक है, हियर द आंसर इज 5-HT3. इट इज नॉट अ लाइगेंड गेटेड, इट इज एन आइनोट्रोपिक रिसेप्टर. नेक्स्ट पे आओ. लेमोट्रिजीन क्या है? लेमोट्रिजीन पे तीसरा सवाल है. लेमोट्रिजीन, टेल मी व्हाट लेमोट्रिजीन. क्वेश्चन क्या था इसमें? लिवर फेलियर. क्या था लेमोट्रिजीन लिवर फेलियर पे? बता दो बेटा फटाफट. यस यस यस, लेमोट्रिजीन के यूज, सिजर्स तो है ही, और क्या यूज है? लिवर फेलियर में सिजर्स हो रहे हैं. लिवर फेलियर में सिजर होगा, दोगे लेमोट्रिजीन? यस. लेमोट्रिजीन देंगे तो कैसे मॉनिटर करना है? कुछ क्या मॉनिटर करना है? ब्लड मॉनिटर करना है, TDM थेराप्यूटिक ड्रग मॉनिटरिंग, ब्लड लेवल मॉनिटर करना है, और बताओ स्टीवन. ऑक्साइम्स हो गया बेटा. डोज एडजस्टमेंट तो करोगे ही ना, हर एंटी एपिलेप्टिक ड्रग की करते हैं हम डोज एडजस्टमेंट. यस, वी विल डू डोज एडजस्टमेंट. मॉनिटरिंग तो करनी है. यस, मॉनिटरिंग तो करनी है. ब्लड लेवल्स आई हैव आल्सो टोल्ड यू. WBC काउंट. ओके, और बताओ थर्ड ऑप्शन बताओ. अभी लेमोट्रिजीन पे ही रहते हैं. नेक्स्ट क्वेश्चन बताओ दास. चलो, व्हाट आई विल डू, विच टाइप ऑफ सिजर. अबे तुम बच्चे यार, वो तो क्वेश्चन हम डिस्कस कर चुके हैं, लेमोट्रिजीन कहाँ यूज करते हैं. सो वी विल लीव दिस क्वेश्चन. यस, लिवर डिजीज में लेमोट्रिजीन का ब्लड लेवल बढ़ जाएगा, मॉनिटर करना है. अगर ऐसा कोई क्वेश्चन है, यस, यू हैव टू मॉनिटर ऑल एंटी एपिलेप्टिक ड्रग. ओके, ऑल एंटी एपिलेप्टिक ड्रग. सो वी विल गेट बैक टू दिस क्वेश्चन. आई विल गेट बैक टू दिस क्वेश्चन बिकॉज इट्स ऑलरेडी पास्ट 11. अदर फैकल्टीज आर ऑल्सो वेटिंग. एंट्रोहेपेटिक. अच्छा बता दो यार फटाफट. फोर्थ ऑप्शन क्या है? लास्ट ऑप्शन क्या है? यस, एंट्रोहेपेटिक ऑब्जॉर्प्शन. लास्ट ऑप्शन बता दो. ओके, सो जस्ट मैसेज मी दिस क्वेश्चन इन ग्रेट डिटेल बिकॉज इट विल टेक लॉट ऑफ टाइम. ओके, सो थैंक यू वेरी मच. सो आई होप योर पेपर वॉज फाइन and I'll let Dr. Deepak Marwa to join now. You all are eagerly waiting for medicine also. Probably this question, please discuss with Deepak Marwa, sir. Okay?
Okay. Hi guys, hope you're doing great. So let's get started with the next few aspects that I think I should be coming up live in the next couple of seconds. I understand that you would be tired at this point of time, and it's a natural thing to happen. At the end of the long day, you would have sat for the paper, and after that, there's a recall session that is going on also. So okay, fine. So I can see myself. The audio part is clear, and I'm good to go for today. So, oh, great, Lokesh. This question normally used to, if this came, hi, Dr. Venki, Dr. Lokesh. So if this question came in the exam, this usually used to come in FMG exam, but surprisingly, they took it up to the heart and they started talking about ST elevation in lead number 2, 3 and AVF as well, which is an inferior wall MI, and that indicates that the patient would be having a involvement of the right coronary artery of the patient. So the answer to this question is option number A. I think it's very much visible in the feed. And do let me know if there are any different options or you would like to change this. So hi Shakti. Yeah, okay. So we are sorted for this. I think there's no debate. This I saw that the radiologist has discussed. Even I have said that if you get lesions in the basal ganglia, that means patient is having cerebral toxoplasmosis. That's the highlight of this particular condition, because anytime count is less than 100, then we either have cryptococcal meningitis or cerebral toxoplasmosis. Option B was progressive multifocal leukoencephalopathy that is having an indolent course and is associated with like drugs like natalizumab. Primary CNS lymphoma would be a single lesion and NCC will be multiple lesions that would be present. So I think we are sorted for this one as well. Then I came across this very interesting question, which I have discussed with respect to focal seizures, that is automatism. Automatic behavior would mean like the patient will keep on doing picking movements, or there would be a behavioral arrest or like, piloerection. So it's basically like earlier we used to use the term complex partial seizures, and now we don't use that. We use focal seizures with impaired awareness. Obviously, because there's a behavioral arrest in a patient, so it can't be intact awareness of the patient. So one thing is clear, it is a focal seizure with impaired awareness. And I presume that this question was having two options to be selected. One is like which part of the brain. So you will hear me say the word temporal lobe epilepsy. Every time I say focal seizures and automatism, I say temporal lobe epilepsy. Words are like the guy is having smell of burning rubber, or there is like kerosene oil burning, or like the person does this automatic behavior. So questions are like temporal lobe semiology, and therefore option number B and D would be correct for this one. So I think we are sorted for this one. Yep. Yeah. Yes. Okay, great. Mesial temporal mesial temporal lobe sclerosis, that would again be a condition which will be having association with epilepsy in a patient, but that would be for the situation of where surgery would be required. Okay, then is a patient of differential cyanosis. I think that's what I could make out here. I'm having two questions on cyanosis. So Osler-Weber-Rendu syndrome may be like mentioned in the next question also, or like at the moment what I want to say is that there's a differential cyanosis because PDA with shunt reversal ho jayega. So I think the most appropriate answer would be a large patent ductus arteriosus in this patient. For the hereditary hemorrhagic telangiectasias, we can have arteriovenous malformations present, and those arteriovenous malformations, if they're present in the lungs, they will cause a development of central cyanosis. If the question is on the topic of peripheral cyanosis, which is why like I'm comfortable answering C as an answer for this one, large PDM. And yeah, I am not sure whether there was like two questions, but like this is what I could figure out. One was differential cyanosis part. Second was ki cyanosis hi boli ja rahe the. So if it's only going to be cyanosis, then it's going to be Eisenmenger syndrome in a patient. So if there were two separate ones, then yeah, I'll go with option number D for the subsequent one. But in my opinion, I think there would be only one. It's unlikely that they'll put up two questions on the topic of cyanosis itself. So it was a differential cyanosis question that would be present. Yeah. Semiology basically means topography, that which part of the brain is involved from where the lesions would be starting in a patient. So at least the previous one is fairly straightforward. This one would be Eisenmenger. Then is this patient who's having features suggestive of granulomatous inflammation with caseous necrosis. So we read about caseous necrosis with TB and then with histoplasma, coccidomycosis like that. So, and then the description that is given matches more of histoplasmosis. I think this question would have been discussed by a lot of people. So I would not like to talk more about this one.
TAPVC नहीं था यार, PAPVC था, partial anomalous pulmonary venous connection. It's associated with ASD, and it will be a left to right sided shunt in a patient. Okay, so I was waiting कि ये भी पूछ लेगा भाई, hydrocephalus in a patient with lymphocytic predominance, low glucose and high protein levels, which will go in favor of diagnosis as tubercular meningitis. If you have any difference in opinion, if there was some different values that were given, then yep, I would be wanting to talk about this. Otherwise, yeah, I mean, I already told you that either that question will be on the cyanosis part or it would be on differential cyanosis. I mean, I agree to that, but I kept both because the chat was going on, so I had to pick up both of them. Okay, Ji, fine. So TBM is the correct answer for this one. Then was an acid-base disorder. I think you guys would have killed this question, no? Metabolic acidosis. I mean, do I need to even do the matching here? Metabolic alkalosis with pyloric stenosis. Then we would be having respiratory alkalosis, that is hyperventilation. So some can be easily identified. Then is toxins, that cult mnemonic that we pick up for glycol poisoning or ethylene glycol. And you're left with respiratory acidosis, which could be a lung disease developing in a patient. That would be bronchopneumonia. So it's just match the following that you have to do. And I think it's an easy one to be identified. Okay. Yeah, newborn baby with meningitis is listed here. Exactly. Then is hypertriglyceridemia would be seen with all of the following except to diabetes में तो होता है deranged lipid profile. Nephrotic also say ना hyperlipidemia. Like the fourth point that I always describe, massive proteinuria, hypoalbuminemia. Then I say like patient is having edema. Fourth point is also always hyperlipidemia. Cholesterol is more, triglyceride is more. They develop heart disease. So that is okay. And high fructose diet. You know आजकल जैसे बहुत सारा fashion चल रहा है कि fruit juice को लोग मना करते हैं पीने के लिए because lot of these fruit juices are like rich in fructose and fructose causes deranged lipid profile in a patient. So this fructose based syrup should not be consumed. ये जो concentrate आते हैं ना fixed concentrate which you can mix with soda or these juice concentrates which are available and even the fruit juices lots of time they are having like high concentration of fructose. The answer is A beta lipoproteinemia. ये एक ऐसी condition होती है जिसमें cholesterol की value भी less होती है, triglyceride की value भी less होती है because of which there are deranged lipids. Because cholesterol is less, triglycerides is less, and lipids are important for RBC membrane. So we get those acanthocytes which are present in this condition, and even like neurological manifestations can occur. The correct answer to this all except question is option number C. I mean, first two options you have to rule out, and then if you watch these reels which are related to healthcare perspective, then I can say fructose, corn syrup, all these things are like really bad because they tend to increase the incidence of they cause increased incidence of atherosclerosis and heart disease. So we sorted for this one. Next one is antibodies with congenital heart block in neonates. ये तो चिल्ला के ऐसे lupus woman रुला दिया antibody ने रुलाने वाली antibody is that photosensitivity वाली antibody. It can cross the blood brain barrier, it can cross the placenta, and then the baby will end up with the development of complete heart block. So I hope there was no ECG given here. Even if it was, I know that you would have crushed it. The number of P and R waves would not be matching. So I don't think so that this would have resulted in any kind of issues for you. Okay. Yeah, hyperventilation. Okay, that would be respiratory alkalosis only, doctor. That hereditary hemorrhagic telangiectasia, doctor, as I explained to you, would be causing a pulmonary arteriovenous malformations. So I think that can explain the development of cyanosis in the patient, but not the development of the central cyanosis component. Okay. Okay, overactivity, dopamine. Thank you. Do drop a mail at marvamedicine@gmail.com. I'll be like, in a better position to respond to 2-3 comments that you mentioned. Okay. Okay, which of the following is not considered as a major risk factor for falls in an elderly? Okay, muscle weakness, balance. Okay, balance issues, fine. Like, maybe he could mention balance issues with respect to proprioception loss in a patient. No, like if a person is having vitamin B12 deficiency, then the balance issues would be present. Yeah, core indicated sarcopenia. I'm coming to that question, beta. I'm just coming to that question here. Just want to add this word that would be related to the balance issues here. So that's perfectly fine. I mean, the hearing impair, मतलब कहाँ से सुनाई नहीं देता तो that would be relatively less ना. Old age patients would be affected. Muscle weakness or balance issues and arthritis increase the risk of falls in the patient. So more of this, I can say, English-based interpretation for this one. For next one, I could not pick up an ECG, but if it was an irregular rhythm, there can only be two possibilities: atrial fibrillation and multifocal atrial tachycardia. I mean, it's unlikely that you guys will miss that atrial flutter part. That is the sawtooth wave. So either it is like the P waves are absent or they are present, and that will help in deciding the answer. Considering that the disease is more common, when I'll obviously keep the decision much more common, sir. So atrial fibrillation, okay. So most of the people are vocal about the fact that the P waves are absent. But yeah, if you get a P wave present and you get different morphologies of the P wave, then the answer will bound to change. But agreed, like irregular rhythm, atrial fibrillation being the more common thing there. Cool, great. Refeeding syndrome would be hypophosphatemia, that when you feed a person, insulin would be also utilized, energy consumption would occur. So I mean the body is busy at the moment, so hypophosphatemia would set in the patient. Okay, so the ECG based ones, you did a good crunching for them. Next is an elderly woman with back pain. She's having elevated alkaline phosphatase, elevated PTH, low phosphate levels and normal calcium. I'll just give a quick rationale for the same. होता क्या है कि जैसे अगर किसी को विटामिन डी डेफिशिएंसी होगा, मैंने बोला कैल्शियम फॉस्फेट का हमेशा इनवर्स रिलेशन होता है. Only time you don't have a inverse relation happening is whenever vitamin D deficiency is present. So most of the time in vitamin D deficiency, initial phases में calcium will be less. This will cause the PTH values to rise, and when the PTH will rise, it will cause the calcium values to normalize. So the explanation for why calcium is normal in this condition is an increase in the PTH value. Now PTH क्या करता है? It causes phosphaturia. PTH, what it does is it causes the phosphaturia, and because of the phosphaturia component, there would be like a hypophosphatemia occurring in a patient. That is why like the phosphate part can be explained to be less in this patient. So if you look at the data, I mean, like the calcium is normal, phosphate is low, elevated. I mean, bone turnover is anyway increased. Bone turnover is always increased. So all other options are ruled out because here calcium would be high, and then I mean, the manifestations also would be totally much more slow and benign to develop. And Paget's disease will only cause disproportionate rise of serum alkaline phosphatase. So all I was thinking about was that this could be like, pseudo hypoparathyroidism, but pseudo hypoparathyroidism will have increased phosphate, just like in CKD. So the only thing that would be, okay, fine. Pseudo hypoparathyroidism is not there. One of the options that is present is patient had valvular abnormality. Okay, doc. Okay. Yeah, I'm coming to that question, doctor. That Parkinsonism wala which will not be directly related, different treatment approach. The answer to that would be dystonia, dopamine replacement wala. So I just have to move on to our different computer just to check this out. Okay, yes, waiting guys. हाँ मतलब विटामिन डी यार एडल्ट में तो जो विटामिन डी होता है वो ऑस्टियोमलेशिया ही होता है ना. द एडल्ट में जो विटामिन डी का डेफिशिएंसी होता है उसको हम ऑस्टियोमलेशिया ही तो बोलते हैं. Yeah, calcium is normal. The reason I explained now, calcium white is normal is because of the fact that the PTH will act here. Therefore, the calcium values can be in the lower limit of normal in the patient. Yes. अभी calcium low भी बोल रहे हैं. Osteomalacia was. I think that question मैंने काफी discuss किया, तो I think the options were this one only, that is secondary hyperparathyroidism with vitamin D deficiency that I've explained. Phosphate is less, वो तो समझ में आ गया ना. Phosphaturia is a function of the PTH, so that explains it. And PTH can, if you are agreeing for the fact that PTH will cause a phosphaturia, then you also agree to the fact that PTH will cause a corresponding rise in the value of calcium, and the values can be normalized also. Okay, lamotrigine is first line drug for JTCS, beta. That's always discussed now. We always discuss lamotrigine because focal seizures and JTCS दोनों में use होता है, but main answer is first in Harrison is mentioned for JTCS only. Okay, so at this moment I'll go with option number A for this question. The way it is presented, and yeah, this would be subject to debate. Okay, it's a separate option for osteomalacia. Fine, man. But still, like if I look at the primary defect in a patient, then vitamin D deficiency makes much more sense for this one. Okay. Patient with Korsakoff syndrome is likely to present with, this is that mammillary body ना, वो भूल जाता है, झूठ बोलता है, confabulation, हमेशा उसकी वाइफ गुस्सा करती रहती है कि इसको कुछ भी बोला तो मतलब इसको gaps in the memory fill कर रहा होता है. That would be antegrade amnesia with the recent memory loss in the patient. नहीं बेटा, ये this would not be Wernicke's encephalopathy ना. Korsakoff अलग से था बताया हुआ ना. Korsakoff is like where you get the person having confabulation, that is mammillary bodies present, mammillary bodies getting affected. Okay, this का मुझे options बताना जरा. I hope that the options are right for this one. Visual gaze defects with motor symptoms, or was it like a long stem question? For the next one, yes guys. Korsakoff is उसकी वाइफ गुस्सा कर रही है ना कि भाई उसको बोला सब्जी लेके आ जा, वो कहानी सुना रहा है. अच्छा, visual handling. ओके जी, हैंड आई कोऑर्डिनेशन. ओके, थोड़ा सा और हेल्प कर देना. ओके, हैंड एंड आई कोऑर्डिनेशन इन अ पेशेंट ना. ओके, हैंड आई कोऑर्डिनेशन. सो देयर वाज नो लाइक मोटर वाला ना, हैंड और आई कोऑर्डिनेशन वाला. ओके. Okay, just waiting for your options, guys. Thank you, Akshay, for waiting now. Okay, fine. If we are talking about only a hand-eye coordination, then we'll go with parietal lobe in the patient. No? So that is okay. Obviously there can be multiple things that could be coming into this: occipital lobe, temporal lobe, parietal lobe in a patient. But if these are there and the single best answer will be given, then I'll go by parietal lobe. But obviously occipital lobe plays a role and temporal lobe also plays a role. Yeah, single best would be for parietal as an answer. So answer to this is, I think, pretty okay. This is the question that somebody had commented. तो इसको देखो मैं I'll try to solve by logic कि option A, B, C ना तीनों में degeneration, neurodegeneration और जो last वाला option है उसमें there is like a neurotransmitter deficiency in a patient. So instead of like racking my brains over like what could be the possibility, I'll just go by odd man out. Like I'll go by like how you study English, you know, neurodegeneration versus like neurotransmitter deficiency. So the answer in this case would be given as option number D. No sir, Wilson disease में तो we'll use a copper chelator in a patient, ना? We'll be using a copper chelator, but for CNS we use tetrathiomolybdate in the patient. Right? So it's a neurodegenerative disorders present in all of them. Okay. Moving to the next one, I think I have the second last slide. Major contributor frailty. This is like a hot topic in a sense that most Indians, you know, because we don't exercise and we have a sedentary lifestyle and we keep on sitting for most part of the day. So we end up with development of sarcopenia. That would be a significant muscle loss present in an individual. That's primarily because of sedentary lifestyle. Best example of that is we doctors only. Okay. So coming to the last slide that I have at the moment. Patient presents with features of Cushing syndrome. Low dose dexamethasone was suppression was done already in the patient, and he said, what is the next best investigation? So when I've explained it, I've said पहले 24-hour urinary cortisol करते हैं, फिर midnight salivary cortisol करते हैं, low dose dexona करते हैं, then we check for ACTH levels in the patient. Okay, low dose नहीं होगा. But then if you look at the diagnostic algorithm, the algorithm goes like this only, that you first check the 24 urinary cortisol, then you check for midnight salivary cortisol, then low dose dexuna. And then the fourth thing that I write is always ACTH levels in the patient. That ACTH levels will be like helping in identifying ACTH dependent and ACTH independent in a patient. So therefore in this patient, the answer would be given as option number B, that is ACTH levels. A question Parkinson disease ka tha, which was related to like, you know, what is going to be like from the physiology perspective with respect to globus pallidus activity, the direct and the indirect pathway in the patient. हाँ, डायग्नोसिस तो कंफर्म हो गया ना, लो डोज डेक्सामेथासोन करा तो मतलब कंफर्म डायग्नोसिस हो गया ना। ये जो टेस्ट होता है ये कंफर्मेशन, इट इज लाइक द टेस्ट दैट हेल्प्स इन कंफर्मेशन ऑफ डायग्नोसिस ओनली ना, या इनहिबिटरी ग्लोबस पॉलिडस, या डायग्नोसिस इज कंफर्म्ड स्पॉट ऑन. I agree to that, but then subsequently like what we do is ACTH levels to find ACTH. दो ही तो होते हैं ना, टोटल 4 होते हैं, 4 में से 2 ACTH डिपेंडेंट होता है, मतलब ACTH बड़ा होता है, 2 में कम होता है, तो उनको डिफरेंशिएट करना है. CT will help you identify only one cause ना, adrenal adenoma which is ACTH independent. एक बार जस्ट आप ऐसे करना, रिजॉल्व या रैपिड रिवीजन किसी का भी फ्लो चार्ट मेरा देख लेना, तो आपको सीक्वेंस समझ में आ जाएगी. Okay guys, so these are the questions that I have at the moment in front of you. फर्स्ट गेट पिट्यूटरी. नो सर जी पिट्यूटरी नहीं करते ना, ये तो बताया आपको कि अगर आप देखोगे डिस्कशन तो देखो तो सही फ्लो चार्ट को भाई, एक बार सिर्फ आप रिजॉल्व का या मेन वाला फ्लो चार्ट तो जस्ट एक नजर मारोगे आपको रियलाइज हो जाएगा. यस, इट स्टार्ट्स विद ACTH ओनली. सो फाइन गाइस, डॉक आपका ना बड़े चैट फास्ट चलेगी ऊपर, तो मुझे एक बारी प्लीज मेल कर देना एट, मैं फोटो ले लेता हूँ यार, तो दिस इज गोइंग अप वेरी फास्ट. मेरा ईमेल है marvamedicine@gmail.com. तो जिन्होंने शायद 2 बार ही कमेंट किया और उनका मैं पढ़ नहीं पाया, तो प्लीज जरा मेंशन कर देना. ओके गाइस, सो आई थिंक वी आर सॉर्टेड फॉर टुडे. थैंक यू सो मच. एंड बाकी जो मेन मतलब रिकॉल का जो इसका जो रिफाइंड वर्जन होगा, दैट विल बी पोस्टेड इन द ऐप सब्सिक्वेंटली फॉर अ डिस्कशन. ओके गाइस, scleroderma, malar brush option. Okay, I discussed 21 slides now, so I discussed 21 at the moment. Okay guys, fine. So thank you so much for joining with us, and I think Akshat, you can take over from me at the moment.